A warm welcome, everyone. It's heartening to see a house full of audience on a Saturday afternoon in Solapur trying to understand and decipher artificial intelligence. We're really heading in the right direction as medical professionals, as a community. Can I have a... Okay, so while we are getting ready and as auspicious as it can be to have a technical glitch at the start of a technology meeting, trust me, it's very auspicious. We've always faced this. Let's try to understand the feel of the house, okay? So all of us sitting here, we are using a smartphone, right? Is there anybody in the house who's not using a smartphone? Great. All of us in this house used some kind of AI tool for some work or the other. Can I have a raise of hands? How many of us have used an AI tool? All of us. So we actually have a AI-friendly audience. Doctors who are using artificial intelligence. Waiting for my slides. All right, so we are back on track. So where I was is, do we all have a mobile phone that has a QR scanner with us, right? So kindly keep the QR scanner ready because we'll be using this in the next 15-20 minutes to start getting a little more fancy with technology. So over the next 20 minutes to 25 minutes, I will try to give you all a basic understanding and deciphering of artificial intelligence. We strongly believe in Doctor's AI that as clinicians of the present and of the future, we need to understand these technology jargons while we are deciphering the intersection of artificial intelligence, technology, and medicine. I am Dr. Amit Kumar De. I've been working as a diabetologist for the last 15 years from the city of Joy, Kolkata. I'm excited to be here. A big thank you wholeheartedly on behalf of Doctor's AI Education and Research Foundation to our esteemed Dean Council member of the Indian College of AI in Medicine, Dr. Gurunath sir, for creating this history. What I see here is actually history being built. And a big thank you to the Association of Physicians of Solapur and the Cardiology Society of Solapur for collaborating on this midterm summit with Doctors AI. So keep the QR scanner ready. Let's get interactive right from the very beginning. Okay, can we all have this QR scanned quickly? I hope you are all able to see the screen. It's not going to be a quiz. It's going to be just the voice of the house, okay? We'll try and see what we think. We all got the QR? Right, keep it open on your browser, whatever browser you're using, Google Chrome or anything else, just keep it open on there, right? We'll have some discussions. Okay, let's move ahead. So, going forward, we're going to divide the session in 4 halves, and in the first half, I'm going to give you a little understanding of the basic definitions and terms. So today, throughout the entire workshop that will be conducted in different rooms, you will be hearing a lot of these terms in a repeated manner. Artificial intelligence, machine learning, deep learning. You will be using a lot of the tools right on your mobile phone or on your laptop, ChatGPT, Claude, Notebook LM. So let's understand these terminologies so that it gets a little easier for us when the faculties are interacting with us. We'll try to ask this important question that why are we needing to use artificial intelligence in healthcare? Is it only because to make our life easier by using a Notebook LM or a ChatGPT, or is there something more than that? And a very important question that we've been trying to solve on behalf of the organization is, how can we have a structured AI literacy and capacity building for clinicians in a structured manner? Okay, let's see if this comes on your screen. Yep, it does. And this should come on your mobile phone now as well. Right? You got it? You missed the QR code, madam? Let me see if I can give you the QR code. I have to go back to give you the QR code. Yeah, here is the QR code again. Did we all get it now? Okay. And let's see if we are able to share our thoughts here. In one word or phrase, what does artificial intelligence mean to you? Okay, let's have a word cloud. Can we have everybody typing in something? You have this on your screen, I believe. Fast forward, helpful, convenience. What else? I'm looking for some more words. Okay, Gemini, Claude is already out there. ChatGPT is already out there. Human-like. Otherworldly, that's a new term. Knowledge, accuracy, that's a very important term. Intelligent, blessing, wow, that's nice. Okay, anybody wants to play a devil's advocate in this with some strong words? Quick, efficiency, bias, interesting. Easy, cost saving, early diagnosis, one-click solution. Okay, something else doing work. Solution to all problems. Great. So we have a lot of phrases. Angeline ma'am, interesting? Yes. It's the human flow of thought, what we are looking at artificial intelligence as. How do we define artificial intelligence? I can see a lot of words being floated in, but one word is sticking out as helpful. Helpful. I can see that that's usually in a larger font, which means that many of you are typing that and feeling it. That is there, right? Assistant, I can see the word assistant being also there. Speed is also there. Knowledge is there, so yes. Okay, I can see some very nice words coming up. Okay, let's move on. So what is artificial intelligence, dear friends? Let's try to understand this once and for all. Let's try to decipher this. Okay, scary. Okay, I'm going to go on to the next slide now. Now, this is something what we defined AI as. We try to explain this. So what artificial intelligence means is this pyramid. You're looking at the world with numbers and strings, right? So that's data. When you make an analysis of the data, you're adding an information to it. And when that information is being contextualized, that is knowledge. What we are doing and acting on it is our wisdom. So the example is on your left, right? So if I give you a number of 7, it makes no meaning, right? So it's just a number. It's a number, or it's a string, or it's a word, or a phrase. But when I tell you that hemoglobin is 7, I'm trying to give you an information that a hemoglobin of a patient is 7. This is exactly the way human mind is thinking. Now I'm giving you a context to this hemoglobin of 7. I'm saying in the emergency department of your hospital, there's a road traffic accident, who has come and his hemoglobin or her hemoglobin is 7. That is knowledge. What we're going to do to this patient. What would you do, sir? Dr. Rajesh, क्या देना है इसको? क्या करना है? Blood transfusion, right? So hemoglobin of 7, road traffic accident, will give blood transfusion. That is wisdom. So this is human knowledge. This is human data, information, knowledge, and the action point is wisdom. We are training neural networks. We are training machines to think just the same way. That is artificial intelligence. I think this could be the simplest way of understanding in medical context what artificial intelligence is. Now you would ask me that, is this something very new? Well, no. Artificial intelligence has been there for ages. It started in the year 1950 where this gentleman called Alan Turing created a test called Turing test to prove that a user and an AI ecosystem can actually be masked. So that was the Turing test. You can read up on that in Google. John McCarthy coined the term of artificial intelligence in the year 1957 in the Dartmouth conference. And since then, there's been a lot of evolution of AI happening with the invent of machine learning, deep learning. There's been a waxing and waning happening, but mostly this has been happening in the field of research, in the field of academics, and people have not been talking much about it. But then why did we start talking about it? Because in the year 2022, AI suddenly came into the public domain as ChatGPT or OpenAI. And then some of the nerds like us started thinking, hey, this could really change the way we are looking at medicine, right? And that's how today we have a house full of audience on a Saturday afternoon trying to understand this technology. It's around us. Artificial intelligence is all around us. We are using AI for convenience. On the left, we are now looking at using AI for our medical and clinical utility. And this is the real power of AI. While today, throughout the entire session and tomorrow, you will be having a lot of discussions on the lower hanging fruits of using AI to improve your productivity and creativity, there's a larger to this picture that AI can actually be used when it can convert the data to information, to knowledge, to wisdom. And that is the true essence of artificial intelligence. When we talk of so much of power in the technology, we need to have the guardrails, right? And these guardrails need to be put. The FDA has been putting in the guardrails. The CDESCO in our country has been putting in the guardrails. And this is an ever-evolving domain of setting the guardrails of how it should be used. safely, to do no harm. That's the whole principle of medicine. That's what we've been taught, to do no harm. So if we are building or co-building artificial intelligence, the first thing that we need to ensure is that it is doing no harm to the patient. Now let's get back to the basics. So let's quickly revise some of the terminologies. I have a gut feeling that I'm really talking to an AI literate audience, and this is going to be simple bread and butter for you, but to still some of them may be sitting at one corner trying to understand that what this really means. Let's quickly understand these terminologies. So the entire ecosystem is called artificial intelligence. A segment of artificial intelligence is where we are training a machine to pick up a data, make an information out of it, understand a pattern out of it, and then give a recommendation to simplify a task that we are doing. That is machine learning in simplest terms. When the machine is learning through numbers and strings, it's machine learning. When it gets a little bit more complex, where it starts learning through a neural network, like the neural networks of our brain, it is called deep learning. Machine learning has got three types: supervised, unsupervised, and reinforcement learning, which I'll just come to you. But if I have to give you a quick understanding, a part of machine learning is deep learning, and a part of deep learning is where your ChatGPT, Claude, Perplexity fits in. That's generative artificial intelligence. Now, as I said, AI has not been new, and the evolution has been happening for over decades now. It was an expert system, rule-based, case-based reasoning. From there, we have evolved into pattern recognition and machine learning. Now, this pattern recognition is also kind of the way we humans are recognizing patterns, right? So imagine a hospital ecosystem where you have your PGTs or your postgraduate trainees, and you're hand-holding them to learn. So you're supervising what they're learning and how they're acting to that knowledge. That is, dear friends, supervised learning. Now imagine that intern in the hospital who's jumping from one department to the other department every month or every 3 months. He doesn't really have a guide to help him, but he's learning kind of on his own, but he's still learning. That is unsupervised learning. And reinforcement learning is what we are all doing in our lives, learning from mistakes. The concept of reinforcement learning is used in gamification, and this is very, very important in the field of healthcare because we want AI to evolve with iterative learning and refinement, and that's where reinforcement learning comes in. So machine learning is used in big data visualization, in targeted marketing, in structured discovery of drugs. Supervised learning is used as an advanced statistics in classification and regression models, which are being used strongly these days, and we could see some paper presentations early in the morning today that was using these models. Now, when the same machine learning happens through a layer of network where there's an input, there's a multiple hidden layers through which the informations are getting transmitted simultaneously in a fraction of a second through multiple layers, through nodes, internodes, like the sensory nerves of our brain, and then it is giving an output that is called deep learning, which means if I train it with an image of a dog, it can predict that this is a dog. If I train it with an image of a cat, it can predict that it's a cat. Now imagine doing the same thing with a set of X-rays, with a set of retinal images, with a set of ECGs, which Dr. Gurunath sir has been doing excellently in his career, and with his team here. You are teaching machine to pick up the neural patterns and predict something. And by this, it can possibly predict something that the human eye have been missing. So now, where's the fun in that, right? There's no fun in that. The fun is in here, in creating content, in generative AI. So generative AI came into existence in the year 2022 in the public domain, where you have the entire neural architecture being able to create and generate content. So exactly how does that happen? You give in the content, you give in the context through the text, image, speech, audio inputs, sometimes through an entire instruction, which is also called as prompting. And then it undergoes the processing inside something called a transformer architecture. These transformer architecture are trained on trillions and billions of parameters on the Internet of Things, and then it gives an output to us. And that's how your ChatGPT, your Claude, your Gemini is responding. But the fantastic part of this technology is, while the computer is all talking in its own sense and own binary code, it's all coming to us in our own language, right? Especially it can come in Marathi, it can come in Bengali to me, it can come in English to us. How is that happening? That is happening with the help of this technology, which overlaps AI, and that is called NLP, or Natural Language Processing. Which means when I'm speaking to an AI ecosystem in my language, it's coding binary 010110, but it's again giving back the response to me in my language. And that's how ChatGPT has become a good friend to us. All right, let's see if we can have another word cloud. Which AI tool do you use the most for your daily activities? Let's get this quick. ChatGPT, all right, Gemini. So now our faculties know what to teach. ChatGPT, Gemini, okay. What else? Oracle, okay. Claude, Copilot. All right, so we had a lot of hands raised. Let's see. So we're having mostly use of ChatGPT, Grok, Canva AI, very interesting. Okay, what else? Perplexity is there. Kimi, Quen, okay, these are some names which I'm also hearing for the first time. Wonderful. Notebook LM, finally it's out there. Yes, some of us use a lot of Notebook LMs. You'll be taught throughout the workshops how to use effectively Notebook LM. Notion, okay, great. Meta AI, that's on your WhatsApp. That's what you've been using. Gemini Pro. So we are all using these language models. Let's try to learn how to use it effectively. But as I said, beyond all this, there's much more that we can do. So one is, at one end there is traditional AI, right? So it predicts, it classifies by machine learning. And the other end is this advanced generative AI that we are all going to be learning today as advanced AI, which can create and generate new content. It can draft your discharge summaries, your research papers, it can translate. Some of the terms that all of us need to get familiar with, as we say, we need to be bilingual. What is a training data? What is a model? What is hallucination? What do we mean by bias? Somebody wrote there in the beginning, bias. What is a prompt? What is an instruction being given? What do you mean by having an explainable model? What is a model drift and a model shift? And what do we mean by we need to be the human in the loop? Let's all try to find out the answer to these questions. I'm not going to give you the explanations now. You will find out over the next 2 days. But then you will all be asking, where do I really fit into this entire ecosystem in this complex technology world? I'm a clinician, I see 50 patients, 100 patients a day. Mera isme kya kaam hai, right? So there is data. The data will have a training. A model will be created. Some user is going to use it with a prompt. Somebody is going to verify it, the output. And that's where the clinician and the human in the loop is going to fit in. So this is the AI ecosystem. That's how we'll fit in the ecosystem of a clinician. Now, as language models are evolving, we are also looking at newer AI technologies evolving, and that is agents and agentic architecture. A quick difference between agents and agentic architecture is here on your screen. But if I have to give you a simplistic way of understanding agent and AI, agentic architecture, it's this. So agents are like a simple instruction following tool which is trained to do one particular tool. Now when you connect multiple agents on one architecture, orchestrating with each other, it is going to function complex multi-step tasks together, and that is known as agentic AI. So don't confuse these terms. Generative AI creates the content, agentic AI plans and executes, agents in the agentic AI architecture performs the action. Right, so a little bit with the fundamentals. This is the link to our book. I will give you the QR code. You can scan this, keep it with you. This gets you started with artificial intelligence. And we keep on bringing up newer articles and newer books through our organization. This is the fundamentals. There's also another book which gives you an overview of AI in medicine. On all the faculties that we have here today have been authors in this textbook. And you can also grab a copy of this particular book. We'll give out the links later as well. So even if you don't grab it now, there's not a problem. Okay, quickly, third part of my talk. Let's see if you are able to give me a little bit of word cloud here. Which application of AI in healthcare excites you the most? Now this could be very diverse. We are looking at a target audience. All of you are different specialities. You must have looked at many applications of AI in healthcare while you were here, or you had been to the stalls, or you have been exploring the AI field. So I'm not talking about language model. Try to think of an AI tool that you've come in touch with or you feel that can really make an impact in your practice. That's the best answer, no idea. That's exactly why you're here, right? So that's good. Differential diagnosis tool, somebody wants tools. So now you're getting a cue, what people want. People want tools for differential diagnosis, X-ray interpretation, imaging. All right. Ready my case. Somebody's saying lovable. So we have some people who've been using a lot of pro advanced tools, as I can see. Gemini, Perplexity, Claude is again most of the common language models. So these are good cues for our faculties who will be teaching after this to understand, where the house is going. Okay, let's shift gear and now move quickly into the third and the fourth part. So why artificial intelligence in healthcare? Folks, think about this. It's not only ChatGPT and Gemini, right? Why AI? This gentleman thinks that we have been moving from a period where for the first time we may be encountering things which are more intelligent than us. Eric Topol, who is often known as the father of AI in medicine, he speaks about patients wants to be more autonomous, and we have agentic autonomous architecture to help that. So we have the technology. Can we really stay away from it? But then why are we talking about AI in healthcare? So what we've been doing in our conferences every weekend is talk about the standards of care. Now we are looking at data giving information to knowledge to wisdom, which is going to take the care into more precision way to above the standards of care. So that's number one, why. Drug discovery will get augmented because protein folding and unfolding has become much easier with the help of Google AlphaFold. That's true. So we are looking at faster drug trials, lesser cheaper drugs coming out in the market. This is something which I want everybody to look at, and this is one of the hypotheses we've been saying, that all the research that we've been looking at has been largely a top-down approach. We've been looking at systematic reviews, meta-analysis, we've been looking at clinical trials, but we've been missing out on the entire chunk of data that can give us a complete different meaning. So we are now looking at a bottoms-up approach. We are looking at a more federated architecture approach where the data will contribute to the research and not a controlled clinical trial. The gap is going to be moving very, very fast from precision medicine into population health, and this gap is doubling time. Medical literature doubling time is increasing, and that's one of the reasons, which is why. This is one of the most important why. Our mind is trained to see what our eye sees the most. We keep on thinking only at the commonest diagnosis, and that often leads to cognitive bias. This AI might be a neutralization to our cognitive bias when it is incorporated into a clinical decision support system. So in a nutshell, we've been practicing evidence-based medicine. Let's use artificial intelligence not only to improve our creativity, but also to practice data-driven intelligence-based medicine. The data will come from structured data, and that will now go into the entire ecosystem of the neural networks, into the machine learning algorithm. Through input, it will be analyzed, and then we are going to get the output. A quick word play now. Okay, this is a poll. What role should AI ideally play in healthcare? Should it fully automate specific medical tasks, assist clinicians in clinical decision making, enhance patient engagement? Okay, there's no right answer, all are correct. Let's see what's the opinion of the house. This is just a house opinion. Okay, nobody wants fully automation. The technology exists. Agentic architecture is there to fully automate. Think about it. Be creative. Put your thinking caps on as you walk through this entire, 2 days of conference. Okay, now suddenly people are getting biased because I said about it. That's how influential it can be, right? How tricky the human mind is. Imagine how AI can be. Okay, so of course we all agree that it can assist clinicians in decision making. That's what we're here for. Yes, and we now need to move from that wow factor to that how factor, understanding how it can make a difference. I wish to introduce you to Doctors AI. The Indian College of AI in Medicine is the academic wing of Doctors AI, and we'll invite all of you to be a part of the organization. It's a place where we learn from each other. There's no teaching happening. We all learn together. We all learn from each other. Can AI replace physicians? How many of us think AI can replace physicians? How many of us think AI will never replace physicians? All of us think that. Do anybody know who this gentleman is? Any guess? Any guess from the house? Look what he told in 2025, published in Times of India. We have AGI, and we are heading into AGI. Claude is going to develop AGI, and this might automate and replace us. This is Demis Hassabis, who is the CEO of Google DeepMind. So, what do you think is your biggest concern about AI potentially replacing human physicians? This was a poll we had taken. We can build up on this poll. What do you think? Is it loss of human empathy in care, over-reliance on AI's accuracy, ethical and accountability, misunderstanding of AI's capabilities by patients? So folks, what do we need? We need AI, but that's not artificial intelligence. We need augmented intelligence, human plus artificial intelligence. But then, where do we start? We start right here, through a primer. We start right here, through this conference. Because in today's world, we all need to be bilingual. We need to speak this technology jargon as much as we speak the medical jargon. We start with a pyramid, is what we propose in Doctors AI, have a basic AI skill, develop a proficient learning, and then some of us might want to become an expert in AI. It starts with the foundation knowledge that you all have now. Now start exploring, sky is the limit, get engaged, co-building with tech developers, get some hands-on training, and engage in research with AI. That's the true potential of AI. In Doctors AI, over the last 2 years, we've been doing a lot of work through primers, through workshops, through certification program. We are now building the Doctors Academy for hands-on learning for doctors. Primers has been one of the core point of Doctors AI, and these are some of the snapshot. Yesterday, Dr. Kulkarni and myself, we were in AIIMS Nagpur conducting a primer, and look at the faces of the curious clinicians attending it. We've always been focused towards validation and keeping the clinicians in the loop. We keep on doing a lot of activities in the organizations. As you get engaged with the organizations led by Dr. Gurunath sir, you will find a lot of activities happening. Academic collaboration has been our key. We have collaborations across the country. One of a very, I would say, an important collaboration for the state of Maharashtra is with Chakra, which is led by Dr. Aslesha, Dr. Kulkarni sir, where we will be conducting primers across the state of Maharashtra in various medical colleges. The core principle has been adoption of responsible AI, and we are functioning under 4 pillars: education, to research, to validation, and then the clinician community evolves. We've been part of many stakeholder meetings held by the Government of India. We're conducting our AI certification program. Some of you might be interested to join that. You will find all the details on our website. This is how AI certified and AI literate clinicians looks like. This is how AI curious clinicians looks like. By the end of the 2 days meeting, we're all going to become AI literate. So I'll leave you with this thought, friends. Let's use AI to see what we have actually been missing. It's not only to use for ChatGPT for fun, but to actually really help us become smarter clinicians, take the right care to the right patient at the right point of time. Thank you very much. I'll leave you all with this. We'll invite you all to be a part of the Doctors AI, the Indian College of AI in Medicine, and I officially invite you all to please join us in the Doctors AI Global Summit. This is the midterm event. We'll invite you all to join us in the Doctors AI Global Summit on 19th and 20th of September in New Delhi this year. Thank you so much.
Thank you so much, sir, for this insightful lecture. Any questions from the chairpersons?
First of all, we could not welcome you all because it was a technological glitch. So welcome to all of you. The very fact this hall is full on a Saturday afternoon and after a 50-course meal, it appears you're all curious about AI.
Yes.
Once you get curious, you will move to the next stage, which is your capability, and finally you will choose responsibility also. So to make things more curious, Dr. Amit and team will help you. To make you more capable, again he and his team is going to help you with various programs. And responsibility, the moment you're capable, you will go looking for responsibility yourself, and again our team is there to support you in this journey.
The theme of the conference is From Stethoscope to Algorithm. As Robert Pearl says that AI will be as common in healthcare as the stethoscope. Sir has given a good theme, and above all, as Sir says, Eric Topels, the greatest opportunity offered by AI is not in reducing errors or even curing cancer. It is the opportunity to restore the precious and time-honored correction and trust between patients and doctors. After all, today we came to know one new word, Digital Personal Data Protection Act. Above all, AI gives us a leverage, ethics gives us direction. The purpose of AI is to amplify human ingenuity, not replace it. After all, the question is the world a better place or worse place with artificial intelligence? Thank you.
Thank you so much, sir. I request the chairpersons to please felicitate Dr. Day. Dr. Day, can you please come on the stage? Can we have a huge round of applause for the wonderful lecture by sir? I request Dr. Zambre sir to please come on stage to felicitate the chairpersons, please.
So Professor Dr. Sriram Kulkarni is currently Professor on HOD of Medicine at MGM Medical College, Navi Mumbai, and the founder Dean of the Indian College of Artificial Intelligence in Medicine. With 40 years of in clinical practice, in clinical medical education and healthcare administration, he is a gold medalist in both MBBS and MD from GMC Meerut. From being a clinical director at the Khargar Diabetes Heart and Childcare Center to the past president of Maharashtra Association of Physicians, he exemplifies from stethoscope to algorithm, showing how AI can augment, not replace, clinical intelligence. So please join hands in welcoming Dr. S.V. Kulkarni as he speaks on real-world applications of AI in healthcare.
Thank you. It's a real homecoming for me. It's a family affair. And I can see so many of my younger brothers here. And after our founder has given you a gross overview of AI, what I'm going to talk to you is very practical applications. It is like a rapid fire, AK-47. And we have got 2 days now to discuss with the individual applications which we are having. First of all, I appreciate the efforts of Indian College of Artificial Intelligence, API, Solapur, Dr. Parade and all his group. And it's very rare to see such a big hall full on an afternoon for a topic which is quite unusual. Friends, I am not an outsider. I studied in Dayanand College. Some of my classmates are also there, and I hail from Tulzapur. Yatin and everybody, we are knowing it for years, and this is our family relations. I'm going to share with you a story of 52 years. 1974 to 2026. What made me to get attracted towards technology? Previously, it was something very simple, a small card. Then it used to store the addresses. Then you got small handles. Amit told you everything about the history, but do you recall this event? On 11th May 1997, the IBM supercomputer Deep Blue defeated the reigning world-class champion Gary Kasparov. And he was not one time, he was a 2-time champion. So that time there people felt that there may be something in the computers, there may be something which is going to at least match with our intelligence. Everybody has got Netflix, everybody has got ChatGPT. Netflix took 1300 days to cross 10 lakh users. ChatGPT only 1 or less than that. And we have learned our technology like this only. Manachi party hoti, calculator hote, then all the computers came. If you recall, when the computers were introduced in banks, there was a strike. The computers were called as the job-eating machines. And now you can, I don't know how many of you have seen the bank. So friends, I'm just going to quickly analyze what Dr. Amit has told you. It is a support system, not a replacement for doctors. So it analyzes rapid processing of massive medical data set beyond a human cognitive limit. तुमच्याकडे टाटा मेमोरियल हॉस्पिटलची एवढी जरी मोठी फाईल असेल, you put it into PDF, feed it to a good engine, it will give you 2 pages good output. I can demonstrate you bring that PDF of 200 pages. Then support. It is the driving evidence-based care across the diagnosis, treatment and clinical research. We are having good number of patients, but we fare very bad in research. I am very happy that Dr. Parade has got so many records preserved right from his beginning of practice. And it is an enhancer. It is an enhancer, it streamlines healthcare administration, boosting the systematic efficiency of your institute. आपण सगळ्यांचे हॉस्पिटल्स आहेत, कोणाचे 5 बेडचे, 10 बेडचे, 20 बेडचे, 50 बेडचे. आपली एफिशियन्सी कशी वाढवायची, दॅट AI will help you. So look at the traditional approach and look at the AI augmented approach. Diagnostic speed, symptom case-based discussion. Here there is an earlier detection and predictive ICU alerts. I will give some examples. Treatment strategy, standardized broad spectrum pattern. Here you are having a precision medicine integrating genetics and biomarkers. Yesterday me and Amit were in Nagpur. He talked about sensors, I talked about the precision medicine, how it is going to change. The workflow and administration can be done fantastically. It automated summaries, coding and scheduling. Patient monitoring. 3 महिन्यानंतर या दाखवायला 100 दिवसाची दोस्ती डायबिटिक पेशंटला. No, you can monitor the patient in any way. Continuous tracking via connected variables. Right now, I am wearing a glucose sensor. I have got a smartwatch. My family can track how many steps I have walked and what calories I have consumed. Just a simple example. You are treating, you are physicians, pediatricians. You go to ChatGPT and request ChatGPT to download on their, can you give a prompt making adolescent care smarter by the use of ChatGPT. So it is a tool which communicates in a better way. It gives a structured output, saves times, it is educating, efficiency is very big. So in this chart, if you put this chart in your OPD, many patients will bring their teenager children for evaluation. And I have not put a simple word into that. I just asked them to do the charting. It explains conditions like PCOS, obesity, or even something like anxiety, phobia, diet needs, and calorie count. So let us start from our first MBBS. How AI is going to change the life of a medical doctor. Forget the cadavers, no smelly anatomy things. You will be having a real anatomage, that is this is called as a head mount unit, and you can see all the arteries, nerves, everything. It's a 3-in-1. It is anatomy, physiology and biochemistry. Put the camera on liver, it will tell you the Krebs cycle. Put it on the brain, it will show you the tracks and everything. So these are the virtual anatomy dissection things. In pathology, this is not Harvard or Stanford. Here I can see the RBCs of the size of a lemon or a apple, but this is my niece from Solapur. She is practicing a telepathology and onco-telepathology. This is all possible and it has been evolved in a very, very significant way. There is an app called as a HistoViz. Everybody should ask your pathologist to have it. And what it tells you, as a physician, you must have seen an X-ray coming with cannonballs. So you don't know. It tells you either the malignant or benign, what is the site of origin, what are the driver mutations, what are the structural genomic changes, what is the response to therapy, and even what is the prognosis. So pathology has advanced very significantly. Microfluidics in biochemistry is the key and it is the future of biotechnology. You don't require massive reagents, you don't require massive amount of blood sample. It just goes through a lateral flow and then you have got a QR code. You may be having a plain paper, on that you put a drop of blood of a patient who is breathless. You get an image, scan that QR code, send it to the lab. It will tell you within 1 minute how much is the NT-proBNP of that patient. It is as simple as that. These are the different types. The pathology has gone to such a microscopic level that not only it will analyze the nucleic acids or protein, but it can go to the ionic level, like an MRI related to a particular ion. Suppose if you have got a case of hyperparathyroidism and you want only a MRI related to calcium and parathyroid, it is possible. No needle pricks, no vacutainers or gel codes. You will get a thing like a pulse oximeter. It will suck that amount of blood. There will be a lateral flow technique. And not only that, there are going to be many, many things like enhancement, classification, segmentation, and it will give a good appropriate data set according to the syndromic approach. The same breathless patient, if he has got a NT-proBNP, with an algorithm system, it will do a CPK-MB, it will do a myoglobin, it will give the top T or top I also to tell whether it is a ischemic event or not. Suppose if you go on to do a search on a very genomic level, our friend Dr. Tanej has done a wonderful work on fatty liver, metabolically associated. But if you want to point out at genomic level, this AI tool is going to help you. Drug discovery is a very, very complex process. It was said that 10 years you need to have 2 drugs. But now the thing has been very, very fast, and it accelerates the drug delivery and development process. Not only that, it predicts that suppose if you have got an antibiotic which will be helping in gram positive, which will be in gram negative, which will help you in gram or a anaerobic. So this is a company called as AlphaFold. They are protein specialists. You give them the receptor and then they will give the proper answer for it. It reduces the cost, time associated with traditional drug development, and it not only that, it understands the mechanism. So if one particular molecule fails, the cis form of that will work. If the cis form fails, the trans form of it definitely work. What it gives you? Personalized medicine. A malignancy patient will never lose a single hair. He will not have stomatitis. It will be targeted drug delivery system which is going to help for that particular tissue only. So these are the different types of organization. It's called as a Tempus Lab, Recursion Pharma. There is a separate department of rare diseases. We don't know. The central government of India has got a department of rare disease, and the children suffering from rare disease get a very special grant of it. You can have deep genomics, another called as benevolent AI. And there are certain molecules which are being developed as not only anti-aging medicine, but aging halters. So this is something really very exciting. There are a lot of people from our doctors AI who are doing pharmacology in that. So this is a company called as the Recursion. It analyzes 10-15,000 molecules and then tells you that this is the place where there is an opportunity for you to develop it more. Clinical trials can be very more fascinating. It identifies the people by the phenotype and by the height, weight, body mass index. Suppose if you are doing a patient drug trial of anti-obesity drug, then it will give the right type of people whom you are going to help out. So the real world data analysis, evidence from the safety, effectiveness, live dashboards, it is all possible. We do a lot of drug trials, and I can see on the screen how many people have come for the visit or not. So this is something called as a treatment optimization. आपल्याकडे patient पोतं घेऊन येतात औषधाचं, bag भरलेली. So you have to reduce the number of tablets. This is called as a concept of pill reduction that is possible with the different AI techniques. So if you are a teacher, if you are a technology inclined practitioner, then these are some of the things. Emboss, Osmosis. Lecturio is a very good app. Lecturio. You can prepare a topic, you can prepare a chapter, you can prepare slides, you can prepare handouts with that. The very authentic and scholastic thing. So let us come down from the research and pathology, pharmacology to a human being. So we are surrounded by sensors and watched by connected patient, and you as a connected patient, so you are a huge generator of data. So what you do, start with your TPR mapping. If I will give you a pulse oximeter which gives you pulse respiration and something called as a perfusion index which will go to the EHR, it will reduce your job like anything. Height weight ratio, obsolete. Do a body composition analysis, the body composition analysis go to EHR and then it combine and then it compares the first, second, third reading, which is going to be very useful for a person. It's a very motivator for a person to lose weight. This is a stethoscope which magnifies the voice, your heart sound for 17 times. Everybody was getting deaf, either because of the age, because of the ambient sound, and the most important, mobile. So as you age, your hearing capacity is going to go down. So you can have that, and Dr. Parade will be here with the earphone, and the patient in the hospital, the stetho is on the chest, and he will be in a position to assess whether the patient is in what is the murmur or what is the congestive cardiac failure state. There is a BP apparatus without tube, without bulb. You can move around, you can use as a stress test, and the BP is get taken on the directly on your smartphone, and it gives like CGMS. It will be ambulatory BP apparatus. This is the CGMS, which gives like a 24 hours by 14 days blood glucose. It likes a detective in your body. आता दुपारी सगळं काय काय खायला घातलं, उपमा आणि भाकरी वगैरे, देर इज अ सडन सर्ज ऑफ शुगर. शेंगदाणे खाल्ले की अजून 200ची 350 होते शुगर. बट इट टेल्स यू व्हॉट fruit, your drug you should avoid, and what food you should not avoid. That is a good idea for you. Where is the X-ray machine? Where is the X-ray department? It is all gone. It is all in your mobile, and it is also there outside in the corridor. There is a stall. You please visit that stall, and you will get good amount of portable X-rays immediately within the minutes of taking it. Can you diagnose malignancy in a proper way? Yes. We had a wonderful paper today morning where the person described, and it will give AI. Okay, to diagnose a solid nodule, hematoma or some other thing, but malignancy, but can you diagnose diabetes from X-ray? Yes. This is the analysis of almost 156,000 X-rays, and they analyze the mediastinal fat disposition, and it gives you diagnosis of X-ray diabetes from the chest X-ray. These are the various AI tools which are going to help you to detect CA breast as earlier possible. So from that, let us enter into your eye. Eye is supposed to be the mirror of your body, and you can diagnose various stages of nephropathy, and these are the AI enhanced retinopathy, and these are the AI enhanced images. And when there is this person, you will definitely have a urinary microalbumin of more than 400, because kidney and eye, they go in parallel. It can even detect heart failure, it can detect so many cardiac events, and this may look like an exaggeration to you, but there are 385 diseases which can be picked up by fundoscopy, including Alzheimer's. I am not talking in air. There are the references. You can go, you can see the articles, and you will be convinced what. So there are lot of things in AI in super specialties like cardiology, nephrology, neurology. Early diagnosis of Alzheimer's disease is one of the very strong subject going on. There are many multimodular gadgets. There can be a ring, there can be a wristwatch. Google has come out with a strap now that costs around 10,000 rupees, but it is much better transmitter of your and analyzer of your health. This is a small putty-like thing. It doesn't require any jelly cable or machine. You get a 6-lead ECG. And outside all, we have got a patented product of Dr. Parade, that one of the first thing, and I'm really proud of it, that we have got an organization, we have got patent holders. The ECG can give you so much of idea about systemic diseases, like right from age and sex to hemoglobin to a prediction of a horrible condition called as a peripartum cardiomyopathy. Those who are in gynec, those who have seen the patient getting breathless on the 4th or 5th days, they know the seriousness of this situation. It can. Can mammography diagnose ISD? Yes, it can possibly diagnose ISD because it checks the calcium score. This is called as a augmented reality or virtual reality. It is a boon for the patients who are recovering from neurological and different kind of stressful situations, occupational therapy, rehabilitation. These are the examples: simulators for vertigo, simulators for hypoglycemia, and forget the word plagia. Neurologists don't utter a word monoplegia, paraplegia, quadriplegia. You are going to have exoskeletons, and they are very good exoskeletons. Dr. Aslesha is from military background, and she has seen so many patients, so many young people, our soldiers, lying hemiplegic, paraplegic. They can play football with this kind of things. So let us go to computer vision. मेडिकल कॉलेजमध्ये जे लोक आहेत ते सकाळी पंच करतात, डोळे मारतात स्वतःला. Okay, that is the detection of your own body. But suppose if you have got a OPD where there are people who are likely to create problem, can you predict violence? There is an app called as the Pushpak AI. So what it tells you, high security related areas of our country, odd belongings. हातात काठी आहे, क्रिकेटची बॅट आहे, हॉकी खेळायला का तुमच्याशी तो गरबा खेळायला आलेला नाही, तुमची केबिनच फोडायला आलेला आहे. Okay, so not only that, you can identify the patients who are negative, anxiety, not satisfied, even argumentative, abusive and violent. आपल्या सगळ्यांच्या उपड्या भरपूर असतात, आपल्याकडे एक ग्रुप आहे पेशंटचा, काहीच फरक नाही म्हणतात सारखं, काही जरी झालं काहीच फरक नाही, एवढी मोठमोठी फाईल घेऊन आलेले असतात. ते KFN पेशंट पहिल्यांदा उचलायचं, त्याला KFN, सो ते KFN आणि फाईलवर वर लिहून ठेवायचं, KFN म्हणजे सगळ्यांना लक्षात आहे. यू कॅन आयडेंटिफाय, इट इज गोइंग टू ए बून फॉर द सायकॅट्रिस्ट. So facial recognition of emotions is helpful for violence prevention. The skin, you can pick up the things, but please remember as a clinician, as a doctor, 3 things: Stevens-Johnson syndrome, toxic epidural necrolysis, pyoderma gangrenosum. Just take a picture, go to Google Lens and identify the skin lesion. If it gives the slightest idea, don't keep the patient with you. Refer this patient. They are the time bombs loaded with a death certificate to be signed. So there are many things in surgery. Robotics is going to be there. There is something unusual things which I found when I searched the literature. It can do perioperative planning, it can do intraoperative navigation, and it can be used as a educational simulation and training. These are the different systems, and they have got something unusual, automated tissue recognition, and they can give intraoperative decision support also when the anesthesia is either going up or not, or the duration of the surgery is going for a long duration. And this is a cost effective aspect of a meso-robotic surgery, good amount of reduction in the hospital time as well as the cost of the patient. Plastic and reconstruction surgery, we have got certain people in the country who can even replace your all 4 arms, both the legs and arms. All the quad limb amputations, reconstructions are possible. I have seen it with my own eyes, and this is the plastic surgery called as a Vectra 3D. This is a model which tells you what type of things fits into your thing. Cyber knife or gamma knife, there is no knife, but it is a radiation. And what is the accuracy? 0.03 millimeter. You can treat any patient with this. For the medical research, there are many good things. We have got a separate topic on that. These are the 4 important things: size, space, consensus, illicit and semantic scholar. And last one is a JENI, JENNI. It will help you for your research publication. So friends, I have told you so many things. What is the real advantage? It not only saves time, money and efforts, but the torture, trouble of travel and anxious waiting time in the consulting room, telemedicine helps you. It handles with accuracy big volumes, but take it from me, it increases your serum levels of confidence, competence, concentration and enthusiasm. And it makes you to acceptable. आता junior मस्त जरी पोरगा, आता तो 8वीतला मुलगा होता. I was just talking to him. He has got something fantastic. So it makes you to acceptable to talk with people, it really tells you that you are what you don't know. Accuracy, explainability and robustness is the key word for it. And this was one of my editorial in JAPI, which Amit told you about responsible use of AI in the clinical medicine. You go to the website of JAPI and just you will get all this article. There are 10 journals which are available, which you can ask your medical college to surprise. This is our website. You go to Doctors AI, you will find so many new things, so many different things. It is like a Coursera. If you have got 4 hours, we have got a material for 4 hours. If you have got 6 hours, we can do it. We will definitely help you. This is a very unique concept called as the medical literature doubling time. In 1955, it was 50 years. Now it is 73 days and less. So with the help of AI, you can do lot of good literature search and literature production. And suppose you have got some thought, something to think. You prepare it, present it, we will publish it. How? we have got a journal called as the International Journal of AI in Medicine. Dr. Amit Kumar De is the executive editor of the journal, and we are not charging you any fees for publishing into that. So please do join us at the event, Doctors AI Global Summit 2026. And there is another event for all my physician friends, because the API Solapur has been a very active thing for, this is MapCon 2026. If you need any further help from my side, this is my email ID and this is the mobile number. Please be in touch with. Thank you for all your patience listening and appreciate all your efforts. Coincidentally, this is the black and white photograph of our batch. This black and white photograph has been converted into color. There is an app called as a Color AI. This is my family, Dr. R.D. Lele, everybody knows, Dr. Sortur, Dr. Sanpur, Dr. G.S. Kulkarni. He is still fit at the age of 94. So thank you very much. Thanks for this opportunity.
Thank you so much, sir, for that insightful talk. I request the chairpersons to please felicitate Dr. Kulkarni.
Thank you so much. Please note all these sessions are currently being broadcasted live on YouTube as well. Moving forward, innovation flourishes when medicine and engineering work together. Our next session brings together experts from both domains to discuss collaborative opportunities and future healthcare solutions. I invite the panel comprising of Dr. Sudhanshu Gaurhar, Dr. Advait Sahasrabhojani, Dr. Siddhesh Kumar and Dr. Sachin Chaugule, please. Dr. Sudhanshu Gaurhar, Dr. Advait Sahasrabhojani, Dr. Siddhesh Kumar and Dr. Sachin Chaugule, please. And Dr. Pranav Page. It is my privilege to call upon the moderator of this session, Dr. Gurunath Parale sir, who is the Chief Organizing Secretary of this summit. Please welcome our distinguished panelists.
Just to repeat what Apte Madam has said, that all these sessions are being aired live on YouTube. Okay, so they will be available to you later, and the link will be shared later. So you can, those who are missing this workshop, or if you want to have access to these all lectures which have been really very informative, you can access them on YouTube. Okay, now this is a peculiar session that we are hosting. All the talks which you are hearing today is AI for doctors. But this cannot be completed without collaboration with engineers. So in AI, you need two persons. One is a domain expert, that is we doctors. And the second is the developers. So without these persons, Siddhesh, please join it. I'll ask all these 5 engineers sitting there to introduce themselves first. Yes, start with Advait.
Hi, I'm Advait Sahasrabhojani. I have about 12 years of experience in AI. I'm currently leading the AI Center of Excellence at MIT ADT University in Pune. Prior to this, I worked at NASA in California for 6 years in the machine learning prototyping group. This is the second time I'm working on a healthcare project. Prior to this, I've worked on a lot of space and earth science applications. Yeah, look forward to talking.
Hello, I am Sudhanshu Gaurhar and I am from IIT Jodhpur. and I am doing my research on biomedical signal processing through AI, and my main research is on ECG, how we can extract some features, some scores from ECG signal. So I have around 6 to 7 years of experience in AI.
Hello, my name is Sachin Saugule. I work with a company called Design Tech Systems. We have been developing software for hospitals and physicians for almost 30 years and working with EMR data to be stored electronically. And now we see the time has come with doctors or hospitals who have stored this EMR data for so many years to enable AI to harness the results for predictive analysis in the future. Thank you.
Hello, I am Pranav Page. I am part of a founding team of a startup in the AI space, where we are building co-pilots for manufacturing systems. Prior to this, I was also working in IoT, sensors and other things. I graduated from IT Bombay in 23, and I'm very honored to be on this panel.
Hello, myself Siddesh Thakkar. I am a graduate of IIT ISM Dhanbad in 2019. After that, I have worked in medical imaging, T and B cell lymphoma detection and Alzheimer using PET-CT and everything. After, in 2021, we have started our own company with a mission to develop point-of-care medical imaging devices in India for screening purposes. So we currently in our portfolio, we have the handheld X-ray imaging device, which you can carry it in a bag and do the X-ray anywhere. Along with it, we have the AI software, which basically screens the patient for different diseases like tuberculosis, heart disease, valvular heart disease, silicosis, lung cancer, etc. In the pipeline, we will be developing point-of-care ultrasound imaging devices as well. Thank you.
Before we go to the session proper, an announcement to make is those who want to attend workshop but their names have been missing from the workshop list. Can you please go to the Vayu Hall so your hall can be assigned? Those who already have been halls assigned for their interactive workshop, you stay here. But those who don't have the halls assigned, please go to the Vayu Hall. Now, coming to this interaction with these engineers, the foremost, now most of us, all the doctors, they have been using routinely the ChatGPT, Gemini, Claude. Now, I want opinion from these expert panelists. What is so different? Why do you need specialized AI systems when you already have such a sophisticated large language models even on your mobile? Why do you need these specialized systems? Yes, Advait.
There are a few things that generalized large models like ChatGPT and Gemini cannot do. So for example, let's say you have 100 medical reports in front of you. ChatGPT, you can't just upload, 100 documents and expect it to do any kind of analysis or even extraction of text in a standardized manner. For that, you need to establish programmatic systems using customized AI solutions. Another concern is data privacy, because whenever you use ChatGPT or Gemini, your data is going out of your own ecosystem and it's going to some third party. So as regulations get tightened more and more, I would guess that this will not be acceptable going into the future. So deploying a local solution is what's needed, and because most of us don't have the resources to deploy these large general purpose models, specialized models can be deployed more easily.
So I have a take on this. So as you all are clinicians and you have not become doctor in one day or 1 month. So building an AI model in 1 month, which is equivalent to you, is not possible, not at all possible. And ChatGPT and these are large language models. They do not have the domain specific knowledge. So, and they are not computer vision based. So if you run, upload a chest X-ray or some different image there, they will give you some interpretation. And doctors make judgment ki this AI is not performing well. And it will not perform well because it is not trained on the specific data. The vision data, the X-ray data, on that they have just collected the open source, whatever was available, and they've trained these models into it. So you can use these LLM for interacting to access the knowledge what is available in the internet for language-based, books-based knowledge. But vision-based, it is not there. You have to develop separate models for it. And it requires a lot of data, clinical history, lot of has to be developed. Then only we will be able to provide assistance which will help in real world practices.
Anyone else wants to opine?
Yeah, I think Siddesh's point is very clear that since GPT, for example, is trained on the complete internet, not on a particular part of it, it might not give as much importance to clinical text and behavior as such. Another aspect that I think Advait was also mentioning is the data privacy. And due to the DPDP Act that is coming into play, you might also have this problem where you can't directly send data to ChatGPT or Gemini in a production setting, because that involves taking patient consent for them to be allowing their data to be stored in a third party or a different region than India, for example. And that is somewhere where specialized AI applications which comply to these acts are going to be the way forward, is what I feel.
So, now the second question is, now so many companies are working, so many engineers are working, and there is explosion, and maybe we'll have many thousands of healthcare models which would be now developed by different companies. Now, what is the bottleneck you feel is the bottleneck for deployment in real life or clinical practice?
That's a good question, sir. Like I said, EMR is the most essential part of any hospital, any physician. And when we start looking at AI is not going to be productive unless you have enormous data related to that particular patient. Maybe not for orthopedics, because the patient may come, heal his leg and go off, but for pediatricians, neurologists, urologists, cardiologists, there is a lot of data that we don't store in the system. Many a times I see culture reports, day 1, day 2 data is entered and then it's totally lost. The patient is discharged and there is no concurrence of it. And next time, in the next episode, that data is simply not available for AI to get some predictive analysis. So for me, any prediction or when you talk to any physicist, prediction is possible only when you have a lot of data. We usually talk that if I flip a coin, the probability is 50-50%. That's not prediction. But Einstein actually said in quantum that the prediction is possible if you have every parameter related to the coin, its weight, the pressure, the position on the finger, the air, the temperature of the air, viscosity of the air, etc. If you can measure all that, capture all that and replicate it, you can make a prediction. So I think my earnest request is that if you have EMR, harness it digitally, and going forward, make sure that every parameter of the patient is digitized and recorded for AI. Thank you.
Yeah, to add a little bit to that, he's exactly right that I would encourage you to gather any kind of data that is being generated at your clinics or hospitals. Even data that might not seem immediately useful might have some application maybe a few years later. Any data that can be recorded should be recorded, and good data integrity practices need to be followed. There were many papers over the last few years that were released showing that the biggest factor in model performance was not your complexity, size of the model, architecture, it is quality of data. So high quality data trumps everything. So yeah, very good.
Siddesh, you have been developing some models, Siddesh. So now what is your practical experience for deploying them in real life?
So I will come on to that. So what happens is we as a manufacturer, we have engineering background, we have specific mindset, and you as a clinician have different mindset. Okay, so we build something which we think is good, and you use thing which is valuable to us. So there is a gap there. We do not have day-to-day interaction with the clinicians do not have day-to-day interaction with the manufacturers. That is the first part. We do not create something which exactly is giving the value to the end user. Second is the adoption. So adoption may explainability, AI, if we are talking about there should be explainability, the proper regulatory pathways has to be covered. Everybody asks for where did you done the validation, what are approvals you have. They will ask for everything. So there are two type of feedbacks we receive in the medical industry. When you run a free pilot, you receive a different type of feedback. But when you sell it, when the customer is paying it, you receive a different type of feedback, because those feedbacks are entirely different. So it is a very challenging industry. You cannot just simply create something and start implementing or selling it. You have to make your product accept to the clinicians. They have to adopt it first. And if some value is created, they will use it. And it will be a success. That is it. And you try to engage with the clinicians as much as you possible. Try gathering the data, add more features to it. That is the incremental way we should follow. We manufacturing clinician has to follow. We have to work together to get this done.
Okay. Now, when you develop different models, because all of you are in the model development, what are the differences or the challenges when you develop a model which is on healthcare and a model which is something else, like financial model or something else? Now, Pranav is working on some models for automotives. So, what is the difference when you develop a AI model for a healthcare setting and for the others?
First thing is the digitization of India. Data is not there in India. You won't get the end-to-end data. If I will get X-ray of a patient today, I won't be able to get his confirmatory report. So that is the biggest challenge there. Second, I feel is कि जो patient and the data end-to-end monitoring data we are not getting. That is the only point that I think is the gap there.
Yes.
Yeah, just to add on that, other domains like sir mentioned, I'm working in sensors and in manufacturing sector. The data is structured, somewhat structured. So we have values, and any reasonably technically efficient person can read that data and sort of come to a conclusion. In here, I believe that the domain itself is much difficult. So you need a lot of specialized information and years of practice to even gauge whether a particular reading is right or not. That is one probably the most important problem that I can see in healthcare.
Just to again add to what he said, we come from engineering backgrounds. For us, the base axioms are empirical. That means A square plus B square is always C square, and it will exist till the day we die. But I think in healthcare, that's one of the biggest challenges, and sometimes I really wonder how you have to keep abreast with things changing. So yeah, we can do a lot of things in simulation and it works and we can just go out and roll it. But I think in healthcare, simulation, shadow runs, etc. are more important, and it still scares us before we go live.
Yeah, so following up on that, there is something called as model drift, which means if you train the model on a lot of data, but then the underlying situation changes, how does the model adapt, right? So there is always new science coming out, new advances in medicine, biology. So if you train the model for, let's say, data over the last 30 years, and tomorrow the science changes, the state of the art changes, you can't expect that same model to be applicable in a new situation. So these factors, because there are medical advances happening so fast, but maybe financial, in a field like finance, these things happen a little bit slower. So that is a big challenge, and that needs to be handled properly. And also, as they were saying, data quality, because finance for quite some time has been to a larger extent has been digitized already, while medical practices haven't kept up with that pace of digitization. So I think a very large push for digitization and maintaining data integrity should be made.
I would like to add something. So, to data drift, for example, if you are working on ECG machines, then if your sampling frequency changes, then the model will not work. If your ADC resolution bit changes, then your model will not work. And in case of people working on computer vision, if the pixels or resolution of the image change, then the model will not work. Or if you change any pixel manually, that is called an attack, then also your model will completely fail in that case. So that we need to address data drift with some new techniques. So, and the one more problem is that the continual learning, once you deployed the model, their weights are fixed. Now how you will train on a new data, that is another research direction people are working on. So that is called as continual learning. While you have deployed the model and now you want to train the model with new data. So that is another story.
One important thing I forgot to mention is the regulatory part. So in medtech, when there is a list of regulatory requirements there. So that is the different thing that we have to follow here. We have to done the proper regulatory approvals. You must have done. There is a graveyard of prototypes. We do R&D, we build prototypes, but they are not able to. We are not able to sell them in the market or make them commercialize. So regulatory is the main bottleneck that we face in the medtech industry. And after even deployment, we have to continuously monitor and continuously improve our AI models, because everything is changing day by day. Genetics is changing, everything is, a lot of changes are occurring inside our body. So we have to continuously monitor, validate and improve our models or solutions.
Mr. Chaugale, you are into EMR for such a long time. Now with AI coming into play, how would you change your strategy for marketing your new EMRs?
Yeah, that's a big challenge that we are facing. Wherever there is structured data, we need to harvest that and cleanse it. Now, when I mean cleanse it, we need to organize it digitally, because data retrieval is one of the biggest challenges when you have a big database of thousands and maybe hundreds of thousands of patients. So many people or many hospitals say, no, we have data for the last 16 years, 17 years. But when we take a deep dive inside and you run a simple query to get some history of the data, it takes more than 20 minutes at times. And that's no good for AI. So it is essential, and I don't blame anybody. I don't blame doctors. I don't blame even companies like me saying that, maybe we should have done that job, a better job. Maybe that was better that time. But going forward, I think it's very important to start designing your database. It's more technical. Start designing your database where data can be stored. All formats of data can be stored. But the most important thing I must highlight here is the data design has to be such where retrieval times are in milliseconds, microseconds. Otherwise, going online and online AI inputs will become very difficult. Thank you.
Now, what are the regulatory concerns in using AI in healthcare, and how can they be addressed? Anyone of who is already deploying the models?
So regulatory concerns are when we, as a starter, when we get started, we do not have any exposure on the regulatory part. How to get these products certified in India. Like in handheld X-ray machine, we have took around 1.5 to 2 years to get the product certified. We face lot of challenges because standards are not very clear. In India, BIS is there, they have listed something, ARB is there, they have listed something. They do not have communication with each other. And we face lot of problem when we proceed with approval one step at a time. That is the main problem. The regulatory pathway, which device has to follow what regulatory pathway, it is not very clear in India. And the reason behind graveyard of prototype saying is this part only. We do not know how, there is a lot of documentation we have to do. We have to build around 1,500 documents, list of documents. We have to print everything and we have to follow everything. There is a lot of documentation is there, but no consultancy is there, no regulatory pathway is not there. And when we go for the consultancy, I don't know, there is not a transparency. There is a work of around 1 day and they will charge, I don't know, lot of amount they charge. That is there. And the validation part is also there. You have to do validation as what the regulatory body have asked. When you go for FDA CE, you have to get different validations. You have to partner with the company which is located in that particular country, European country or the US country. These type of challenges are there. And as an early stage startup who does not have revenue, they do not have this amount of money. So investment should also be there in parallel.
Yes, Advait.
Yeah, going off of that, so regulation has always kind of followed technology, right? So not just AI, but all throughout history, technology first comes in, it disrupts sometimes locally, sometimes globally, and the regulation follows a few years later. So we're seeing the same thing in India. I think it is very important for us to preemptively prepare for all of the regulations that are going to come up for sure. So you can kind of see this already happening in other countries, so especially Western Europe and the US, where they are starting to implement very strict laws for not just model interpretability but also fairness, bias, right, which becomes very important in things like in things like medicine. So of course, right now, if you want to make sure that you are not violating any regulations, probably the biggest thing to take care of is digital personal data, but also just I'm sure it'll be better if everybody prepared for all of the regulations that will undoubtedly come in the next couple of years.
Yeah, I think adding on to that, like in the US, like you mentioned, regulation is already ahead in some ways, and what we experience as an early stage startup, the DPDP Act, that the revision that came out, it's not very clear on what is allowed and what is not allowed. What is not allowed is somewhat clear. What is allowed is also still of a grey zone right now, and that's where we also face some issues. And we won't know if this solution it gets approved right now in the next 6 months. What is going to happen? There are some challenges that early stage startups like us face also, and as this is the major reason why a lot of our projects might end up into the graveyard of prototypes, like he mentioned. And one thing that would also help is support from the community in terms of compliance. Like it will help if the medicine health as a community starts to follow general good practices about data collection, and we don't want that scenario to happen where 6 months down the line the data that you have so meticulously collected can't be used in a development scenario at all.
As I understand, in healthcare, AI in healthcare is slightly more complex from the different answers which you gave. So developing AI model in other fields is much, I feel, is easier, both while the data is there, you can acquire data, it is more in structured form, not in structured form in healthcare, and there are many more concerns when you deploy that model, because there will be hesitation, inertia on the part of the doctors. They will need much more explainability, as well as any error, the margin of error has to be very small. Any error will not be tolerated. So we have, for this, I think the solution is yes, we all doctors who have gathered here and many more, they have to collaborate with engineers, understand each other's concern, and then come out so that we can have at least India specific models. As you have heard, the models which have been developed in the West may not work in India. So we have to have a local data set, more in a structured form, maybe India specific, maybe region specific, maybe Solapur specific, that sort of thing. So we all have to, henceforth, we are not that much careful in data collection. So we have to, the basic, as you know, AI is data, data is the fuel. Okay, so data is very important. So we, from today, I think one has to take initiatives that we start collecting data, a structured data, and we have to have a good EMR so that we can have AI models on our own. And that is the message which I'd like to give. Thank you.
Thank you so much for the enlightening talk, sir. I would request Dr. Vijay Patil, sir, to please come on stage to felicitate our panelists. Can we have a big round of applause for the panelists for giving us insights from the world that we less see, which is the engineering world. So with that, we come to an end of our joint session. Now we will be having a short high tea break of 15 minutes. Before everyone departs, I would like to make an important announcement regarding our most exciting component of today, which is the workshop sessions. So for the workshops, this venue will be divided into 8 separate halls. This present hall will be divided into Prithvi Hall A, B, C and D, that is 4 parts. And there will be Chinese restaurant as well. And Vayu Hall on the ground floor. On the M floor, there will be Jal Hall and Akash Hall. I request all our delegates to check their registration number and see which hall has been allotted to them and proceed to the hall as per the registration number after the high tea. The format of each workshop will consist of 15 minutes of introductory talk followed by 45 minutes of hands-on practical session. The first workshop would be regarding using ChatGPT, Gemini and Perplexity in healthcare, followed by the second workshop will be on using Notebook LLM. A tea break will be following at 5 p.m. for a short 10 minutes, which will be followed by third workshop on the research paper writing. After the third workshop, again we will be dispersing into our specialty focused sessions where we will be going to our respective specialty based halls. We request all delegates to kindly proceed to their allotted workshop halls as soon as possible so that we can start on time. Once you are in the halls, please make sure that you connect to the Wi-Fi provided free of cost by the hotel for ensuring optimum speed of uploading. The password for the Wi-Fi would be from 1 to 8, 1, 2, 3, 4, 5, 6, 7, 8. I will be repeating it again.
Those who want to participate in yoga session, tomorrow is International Yoga Day. An arrangement has been made with the trainer. There will be yoga session tomorrow poolside in Balaji Sarovar Hospital, Hotel. First 50 interested persons can contact Sun Stall in the lobby. So please register yourself in Sun Stall lobby if you want to participate in yoga session tomorrow at 6:30 a.m. poolside.
So let's having a deep breath. When I say breathe in, we have to breathe, hold and breathe out. Let's start. Let's start. Breathe in.
रिवर्स कैसे होगा ये?
Hold.
नहीं मेरा है लैपटॉप तो यार.
Breathe out.
नहीं.
Again breathe in.
कहाँ गया?
Hold.
दोबारा करेंगे.
Breathe out. Relax. Again breathe in. Count 1, 2, 3, 4, 5, 6.
ये रिवर्स करना.
Relax.
नहीं डुप्लीकेट करो स्क्रीन.
Now, I think we all are in the concentrator. So, it's time to channelize the our thing. One QR code is coming. Everybody is requested to scan this QR code to join our WhatsApp group. So few related material and the few things that is what prompting, what we are going to give, we will directly put to the in WhatsApp. So you have to also enable your WhatsApp in your laptop also. So you can directly copy paste that thing. Coming, everything has digital, has some glitches, always will be there. So we have to remain relaxed. That is our aim. So let's begin our talk. How many are regularly utilizing the artificial intelligence? How many of you, just raise your hand, how many of you are regularly using the AI? So, yeah, Wi-Fi, you have to go for the 5G, then it will work. What? Wi-Fi, you just get, because it is a last bench, you have to just go for the A1 5G. Just a minute. Just reconnect it, because at presently working very well in the mind. So we will wait till that thing, till that we can have a few theoretical part to understand what we are going to learn. Till that thing, everything can be settled down, right? Till that you will get the 5G also. You just get they are trying to getting you, because few people come early to you, they get that thing, you have to wait for few minutes then. But we can't wait more, because otherwise we will miss that timing and we will not able to start it. So just concentrate. So let's introduce ourselves. Myself, Dr. Samir Shah, being a pediatrician and adolescent specialist. My special interest definitely in the pediatrics, but also I am one of the AI enthusiasts, and we already running one ICP in Indian College of Pediatrics AI course, and we are try to promote the artificial intelligence in digitalized world in medical practice on regular basis. Along with me, Dr. Akshay is there. Akshay, you can introduce yourself.
Post lunch session, difficult for the speaker and even tougher for the audience. Anyways, very good afternoon, gentlemen and the ladies of the house. I am Dr. Akshay and I am a cardiothoracic surgeon. I head the Department of Cardiothoracic Surgery and Jaipur National University Medical College in Jaipur. And for the disclosures, I am not an AI expert, nor am I totally unaware of and ignorant of AI. I am somewhere in a continuous journey from being ignorant to AI to, I won't say I'll become an AI expert. Nobody can be an expert in a field. But yes, I am gradually moving towards becoming more AI literate. So, next, I'm not a teacher, I'm not a mentor, and this is not a master class. So, I'll consider this hall as more of a big experimental lab, and each and every table is a small experiment table. So, you need to experiment yourself, you need to do it yourself, you need to get the results yourself and appreciate yourself. You have to be wow for yourself. There's nobody is validating, nobody is acknowledging. So you have to take care of yourself, you have to do it yourself. Between slides, we will give time for everybody to put in the prompts, see the results. We are not in a hurry. I have been a part of a couple of workshops on the other side. What I noticed on all the workshops, that the mentor was too quick, and actually the audience didn't find time to do things by themselves, and by the time they go back home, they are not patient enough to do things. Most of the things here you will be already be knowing, and the only thing is you don't have patience and time to do that in your clinic or at your home. So try to appreciate your results. You have to take care of your results yourself. I'll be giving small cues, some directions, but you have to do it yourself. So this is how we evolved. This evolution of the medical knowledge retrieval. We started with the books. We started with the Bible, Harrison. Simple question, यार Harrison में क्या लिखा है ये बताओ. We started with Harrison. Then came the PubMed. In later part of my residency in early 2000s, we started having access to the PubMed. But not much of data could be retrieved because many of the journals were not on PubMed, and also the data was very expensive. Then we started Googling things. Then ChatGPT came, and now it is the age of AI agents. Everybody amongst us, all of us have seen the transition of the doctors using Google as Google, and now they are using ChatGPT as Google. So the difference we will have after this session, after this interaction with each other, is that I hope we will stop using ChatGPT as a Google, and we'll start using it as something for medical communication and as a clinical assistant. So 2 exercises today, one medical communication and other is this clinical decision support, rather clinical assistant. So before we start with the AI, this is the most important slide. What to ask? क्या पूछना है? We should be clear what is our motive. हमको क्या पूछना है उसके? How to ask? कैसे पूछना है? This is what we call prompt engineering. Properly asking the AI to get a proper result. And whom to ask? Which AI model to ask? So what, how and whom? क्या पूछना है, किससे पूछना है और कैसे पूछना है? We have to stick to these 3 things. If we ask the questions properly, we'll get the answers properly. So it is how you ask the question is now becoming more important than knowing the right answer. So next is prompt engineering. What is prompt engineering? It is a skill of crafting inputs. It's a skill and it's a craft. My prompt can be different from yours. We might get a equivalent results, but it's a skill. Better the craft, better the skill, better is the output. So how should we engineer our prompts? Smarter, learn smarter to be smart. Specify the role. Who are you? Like me, I'm here, I'm the presenter. So understand the role. Give the AI model a role. Then mention the context. What needs to be done? Ask a clear task. Request the format. You want it in PDF, you want it in MS Word, you want it in bulleted format. Tell the audience, whom is this talk or whom is this prompt directed towards? Establish the boundaries. You have to establish the boundaries. Like in our cases, in the clinical cases, the guidelines, the latest guidelines, like I'm in endocardiac science, then American College of Cardiology or ESC guidelines. And the most important step and the step that needs most patience, and it's the step where we lose patience, is we have to refine iteratively. Iterate, iterate, iterate. The more you iterate, the better the prompt becomes, the better the response becomes. Now there are so many models. Like there are so many players. Can anybody tell who is the best? Can we tell who is the best? Virat is a good opener, a good finisher. But Dhoni keeps the wickets. Nobody keeps better wickets than Dhoni. And what about Hardik? He's an all-rounder. He can bat well, he can bowl well. So all the 3 have their separate roles, and all the 3 roles are important. So no one model is better than the other model. We will stick to ChatGPT, and sir will stick to LLM, because involving too much will, it is more of information overload rather than it won't serve a benefit. So different players have different roles. The ChatGPT is a good clinical co-pilot. This is a very important slide. If you want to discuss a case, clinical case, then ChatGPT. Differential diagnosis, if you want to generate, then again it's ChatGPT. Treatment planning, ChatGPT. If you want to do research literature, evidence-based medicine, then Perplexity is the best. And now Claude is also coming up for the same purpose. Gemini is good for working across a text, images, and PDF videos. So when we want citation transparency, when we are writing articles, publishing articles, for the citation purpose, the best is Perplexity. For latest medical information, then again Perplexity is the best. For analysis of data, table analysis, PDF analysis, protocol development, drafting manuscripts, making infographics, ChatGPT is the best. So if we consider ourselves as a senior clinician and we have a couple of residents amongst us, with us, then ChatGPT acts like a smart junior resident, is a medical writer and a teacher. Then Gemini is a resident carrying all the books, images and PDFs. You will always find a guy amongst your department जिसके पास सारी PDF होती हैं. वो पढ़ता है नहीं पढ़ता है, that's a different story, but he has all the PDF. And Perplexity is one of your residents that is always sitting in the library, taking out literature and preparing manuscripts and articles for you. So which tool when? These are the 10 clinical scenarios. Almost all our queries fit into this. If you want a differential diagnosis, then give a good prompt and ChatGPT will help you. Like help me prepare.
Don't take any picture. We are sending this whole presentation to our WhatsApp group. Don't worry.
The QR code we showed in the initial slide. So if you want to say help me prepare tomorrow's lecture on ECMO, ChatGPT is the best. When we have to summarize the PDF, both have equal performance, both ChatGPT and Gemini. Interpreting the ECG, since it's an image, Gemini is best. Finding latest evidence, Perplexity. Newest papers, best out of the research, latest research, Perplexity is the best. Generate patient information leaflet. This is very important. Up till now, there must have been so many clinicians who are actually employing a digital marketing team. But if we have patients, although we don't have patients, if we have patients, then we can do good from ourselves. So 2 exercises today. First is AI-powered medical communication, and the other is clinical assistant. So after this workshop, you will have a patient handout, you will have an Instagram post, you will have WhatsApp patient education message, a Hindi or a local language version like Marathi here, a ready to generate infographic and a 5-minute challenge. So what will you do? We'll see what does a one-line prompt and a detailed prompt does. We will see how to convert all this into a layman language. WhatsApp forward generator, turn one topic into 10 different forms, and a medical designer. So I have a couple of prompts for these: pediatrics, surgery, orthopedics, OBGY, internal medicine, ortho. But your prompts, your side, I'll just give you some hints. So this is the first one is, since I am a cardiac specialist, this is the one I started with. Create a patient education infographic on heart attack. Now you can, these are the prompts. If anything suits you according to your specialty, you can start doing it. You start doing it, put in a single one-liner prompt and see how's the result in the ChatGPT.
You can use it ChatGPT also. You can utilize the Gemini also. What are your comfort zone? These two at presently we are concentrating mainly. So you can open your ChatGPT and what is suggesting any of these prompt what you like, you can just put into that. And once created, you can directly put into our WhatsApp group, so everybody can understand what you had did.
We can actually wait. We have a whole lot of time. So put in the prompt, see the response, and then we'll move forward. So how many there are surgeons here? Rest everybody is from medicine side, pediatrics, neurology, and okay, mixed group.
Mix.
this part was a little bit tricky, to hit a common ground. So that is the reason I gave couple of single liners you can start with. My rest of my slides will just give you hints. Those won't have every specialty covered, but this is how you can start. So when I gave a prompt to create a patient education infographic on heart attack, simple one-liner prompt, what did I get? So what did I get? I got a title, infographic titled heart attack. My prompt was not that great. It was not very specific. तो ChatGPT को ज़्यादा समझ नहीं आया कि मेरे को करना क्या है. So he gave us how does it happen. It gave a small box on pathophysiology, warning signs, what to do, risk factor. It actually tried to summarize everything on heart attack and coronary artery disease in one single infographic. Too much cluttered. It does not have much of actionable things, and same you will get also in your prompts.
क्या आया आप लोगों के अंदर? Starting from the table wise, this table. What prompt you used? आप लोगों ने क्या यूज किया? टेबल 1 आप बोल सकते हो. Which prompt you used? Not used. तो ट्राई करिए. आपके सामने है, लिखिए. Create a patient education infographics for heart attack or anything. यहाँ पे है. कहाँ लिखना है आप बताइए. Okay.
So you have a ChatGPT window. हाँ share. It won't be shared, दोनों नहीं एक साथ. Actually both cannot happen.
Full window share नहीं हो रहा.
दोनों एक साथ नहीं होगा, This is an extender. If I put it here, I cannot show my presentation again. It is more of a 3 display thing. So open ChatGPT. Have you opened ChatGPT? And how can I help you? This type of.
यहाँ पे लिखने का है. Have you used? Anybody has created? Great.
Single liner prompt.
आपने किया. Very good. Anybody? जिसने किया है आप WhatsApp में डालते जाइए. हाँ जी. Right. अभी आ रहा है. हाँ. Refresh करिए.
One more thing, it would be very useful for when you go from now to take ChatGPT
open करिए ChatGPT
Go subscription. I have a ChatGPT Go subscription. Most of my things, my infographics, my patient material.
All are requested. First important thing is पहले ChatGPT open करिए. काफ़ी लोगों ने किया ही नहीं है. Just उसके बाद में जाते हैं.
If you have working on laptops, then you should open ChatGPT.com.
ऐसा नहीं, उसने क्या सर ने पूरा लिखा था ना, प्लीज क्रिएट अ इन्फोग्राफिक्स. जब तक आप वो पूरा नहीं लिखोगे नहीं आएगा. हाँ बस बराबर. उसको डाउनलोड करो. यहाँ से उसको डायरेक्टली करोगे तो भी डाउन है. यहाँ नहीं जिसको हाँ उसको क्लिक करिए.
अच्छा ये ना डाउनलोड बटन.
इसको नीचे लीजिए. ऊपर है ना, इसके लिए अभी. हाँ अभी पकड़िए. अभी आएगा. हाँ वो रहा. राइट. डाउनलोड कर दीजिए. सी डाउनलोड या एंड सेंड टू दी व्हाट्सएप.
करते हैं.
यस.
तो आपने ये अपने ब्राउजर में खोला.
हाँ डाउनलोड. यस परफेक्ट.
ChatGPT ऐप ओपन किया है.
हुआ
तो ठीक है.
रेडी. परफेक्ट. सेट किया.
आप यू वांट टू शेयर इट इन द व्हाट्सएप. मैं इसका ना आपको
परफेक्ट.
कॉपी हो जाता है यहाँ से.
हाँ लेकिन यहाँ पे भी आपको व्हाट्सएप ओपन करना पड़ेगा ना. यहाँ पे भी व्हाट्सएप ओपन करिए तो ही इस पर ट्रांसफ़र कर पाओगे मैडम. नहीं तो आपको वो सिंक्रोनाइज करना पड़ेगा.
ये ना आप यू कैन डू इट इन.
हुआ आपका. परफेक्ट. परफेक्ट. ठीक है. अभी आ रहा हूँ.
लैपटॉप से यू कैन कॉपी पेस्ट इट.
एनी प्रॉब्लम.
पेस्ट करके कर सकते हैं. अंटिल अनलेस इट्स इन्फोग्राफिक. आपने इन्फोग्राफिक नहीं बनाया हुआ इसका, है ना. इन्फोग्राफिक
क्या लिखा?
देन इट विल बी अ इमेज. उसको जैसे मैंने
अभी आपने पहले ChatGPT ओपन किया तो ओपन करिए. वहाँ नए ब्राउज़र खोलो और उसमें लाइए ChatGPT. इसको रहने दो अभी जो है
अभी अपन आगे दिखाएगा कि अगला प्रॉम्प्ट कैसे डाल के इसको बेटर कर सकते हैं।
डालिए चैट जीपीटी, लिखिए चैट जीपीटी। हाँ चलेगा कर एनीथिंग ओनली थिंग मोस्ट ओपन जिसने बनाया हुआ है वेदर दिस सिंगल प्रॉम्प्ट के ऊपर जो आपका इन्फोग्राफिक आया, आर यू सेटिस्फाइड और नॉट सेटिस्फाइड? हाउ मेनी सेटिस्फाइड? राइट, एंड हाउ मेनी आर नॉट सेटिस्फाइड? व्हाई यू आर नॉट सेटिस्फाइड?
Personalization is missing in there.
Any who are not satisfied? Yes, ma'am. Satisfied? Not satisfied. अभी लिखिए, पहले करिए, बाद में सेटिस्फाई हो। क्या आया बताइए? तो दिखाइए ना क्या आया, लिखिए। डिलीट। सो दिस इज द थिंग, सिंगल प्रॉम्प्ट। जस्ट पहले जो जिन लोगों ने व्हाट्सएप ग्रुप ज्वाइन नहीं किया है, दिस इज द QR कोड, इफ़ यू आर स्टिल मिस जस्ट ज्वाइन हो जाइए, क्योंकि बाकी के 2 क्लासेस जो अभी आएंगे इसके बाद में उसमें भी ये ज़रूरत पड़ेगा। अभी जो लोग सेटिस्फाइड नहीं है, मैंने अपने व्हाट्सएप ग्रुप में एक उसका प्रॉम्प्ट जो सर ने बताया था स्मार्ट प्रॉम्प्ट, वो डाला हुआ है। यू जस्ट कॉपी पे व्हाट्सएप ग्रुप देखा, आप बाद में ज्वाइन हुए, पहले मैं वापस।
So the importance here is to understand that ChatGPT, whatever the model knew about heart attack, so whatever ChatGPT knew about heart attack, उसने सब कुछ इसके अंदर डाल दिया, irrespective कि patient whether requires it or does not require it, or you want to give this information to the patient or not. So from here onwards, we'll try to refine our prompt. This is what we call prompt engineering. It is not necessary for all of you to put it on the WhatsApp group. As I told in the starting, that try to appreciate your results yourself. So this is a engineer prompt. Try to put in a prompt of your specialty like this. Act as a senior cardiologist. कि आपको कैसे एक्ट करना है. Tell ChatGPT you have to act like this. Create a content for a patient education infographic on heart attack. This is what you have to do. Who are your audience? Patients and their families. Language should be kept simple. Reading level should be of class 8th. Provide some boundaries. It should not be more than 100 words. And what do you want to tell the patients? Warning signs, what to do immediately, what not to do, an emergency number, you can put it off your hospital. Another, the format. Use bullets and short answers. So this is what we got. The clutter was reduced. Now the information you want to give to the patient, now it has appeared. Warning signs are there. What to do immediately, what not to do, what needs to be remembered. I have written call 911. You can put your hospital's number.
Right. And for this infographics what sir has created, I just put a copy paste the exact prompt what demonstrated in our WhatsApp group. So you just copy paste for that thing, and you can change accordingly what the content you want, being the pediatrician, being the gynecologist, being the ophthalmologist, and what content you utilize. So it will be easy for you to get the exact such type of the prompt related infographic what sir has created.
So the crux of the matter is prompt quality is the output quality. The better, the issue is this, we lose patience after this step. हम ये step करने में हम we are not very patient in doing this step. यार इतना कौन type करेगा? This is the main, what I think is the hurdle in we developing patient infographics. Is this कि यार ये तो यार छोड़ो यार कौन करेगा ये? So whatever information we get from a model on the first run, we try to post it, we try to hand it over to the patient. But we need to refine according to our local needs, according to our needs. Patient might not be, wanting to have pathophysiology of a heart attack, but he wants to have actionable things. So we have to put those prompts, a type of prompt which gives us an actionable output.
So do you think each time आप इतना लंबा लिख पाओगे? It's not practically possible, right? And for that purpose, there is a few things that what we can able to do. One is the sequential prompting. Means जो prompt हमने एक बार बनाया हुआ है, we give that prompt as the directly as a example, okay, like this, prepare for this thing. So that will reduce your burden to making repeatedly. If you want to more refine that before putting that infographic, please prepare a prompt with this example. So it will give the exact prompt to you. Okay, this is the prompt what you are looking for. Is it okay? If you say yes, okay, and create infographic, it will be created that infographic what you want. So एक बार आपने ये डाल दिया कि इस example के हिसाब से मेरे को बनाना है, तो that will every time it will give that thing. Once you learn more in detail, or you want to something do more, you can utilize that in different way after when you are expertise like that. इससे थोड़ा और आगे सिंपल कर रहा हूँ. मैंने अभी अपने व्हाट्सएप ग्रुप में जो सर ने स्मार्ट प्रॉम्प्ट डाल के जो फोटोग्राफ मैंने डाला हुआ है, यू कैन डायरेक्टली यूटिलाइज दैट प्रॉम्प्ट एज अ कॉपी पेस्टिंग ऑफ दैट प्रॉम्प्ट एंड आस्किंग एज पर दिस स्मार्ट प्रॉम्प्ट क्रिएट माई इन्फोग्राफिक्स, and it will directly give that infographics like the actual prompt. We will create first a prompt and then you have to create the infographics. Create. So this is called sequential prompting. एक ही चीज़ को continuously करना. There are the different method, that is the project, but it is the at presently out of syllabus, because if we go for that detail, it will slightly difficult. But we will try to create, when we have a specialty discussion in pediatrics, we will going to showcase how we can create a project in that for the pediatrics. Okay? Yeah. Continue.
So ChatGPT gives you all the answers, gives very good response, but it all depends how much patient you are and how much information you are giving. आपके जो मन में आता है, whatever you think, you should feed. So now we will now translate everything to a layman language. So we start again with a one-liner prompt. Create an infographic on HFrEF, heart failure with reduced ejection fraction. Another cluttered response. We have the ChatGPT had tried to give everything. Now prepare. See, this is how we iterate. Now we are starting to iterate. Prepare an infographic. क्या बनाना है? Infographic बनाना है. So we had couple of as you saw, we did not use the word infographic. So it gave us a text. So prepare, हमको क्या चाहिए? We need an infographic. Prepare an infographic explaining this to a 60-year-old. Now we are putting in boundaries. Who has never studied biology? It is like what technical guys, engineering guys were telling, like explain AI, what is AI to a person who is not an engineer. The output is different. It is much more simplified, much more patient specific, much more easily understandable.
फोटोग्राफ भी 60 साल के पर्सन का है इसके अंदर इन्फोग्राफिक, if you just check it.
So if you are, you can also do this on your devices. You can iterate a little bit of your first prompt. Like on the pediatric side, explain dengue to a worrying mother. So defining the audience is the key. हम ये किसके लिए बना रहे हैं? अगर यही हम DM cardiology residents के लिए बना रहे होते, that is absolutely inappropriate. So we would have asked a different prompt. Now we iterate further. Now prepare an infographic explaining using a water pump analogy. Most of us explain the patients about heart, that heart एक pump की तरह काम करता है. So we want to have same analogy for the our next output. So this is what ChatGPT gave us.
Is it correct?
A year or two back, we were getting these type of infographics from a person who was very, expert in Photoshop or Corel Draw 12. So, but now we can actually make it ourselves. So just have a look at this infographic. But still, if you see this type of infographic in your hand, यार ये तो बहुत कुछ लिखा है, कौन पढ़ेगा? If the YouTube video does not engage you in the first 10 seconds, you tend to scroll. First 10 seconds, first view is very important. Iteration is the key to get better output. Now we can translate also. Now prepare the same infographic, you have to share it to a person who is coming from a rural background, create it in Hindi, Marathi, Tamil, any of the languages. Straight away. It takes just less than a second to create this type of infographic. So iteration as per your thought. आपको लगा यार मेरे को ये पंजाब भेजना है, I'll make it in Punjabi. आपको लगा I have to send, this is a very good infographic and I have to send it to Maharashtra. So translate into Marathi. Then now prepare a infographic explaining in English. Now we have HREF, HFref को समझो पानी के पंप से. So this is how you engage your patients, how you refine your medical communications. What I have experienced in last 2 decades of my medical science career, the more better communicator are you with the patient, the better is your practice. Your clinical practice hardly coincides with your skills. You should be a good communicator. So iteration as per your needs. आपको लगता है कि पेशेंट को हिंदी भी आता है, इंग्लिश भी आता है, knows both the language, इंग्लिश भी आता है, मराठी भी आता है, तो let's experiment. Your device is not going to explode, nobody is catching your neck. So iterate smart. If you can see, this was still a lot of clutter. Now, how I gave the next prompt. There is too much material to understand in this. It will take considerable time for a common man to read and understand. Reduce it to under 100 words, remove the clutter and use mobile-friendly, bigger fonts. The clutter has been reduced, the pump size, this everything has, it is better, it's a better visual. And before posting it to social media or sharing it, the ChatGPT has an option of aspect ratio. The ChatGPT, if you click edit the image, it is an option of aspect ratio. So you can convert the aspect ratio according to Instagram, according to the landscape, square size 1:1. So this can be converted right into the ChatGPT and then you can export the image and use it thereafter.
We can wait because
please.
So let's, जो आपने पहला इन्फोग्राफिक्स इंग्लिश में बनाया हुआ है उसको पहले डाउनलोड कर दीजिए. Let's download it. Right? अभी अगर उसके बाद में आपने कुछ नहीं लिखा हो तो यू कैन डायरेक्टली राइट डाउन दी प्रॉम्प्ट व्हाट सर हैज रिटन. प्लीज गिव इन्फोग्राफिक्स ऑफ अबोव इन हिंदी, ऐसा लिखिए. एंड व्हाट इट्स टर्न, वेदर इट इज टर्निंग इन टू द हिंदी और नॉट, देखिए. लिखिए इसमें प्लीज, वहीं पे नीचे ही लिखना है. इसको बंद करिए पहले, तो ये आपने डाउनलोड वाला है, वापस जाइए. वहाँ जो है जहाँ पे लिखने का पार्ट है वहाँ पे वापस चले जाइए. चैट जीपीटी में लिखने का पार्ट है. वी हैव टू शोकेस दैट बिकॉज मेनी पीपल इज नॉट एबल टू चैट दैट. तो वहाँ पे जाइए, वहाँ पे रखिए. आया हिंदी में? कितने लोगों का हिंदी में आ गया? राइट. सो नाउ राइट सेम थिंग, प्लीज ट्रांसलेट इनटू द मराठी ऑल्सो. लेट्स डू, देखते आता है कि नहीं आता है. बराबर मराठी है लेकिन चेक किया, परफेक्ट है. सो मैनी जीपीटीज एंड मैनी थिंग्स आर अवेलेबल, बट बी अ मास्टर ऑफ एनी वन. एट प्रेजेंटली वी आर जस्ट टीचिंग यू चैट जीपीटी बिकॉज इट इज़ वेरी इजी टू लर्न, वेरी इजी टू इम्प्लीमेंट. और अभी तक फ्री टायर काफ़ी अच्छा है कि जिसमें अपने को पेड वर्जन की ज़रूरत नहीं है. सर ने बोला प्रो, लेकिन आपके काफ़ी के पास प्रो नहीं है, फिर भी आप लोग कर सकते.
नहीं, एग्जैक्टली प्रो भी नहीं. एक गो वर्जन आता है, इट्स समथिंग 399 पर मंथ. बट इफ यू आर इनटू इन्फोग्राफिक्स, आप बनाना चाहते हैं
मोर डिटेल अच्छी तरह से बनाना चाहते हैं, इट विल रिक्वायर दैट टाइप ऑफ.
द नंबर ऑफ इन्फोग्राफिक्स, नंबर ऑफ इमेजेस यू कैन जनरेट इज a good amount in Go subscription.
Right. So now this is the one exercise that from next day, from tomorrow, कोई भी patient आपके पास आता है and you want to give some information, ask the ChatGPT to create so and so infographic for so and so patient. And whether वो अच्छा आता है तो patient को directly WhatsApp कर दीजिएगा. If you are able to do from tomorrow, day after tomorrow, tomorrow तो अभी एक है, day after tomorrow in your practice, this 1 hour is successful.
Yeah.
Ready?
Medical reps usually come to us with this infographic booklets, if you remember. You can actually take the photograph of that booklet and you can customize that content according to your hospital, your practice, attach your photographs into it. So it is more of iteration, more of patience. अपने को सिर्फ patience रखना है और उसमें कुछ नहीं चाहिए. There is no skill required in typing. We need to have patience कि yes ठीक है यार, मतलब let us give it 2 more prompts.
So one important thing, what lesson actually we are going to give to you, don't 100% rely on the ChatGPT or any Gemini or anyone. After creation, always read line by line. What I am saying again, line by line. See, some minor problem definitely there you can find out, and that what you have to clarify. And if you find such type of the problem, you have to write same thing in the that box again, typing box. Okay, this is the wrong thing. Please rectify it, and it will rectify that thing. So rectification is easily possible in ChatGPT, and that's why what we have to do that continuously trying, and that will help you lot to give more information to your own patient.
Like if you have written the spelling of chat as CHT, then you can say replace CHT with CHAT. So it will locate CHT and then replace it with CHAT.
And most one important thing, even it is the photograph, it is locating that thing. That's the beauty of the ChatGPT.
So other thing, we regularly use our WhatsApp message forwards. So this is for heart failure. Create a WhatsApp message for patients on identifying heart failure. It can be identifying measles, it can be identifying stroke, it can be identifying osteoarthritis. So create a WhatsApp message for patients identifying failures. Let's put some boundaries. Maximum 120 words. The note should be friendly. Should not be more of authoritarian note. Use emojis where required, and include 5 actionable tips. This was a short prompt I gave, and this was the result, and it was less than a second. Could it be heart failure? Early detection can save lives, and we have 1, 2, 3, 4 and 5 actionable things which we can share to the patients. So you can write a short prompt, just practice it and see what you get.
I put a same prompt what Saresh said just now showcase you in our WhatsApp group. You just copy paste, add something what related to your speciality, and how much you will getting, just check it out. Kia? Yes. Getting good result? So it is very easy. Now you can use more WhatsApp for your patients. कुछ भी पूछता है डायरेक्टली बना के डायरेक्ट डाल दिया, तो that will give the immediate instant good answer by the doctor, and that is definitely appreciated by the patient. Okay, sir,
we can actually record the patient-doctor conversation, what our patients are asking, then we can create out of that also.
That is called scribe.
So we can experiment n number of things in this, make the same message suitable for Diwali season, so Ganpati season, anything we can do it for a Christmas, for a New Year. So when I asked it to modify it according to the Diwali season, this is what ChatGPT gave me. Celebrate Diwali with a healthy heart. Couple of things. This Diwali, light up your home and protect your heart. So we can do any. अपने को अलग से, we don't have to make a Diwali greeting. If you want to do it to the, send it to the patients, we don't have to create a separate Diwali greeting with our photograph and our achievements. It's better to, give some actionable tips to the patients. So ChatGPT quickly understands the context. So you can now choose a topic and immediately you can convert it into 10 things. So you can choose your topic according to your specialty and convert this topic into 10 these things. Instagram post, Instagram carousel, Facebook post, Twitter post, LinkedIn, patient handout, clinical room poster, WhatsApp message, quiz question, myth versus fact. This is how we can ask different things from ChatGPT to do, so that we can, give good information, valuable information to the patient. You can do it. We have a whole lot of time, so you can do it on your topic, whatever you feel is right.
Even we can directly write this thing. Okay, this is a topic and create a different message for all these things. At a one click also it will done by it. So I just copy pasting all the 10 things and you just write down your topic and ask this create a message for all these things. It will give immediately 10 answer within a fraction of the second. Just create yours. How many years created? कितनी मिनट लगी? Just write किया आ गया. Right. So we have to not remember कि अपने को 10 मैसेज अलग अलग बनाना है. So this is the creativity that what you can develop yourself. कॉपी पेस्ट करे व्हाट्सएप में डाला है मैंने. वही व्हाट्सएप में आप ज्वाइन हुए, व्हाट्सएप में सेम कॉपी पेस्ट किया है मैंने. आपको जस्ट कॉपी पेस्ट करना है. कितने लोगों ने किया? प्लीज रेज योर हैंड तो वी कैन मूव फॉरवर्ड. या किसी को दिक्कत नहीं? क्या हुआ? व्हाट्सअप निकालिए आपका, व्हाट्सअप से कॉपी करिए जो भी मैसेज जो मैंने डाला हुआ है. व्हाट्सअप आप जब तक ओपन नहीं करोगे आपको नहीं खुलेगा सर.
एनीवन फ्रॉम दिस साइड?
व्हाट्सअप यहाँ पे है ना, वहाँ पे नीचे देखो, जाने तो नीचे मैंने मैसेज डाला सर. मैसेज मैंने एक प्रॉम्प्ट पूरा डाला हुआ है. ये प्रॉम्प्ट ले लीजिए. ये पूरा प्रॉम्प्ट, इसको पूरा कंट्रोल एक पूरा से कॉपी करना पड़ेगा. कॉपी करके ChatGPT में डालिए.
These 10 are the most commonly used social media things we make.
इमेज कहाँ बनाया? हमने मैसेज बनाया ना. We had created message to send into the WhatsApp और Instagram. वो बनाने का बोला. अभी उन्होंने हमने मैसेज दिया. हाँ, पोस्ट यानी सिर्फ मैसेज डाला है. हम उसमें आप बोलोगे कि मेरे को पोस्ट में इमेज भी चाहिए तो इमेज बनाएंगे. अभी हमने सिर्फ मैसेज डालने का बताया. परफेक्ट, सब आ गए. तो आप कहीं पे भी डाल सकते हो. तो दिस इज द क्रिएशन ऑफ द मैसेज. पहले हमने इन्फोग्राफिक्स बनाना सिखाया. नाउ वी हैव क्रिएटेड हाउ टू क्रिएट ऑल मैसेज एट अ वन टाइम, वन गो. क्लियर?
So normally it will take many hours to do this and a specialized person to do this, but if you do right prompting with one single prompt, you will have all this in couple of seconds. So now the take home. This is a specialty challenge. You can actually make something out of this and post it on your respective accounts tomorrow. It will just take 2 minutes. If you want to make something right here, because it's an enclosure, I would say this is a jail. आपको तो करके ही जाना पड़ेगा. You cannot say कि यार मैं तो नहीं कर रहा, छोड़ो यार, patient है मेरे पास. So this is, you cannot say. It's better you make something. Otherwise, I have the next exercise. So you can ask the model to make an English version, Marathi version, Insta post, WhatsApp message, infographic prompt.
So कल जाके एटलीस्ट परसों जाके बनाना है. कल तो आप अभी और हो यहाँ पे. परसों जाके जस्ट स्टार्ट इट. जब तक चालू नहीं करोगे तब तक कल परसों वापस भूल जाओगे. परसों शाम तक कुछ याद नहीं रहेगा एक्सेप्ट पेशेंस मैनेजमेंट. यस.
I had attended a similar workshop couple of months back. और जो उन्होंने बताया था मैंने आज तक नहीं किया वो. So it is better you do it now. After going outside, तो I don't think nobody does. फिर वो भूल जाते हैं. We have so much patients to see such a practice.
The format will not be in structured way. There is a different methodology for that thing. तो वो चैट जीपीटी वहाँ दिखेगा तब मैं बताता हूँ. अभी सर का वो एक्सेप्ट पीपीटी आ रहा है इसलिए नहीं करे. मेरा जस्ट लैपटॉप.
Actually, I would have required a 3-screen setup on what one there would have been chat GPT, on one there would have been a presentation, and the other one was my master setup. So in 2 monitor setup, I can just do this. So we can move to the next exercise. I would rather like to be quick because my specialty differs from other specialties. I will just show an example how we can do it, how we can use ChatGPT as a clinical assistant. So how clinicians can use AI in clinical decision support. We can generate differential diagnosis. We can structure and evaluate investigations. We can summarize the guidelines. We can identify red flags with the given information. We can prepare patient counseling points, and we can then finally we have to critically appraise the AI outputs. So this is a case scenario. This is a real case scenario. This patient is with me in my cardiothoracic ICU, and you may have different scenario. If any of you remember some scenario or you can make a hypothetical scenario, then you should actually do it. A 43-year-old male presents to the clinic with complaints of breathlessness on exertion, duration for the past couple of years, recent deterioration, recent onset palpitation, heart rate is 110, oxygen saturation is 98%, and yellowing of eyes and urine for the last 1 week. So we have to understand what is a good prompt. First, let's see what is a bad prompt. We have this information. How bad can our prompt be? What is the diagnosis? This is the worst prompt. What is the diagnosis? Generic input, generic answer. A patient comes to you, आप रेजिडेंट को कहते हैं यार देख लेना. रेजिडेंट सेज यार सर ने कहा है देख लेना, देखना में क्या है, क्या देखना है मेरे को. आई हैव टू गेट द इन्वेस्टिगेशंस, आई हैव टू ट्रीट द पेशेंट, I have to take the patient to the OR, या मेरे को patient, I have to admit the patient. So this is a very generic prompt, and this type of prompting we should not do. We should not confuse ChatGPT right at the word go. What would have been a good prompt? You are a senior physician and you use ACC-AHA guidelines. A 43-year-old male patient comes to you with progressive dyspnea, recent worsening, palpitations, heart rate is given, blood pressure is given, saturation is given. He has new onset yellow eyes, dark urine for 1 week. Do not give leading inputs like jaundice, icterus. Let us put in the actual patient language. Now generate. What do we want? We don't want diagnosis from you. We are capable enough to do diagnosis. Give me top 5 differential diagnosis, support and supporting and the opposing features, missing information, and the most evidence-based next step or the next investigation. So the quality of question defines the quality of answer. So we had this 4 tasks we gave. What additional history, next prompting, this is how I prompted up, this is an example of prompting. What additional history and examination is essential before ordering the investigations to establish the diagnosis? Then whatever I knew, I gave it to ChatGPT. Dyspnea kaisa hai, what type of, it is almost like how we used to present our long cases of medicine. Whatever information you have, give it to ChatGPT. Gradual onset, NYHA3, orthopnea present, no PND, no alcohol, general fullness, JVP is slightly raised, almost whatever you see in the patient, just write it. The strength is comprehensive questioning. You give a comprehensive input, you will get a comprehensive good output. And pitfall, information overload. बहुत सारी information चली जाती है, कई बार hallucinations भी आ जाते हैं इससे. Now the next step is load the lab results. What should we keep in mind before uploading the lab reports? Anything?
Lab reports पहले तो upload कैसे करेंगे? How you upload the lab report? In ChatGPT. PDF direct attach. Okay. और कुछ? Text copy करेंगे, वो भी कर सकते हैं. और कुछ?
De-identifying the patient.
It is called de-identifying the patient. Directly PDF upload करने जाओगे तो it's not practically possible. So before the putting anything in ChatGPT for about medical information, always de-identify the patient's information. कैसे करना है सर आप बताओ?
What I do usually is I take a photograph and crop it. Usually all the demographics, all the patient information is in the top band. You have to remove all the patient information, hospital name, even the barcodes. You do not know what the barcode is there for. Yeah. And even the consultant signature, the validation signature of pathologist and all. PNG तो होता है ना डाउनलोड. PNG इज अ फॉर्मेट तो होगा डाउनलोड. अच्छा .png दिखता है. हाँ व्हाट्सएप कई बार इट कैन नॉट रीड PNG. One more thing, you can actually say ChatGPT to prepare the infographic in .jpg file. PNG is more compatible with computers. TIFF is more compatible, is better compatible across all the platforms. But you can ask ChatGPT to give a .jpeg file also.
नहीं वो PNG JPG सब होता है, दोनों सेम ही है.
हाँ कभी
For the medical terminology, there is one is the
DICOM files.
Right? DICOM image. DICOM image is the in association with the data of the patients also. So we can directly can't put that into our any ChatGPT. So we have to de-identify that data and then we have to put the JPG or the PNG file into the ChatGPT, right? So we having a one is the sir ने बताया group करके कर सकते हो या तो you can directly copy paste that data. अभी आप just देखोगे तो once you having a just copy paste किया होता या तो copy किया है as a JPG file. Now if your internet is working, you having a now in photograph also, they having a Google Lens is there and you can directly copy paste the data also, right? So that can be also possible. Yes sir.
So this is a good prompt for uploading the lab results. Review abnormalities, identify clinically important patterns, What more investigations are required if the model thinks there is some deficiency, it will tell us. Do not provide the final diagnosis. I don't want final diagnosis right now. Cite the guidelines where relevant. So the pattern recognition is the strength here. And pitfall that, there can be OCR errors. 18 can be read 8, 8 can be read 18. Now we can put in chest x-rays. Chest x-rays, similarly, you can get a photograph on the view box, de-identify everything, the lower and the upper band, all the patient information, hospital information, even the date of clicking. So for the chest x-ray, do not put in the chest x-ray and say what is the diagnosis. Better set the boundaries, better give a guidance to the model. Cardiac size, pulmonary vascularity. It is similarly, it acts similar. If you remember in our long case, in the spotters, the examiner used to ask us, describe the chest x-ray. So we had to go in point by point, skeleton part, the mediastinal part, the lung shadows, the ribs. So this is how, so whole of the chest x-ray will be diagnosed, will be evaluated in seconds. So the strength here is a rapid description. And the pitfall here is hallucination. And what is hallucination? Hallucination is the pattern completion without awareness of uncertainty. Aapko, when we are second year, something like that, our senior used to say, यार कुछ आए चाहे नहीं आए तुमको यार क्वेश्चन का आंसर जरूर लिख के आना है. This is what we call, वो मैं अब थोड़ा सा retrogradely सोचता हूँ, तो that was actually hallucination. कि कुछ आने नहीं आना चाहिए यार, कुछ तो लिख के आना है वहाँ पर, छोड़ के नहीं आना. If you leave the question, there is 0 marks. If you give something, write something. If you write any crap, कुछ तो क्या पता वो आधा नंबर दे दे, आप आधे से फेल हो रहे हो, आप बच जाओ. So that was hallucination.
An important part when you are putting any such type of the lab report or X-ray, always give the clinical context. That is a very, very important thing, because only interpretation of the lab report or the any X-ray may not be practically possible. It will always hallucinate, because that X-ray will be interpreted by the ChatGPT something other. But if we give a continuous sequential prompting, just now in starting I say same thing is here. Starting with the case history, put that thing, ask the question, then give the lab diagnosis, ask the question, then coming to the X-ray or the sonography or any echo thing, you just and ask the question. If we do the continuous sequencing prompting, ChatGPT take the above context in below also. So it understand that this is all about the one patient, what is prescribed as a 43 year of having some cardiac failure, and uska ye sab details hai. So it will give an exact answer what we really want, so rather than giving one thing as a only X-ray or only lab report.
So if we are in the same chat, then it will understand the context. If you open a new chat and put in an X-ray, then we need to give the it a proper context. So I have a live example, not live, what happened with me, it's an example of hallucination. So this is a CT scan, SAG view of a patient, and I entered it as if I am taking the help of ChatGPT and I am the patient. So what I put in, I am a 75-year-old male with persistent productive cough with shortness of breath for past 15 days. I am also running low-grade fever since 15 days, but no weight loss. I do not have a prior lung disease. I am a smoker since 15 years. थोड़ा prompt कट गया इसके अंदर. I am my lung pulmonologist got a CT scan and I am enclosing the CT scan image. Can anybody make a diagnosis? See what is happening in this CT? Somebody from the surgical side or internal medicine, pulmonology side. मैंने इसमें mark भी कर रखा है ना. The problem here is this is the aorta. Can you appreciate this part? White part. Can you appreciate this white part? This is the aorta, this is ascending aorta, this is the arch of aorta, this is descending thoracic aorta, this is the abdominal aorta. So this patient was a case of thoracic aortic pseudoaneurysm, this part. That was the reason I did a stenting of this patient. So that was the reason I have measured the diameters for the stent. But this part is the problematic part. This is a pseudo-aneurysm. It is not a true aneurysm. There is a small outpouching here, and this is the neck. So I put it into the medical assistant 5. Sam Altman did a comment that medical assistant 5 is better than a PhD scholar some 1 year back. So I put this on a LinkedIn post. But unfortunately, it could not identify the most obvious thing, the most obvious pathology in this. I tried to give hints. Here comes the leading question. I am giving you a hint. Do you find anything abnormal in the aorta? Answer: I don't see obvious signs of aneurysm and dissection. You cannot actually make out what is in the blue box because it was more mobile friendly. Then I somehow dragged ChatGPT into believing that there is some problem in the aorta and this is something like intramural hematoma. Good job. Talk some abnormality of aorta. Locate the intramural hematoma you told me in the chat and mark only the IMH. Can you see what did this mark? The model marked yellow and red. This is yellow and this is red. Marks God knows what. Are you high on weed? You don't need medical knowledge to know which part of the scan depicts the body. The model marked this. ये मेरा computer screen है पीछे background में होगा something like that. तो यहाँ mark कर रखा the intramural hematoma. So this is how things hallucinate. So this is the comment. This is CEO of OpenAI, Sam Altman. What he said: ChatGPT-5 is a legitimate PhD expert. It can help you understand your healthcare better and make decisions for your journey. And this was in OpenAI multiverse. In the real universe, this patient is straight away, carried to the cath lab or the operating room, or there is a hearse van rather than an ambulance. So this is how things get hallucinated if you do not give proper prompting, we do not iterate continuously. So prompt for hospital admission, this whole of the scenario happened, and now we want whether the patient should be admitted or not. Bad prompt. Should I admit the patient? This is a bad prompt. A better prompt from my side would have been: you are a senior physician following the ACC guidelines. Should this patient be admitted? Also, as a part of cardiology training faculty, do you think there are the red flags the resident should identify in this patient which mandate hospital admission? Give the response in a bullet point format and decreasing order of importance. रेजिडेंट को सिर्फ इतना ही समझ में आता है कि बुलेट पॉइंट हमारे गाइड ने दे 5 पॉइंट बोले, ये हमको पता होना चाहिए. वी शुड बी नोइंग दीज 5 पॉइंट्स. सो गिव इट इन अ सिंप्लीफाइड मैनर फॉर अ रेजिडेंट डॉक्टर. So this is how I iterated. We have obtained few more lab results, interpret the result in background of previously uploaded results, summarize abnormalities, identify clinical important points. So this is how you gradually iterate.
An important part of the ChatGPT is that if you write repeatedly, I am so and so, I am so and so, he or it will be captured that this person is asking for this purpose only. Suppose I am the pediatrician and I am asking the being a senior pediatrician, I want this thing related to this my patient. So next time it will take that context. Okay, he is the senior pediatrician asking for that thing. So that's the advantage of the ChatGPT. But in this same time, if you want something other than this speciality, you have to give the proper prompting related to what your role is actually. So your role is very, very important and your context is very important.
So this is how we can we can use a good prompt to initiate management. Same, provide boundaries for guideline directed management. You need to put clear orders on management and stabilization of this patient. Suggest guideline directed initial management. In a bullet point format, suggest clinical finding and investigations to be recorded on a daily basis. ये भी होता है, सर मैं इस patient में हर रोज क्या देखूं? What should I see in this patient every day? I am in a multi-speciality hospital. I am in a medical college. So I am in a multi-speciality hospital. Also suggest any requirement for cross consultation. Give me response in a discrete manner. Bullet point without detailed description. Unnecessary. There is sometimes too much of description and you lose the focus. So this is the end game. Integrate all the information. Explain the reasoning and provide final diagnosis, alternative diagnosis, confidence level. top 5 diagnoses you can say, and missing information if any. If you want some other information, you can ask for the information. So before I end, a very important slide, 5 rules for clinicians using ChatGPT. AI is a co-pilot, not the pilot. You are the pilot. वो साथ में बैठा है आपका फॉर हेल्पिंग, वो आपको बताएगा पीछे से ट्रक आ रहा है, नहीं आ रहा है, साइड है या नहीं है, बट यू हैव टू ड्राइव इट एंड यू हैव टू ड्राइव इट विद कॉन्फिडेंस. Better prompts produce better medicine. The better the prompt, better the output, and better is your results. Upload responsibility and protect privacy. This is very important. Be patient, take a snapshot or Google Lens, whatever you take, delete, erase or whatever you do, but none of the patient information should go. None of the hospital information should go. No barcodes, no validating signatures. Ask AI to explain uncertainty. If you are uncertain, then you can ask, give me top 5 or arrange in a decreasing order, increasing order, and always verify against clinical judgment and guidelines. You have to independently verify. We are not in a position at present we are not in a position to blindly accept all the AI outputs. Ladies and gentlemen, thank you very much for your kind patience.
So we having a just 5 minutes break, and then we will meet again.
Shape your clinical practice. Will it entirely eliminate your administrative backlog? Will it help you discover hidden life-saving connections in your patient data? The potential is absolutely staggering. With the right precautions in place, it's not just a new tool, it is an entirely new paradigm for medical professionals.
So this is all about what the notebook LM is, right? So this is the only my theory. Now everything we are going to for the next 1 hour is the practical. So you have to open your own notebook LM. कहाँ पे जाना है, कहाँ खोलना है. Everybody has opened this notebook LM. Ready with your notebook. आपका Google account खोलिए. मैं वापस बता रहा हूँ. Be speed now. आपके Google account, Gmail account खोलिए. Google account में राइट साइड पे आपको दिखेगा 4 जो आप डॉट्स दिखेंगे. डॉट्स पे क्लिक करने का है. डॉट्स पे क्लिक करके नीचे जाओगे तो आपको नोटबुक LM यहाँ पे दिख जाएगा. तो यू आर ऑलरेडी हैज़ योर नोटबुक LM अकाउंट, तो डायरेक्टली क्लिक ऑन दैट. खोल लिया. रेडी. नाउ हाउ मेनी ऑफ यू रियली थिंक कि आप इतना अच्छा वीडियो अपने आप खुद बना पाओगे? हाउ मेनी ऑफ यू? So after this completion of this notebook LM thing, you are definitely going to make whatever the things what I had made from notebook LM. You can do that thing. But what that you have to understand what are the anatomy, what is the physiology, and how we can implement in our regular practice. So at presently we are forgetting about our own clinical sides. We are not the pediatricians, we are not at all the ophthalmologists, not the gynecologists. We are at presently are the AI enthusiast, right? हमको AI सीखना है, तो हम लोग नोटबुक LM से ही सीखेंगे कि उसको कैसे बनाना है. Clear? Okay. So let's go for the basic anatomy that what you have to understand. नोटबुक LM का पूरा ऊपर पहले ये सब दिख रहा है, उसमें आता है क्रिएट नोटबुक, राइट? दिखा क्रिएट नोटबुक सबको? Click on that thing, create notebook. Create notebook आएगा तो उसके अंदर आपको इस तरह का दिख रहा है आपके ऊपर सब में, right? Now you have to write whatever the things what we want to do, learn. So we at presently what we want to learn all about the notebook, right? So we are directly searching here into the web as a fast search. So we have to just write down here, please give all detailed references related to notebook LM that guide me to understand it better. लिख दिया. अगर किसी को दिक्कत आती है, मैं कॉपी पेस्ट करता हूँ एक प्रॉम्प्ट, आप कॉपी पेस्ट कर लीजिए। अपने व्हाट्सएप में मैंने कॉपी पेस्ट किया है। इफ यू हैविंग ए डिफिकल्टी टू राइट, you can directly copy paste that also. Then just click on this arrow and see what is happening. So this is the our source side. Here it start the researching the website and give the all the references what we want. It's how much it started. It's given the first 7 important resources, right? Have you all got that? मिल गया सबको? आपके बाजू में देखना चालू करिए सर, वो भाई साहब दिखाएंगे आपको। यू जस्ट सी एंड जस्ट सी, दैट इज द थिंग, राइट? सो यू विल गेट दैट। सो पहले क्रिएट नोटबुक, अपना प्रॉम्प्ट डाल दिया एंड वी विल गेट दिस रिसोर्सेज। नाउ व्हाट वी हैव टू डू, इंपोर्ट। तो उसने ऑल इंपोर्ट कर दिया। अभी देख रहे हो वो इंपोर्ट हो रहा है। आपके यहाँ भी इंपोर्ट हो रहा है? आ गया इंपोर्ट, ओके, सिलेक्ट ऑल करके आ गया। सो दिस इज अवर रिसोर्स मीन्स सोर्स मटेरियल। सो नोटबुक LM इज वर्किंग ऑन दी व्हाट दी सोर्सेज व्हाट वी आर गिविंग एंड दैट इज कॉल्ड RAG, रिट्राइवल ऑगमेंटेड जनरेशन, राइट? एंड दैट्स अ थिंग। अभी हम लोगों ने जो ये नक्की किया है उसके अंदर से ही डिटेल अपने को देगा। तो देन सेकंड मिडल पार्ट इज कमिंग इज अ चैट। तो जैसे ही हम लोगों ने रिसोर्स डाला उसके बेस पे उसने कुछ बनाना चालू कर दिया। नोटबुक मास्टरी ऑडियो ओवरव्यू एंड प्रॉम्प्ट इंजीनियरिंग स्ट्रेटजीज, और उसके बारे में पूरा डिटेल उसने डाल दिया। पढ़ना जरूरी नहीं है, क्या आया वो देखना जरूरी है। यहाँ तक पहुँच गए, बराबर है? क्लियर, राइट? क्या अभी कुछ नहीं आया? अभी तो कहाँ कुछ किया, अभी तो रिसोर्स ही डाला हमने, अभी तो बहुत सारी चीज़ बाकी है। अभी तो हमने पहले लेफ्ट साइड का पैनल देखा, मिडल पैनल देखा, राइट? 2 चीज़ तैयार हो गई अपनी। वन इज दी सोर्स, सेकंड इज दी चैट। अभी राइट साइड पे देखोगे तो अभी नेक्स्ट आएगा स्टूडियो, बराबर? राइट पैनल इज स्टूडियो, दिख रहा है सबके अंदर स्टूडियो? लास्ट नहीं दिख रहा है? जैसा देखा है वहाँ स्टूडियो दिखाने का है। राइट साइड पे आपका छोटा हो गया होगा, उसको एक्सप्लेन करना है। यू जस्ट गो पे आपको स्टूडियो के बाजू में, यहाँ देखिए मेरा कर्सर कहाँ पे है, क्लिक ऑन दैट थिंग। मेरे कर्सर पे देखो, वो कर्सर पे यहाँ पे क्लिक करिए तो ये ओपन होगा, खुल जाएगा, ओपन होगा, खुल हो जाएगा। सर अक्षय भाई वहाँ आया सबका, बराबर है? सो अभी अपने को देखना है स्टूडियो। नाउ इम्पोर्टेंट थिंग इज कि सोर्स कौन सा लेना है वो भी अपने हाथ में है। ये सब सिलेक्ट ऑल किया तो सब आया, बट जरूरी नहीं है कि सब सोर्स लेना है। तो इफ़ वी सिलेक्ट अनसिलेक्ट इट विल सिलेक्ट दी व्हाट आर दी सोर्सेज, अकॉर्डिंगली वो सब चीज़ बनाएगा। सो उसको हम लोग सिलेक्ट ऑल एट प्रेजेंटली रख रहे हैं कि जिसकी वजह से अपने को मैक्सिमम अच्छा आउटपुट मिले, बिकॉज दिस आर दी रिसोर्सेज दैट इज गिवन डायरेक्टली फ्रॉम दी नेट। तो अपने पास रिसोर्स तैयार है, बेस चीज़ तैयार है। अभी अपने को क्या क्या बनाना है वो डिफरेंट कैटेगरी स्टूडियो में। यहाँ पे हम ऑडियो फाइल भी बना सकते हैं, स्लाइड भी बना सकते हैं, वीडियो भी बना सकते हैं, माइंड मैप भी बना सकते हैं, रिपोर्ट भी बना सकते हैं, फ्लैश कार्ड भी बना सकते हैं, क्विज भी बना सकते हैं, इन्फोग्राफिक भी बना सकते हैं, डेटा टेबल भी बना सकते हैं। तो दिस आर दी ऑल दी थिंग्स दैट वी कैन एबल टू डू। साथ साथ में विच लैंग्वेज, कौन सी लैंग्वेज में बनाना है वो भी यहाँ पे आता है। एंड ऑलमोस्ट ऑल दी वर्नाक्युलर लैंग्वेज ऑफ इंडिया इज नाउ कवर्ड इन नोटबुक LM, राइट? क्लियर कंसेप्ट टिल नाउ? आ गया? या श्योर। आपका स्टूडियो दिखा, तो स्टूडियो के अंदर आप देखोगे तो क्रिएट दी ऑडियो ओवरव्यू, कौन कौन सी स्टाइल में डालना है वो दिख रहा है, कौन सी लैंग्वेज, एनी लैंग्वेज यू कैन सिलेक्ट एंड इट कैन बी प्रिपेयर इन एनी लैंग्वेज. सेकंड थिंग, यू कैन हैविंग ए सम ऑडियो फाइल, पॉडकास्ट बनाएगा 2 लोगों की बातों करता करता. दूसरा आएगा स्लाइड डेक, 10 स्लाइड का मैक्सिमम 13 स्लाइड का स्लाइड बना सकता है, इससे ज़्यादा नहीं बना सकता. देन वीडियो क्रिएशन एक्सीलेंटली, अभी आपने देखा 8 मिनट का पूरा वीडियो उसने ही बनाया, मैंने कुछ नहीं किया उसके अंदर, मैंने सिर्फ इनपुट्स डाले थे, बाकी का आउटपुट उसने दिया. देन माइंड मैप, कितने लोगों को माइंड मैप मालूम है? हाउ मेनी नो अबाउट दी माइंड मैप? सिखाएंगे क्या है, ठीक है, डोंट वरी. देन रिपोर्ट क्रिएशन, पूरा रिपोर्ट बना के देगा अगर अपने हम लोग कुछ मांगते हैं तो. वी कैन हैव ए फ्लैश कार्ड ऑल्सो, क्विज भी बना सकते हैं, इन्फोग्राफिक्स भी बना सकते हैं एंड डेटा टेबल भी बना सकते हैं. हम रफ डेटा उसके अंदर डालेंगे, पूरा डेटा अपने को बना के देगा. क्लियर? ओके टिल नाउ? ओके. सो पहले अपने को जस्ट वीडियो एंड ऑडियो फाइल पहले बनाते, बिकॉज वो बनने में टाइम लगता है. तो नाउ जस्ट ओपन दी वीडियो पे, यहाँ जो एरो है उसको क्लिक करिए. किया ओपन वीडियो. अभी इसके अंदर उसका अलग अलग फॉर्मेट आता है, सिनेमैटिक है, एक्सप्लेनरेबल है और सम ब्रीफ बनाना है. सेकंड थिंग, वीडियो के अंदर अपने को क्या क्या बनाना है, हाउ वुड यू लाइक टू बी बिकम द वीडियो टू बी कस्टमाइज. आप अपनी अपनी मर्जी के हिसाब से नीचे प्लस प्लस आ रहा है, अपनी मर्जी से लिख भी सकते हो जो आपको लिखना है. अगर आपको लिखने में भी फील कन्फ्यूजन है तो ये अपने को ऑप्शन भी देता है कि हम लोग इसको करते हैं. जैसे मैं लिखूंगा बिगिनर ऑफ ओवरव्यू, तो वो डालेगा कि भी ये आएगा. उसके बाद में बोलेगा रिसर्च एंड डीप डाइव, तो ये भी आ जाएगा. लिखा हुआ डायरेक्टली आता जाएगा. प्रैक्टिकल एक्शन प्लान, तो प्रैक्टिकल एक्शन प्लान. यू कैन क्लिक एनीथिंग टू यू, तो सब लोगों का अलग अलग वीडियो बनेगा. जस्ट नीचे के जो 3 है वो आप अपने हिसाब से क्लिक करिए, जो भी चीज़ है. आ रहा है सबको? एनीबडी यस, एनी क्वेरी? यस. क्या स्टडी पहले वो पहले आप ये जो वोट हाउ के नीचे जो आ रहा है उसकी बात करें. हाँ, तो वही बता रहा हूँ ना, वो आप कुछ भी टाइप कीजिए, आपको जो इच्छा हो. यहाँ पे देयर इज अ थिंग, यहाँ पे आपको डायरेक्टली आप खुद भी टाइप कर सकते हो. जैसे मैं अभी टाइप कर रहा हूँ, तो यू कैन टाइप योर ओन विश ऑल्सो. और अपने को सपोज मालूम पड़ेगा वीडियो के अंदर क्या दिखाना है नहीं मालूम है, तो आपको यहाँ पे ऑप्शन दिखता है, मेरे में कुछ दिखेगा, आप में कुछ दिखेगा. यू कैन चूज़ योर ओन. तो सबका वीडियो अलग बनेगा, ज़रूरत नहीं है सेम वीडियो आएगा. डिपेंड्स ऑन योर चॉइस. क्लियर? तो 3-4 चीज़ ऐसा करके छोड़ दो, तो एटलीस्ट वी कैन हैविंग सम डेमो वीडियो बन जाएगा. रेडी? उसके बाद में क्लिक करना है जनरेट. इसके पहले एक चीज़ बता दूँ, या नाउ इट इज दी जनरेट. क्लियर? तो उसने नीचे अभी वीडियो बनाना चालू कर दिया, दिख रहा है? राइट, वो अभी अपने को छोड़ देते हैं. रेडी, वीडियो बन रहा है. अभी उसके साथ साथ में अपने को बनाना है ऑडियो भी. राइट, सो लेट्स क्लिक ऑन दी ऑडियो. अगेन वही चीज़ आएगा, अलग अलग चीज़. डीप ड्राइव चाहिए, ब्रीफ चाहिए, क्रिटिक्स चाहिए, डिबेट चाहिए. आपको डिबेट करना है तो डिबेट भी कर सकते हैं, डीप ड्राइव करना है तो डीप. सपोज हम डिबेट लिखते हैं, यहाँ ऑप्शन आपको आएगा चूज दी लैंग्वेज, कौन सी लैंग्वेज चाहिए. यहाँ पूरी सब लैंग्वेज आ जाती है. चूज़ योर ओन लैंग्वेज. एज प्रेजेंटली मैं इंग्लिश चूज़ करता हूँ, कोई मराठी चूज़ करो, कोई हिंदी चूज़ करो, कोई भी चूज़ करो. रेडी? चूज़ कर लिया लैंग्वेज. बाद में लेंथ आपको छोटा सा चाहिए या तो डिफ़ॉल्ट चाहिए. डिफ़ॉल्ट मीन्स उसकी अपनी कैपेसिटी उसके हिसाब से करेगा. अभी हमने डिफ़ॉल्ट रखा. रेडी टिल दिस थिंग? कोई कन्फ्यूजन है तो रेज दी हैंड. यस, आप आपका लैपटॉप लेके यहाँ पे आ जाइए तो सर जाते हैं. यहाँ आप आगे आ जाइए तो आई विल गाइड यू. उसके बाद में जब तक सर सिखा रहे तब तक नीचे अपने अगेन व्हाट शुड दी एआई होस्ट फोकस ऑन दिस एपिसोड, किसके ऊपर फोकस करना है। अगेन नीचे आपके पास ऑप्शन है, अगर आपको ऑप्शन नहीं लेना है आई फोकस ऑन के व्हाट आर दी डिफरेंस बिटवीन दी LLM एंड दी नोटबुक LM, तो मैं करता हूँ फोकस गिव डिटेल्स अबाउट डिफरेंट बिटवीन नोटबुक LM एंड LLM। ठीक है, मैंने ये डाला, आप लोग कुछ भी डाल सकते हो, डिपेंड्स ऑन दैट, राइट। देन अगेन क्लिक ऑन जनरेट, हो गया, बाकी सबका हो गया, रेडी। हर टेबल से सब लोग एक बार हाथ रेस करते जाओ तो मालूम पड़े यार हुआ कि नहीं हुआ, नहीं तो एक तो इसमें ही सुन रहे और यहाँ पे मालूम आप बोल भी नहीं रहे तो मालूम नहीं पड़ेगा, राइट। सो अपना एक बन रहा है वीडियो, बन रहा है दूसरा, बन रहा है ऑडियो, बराबर जनरेट कर रहा है, अभी उसको थोड़ा टाइम लगेगा। अभी नेक्स्ट आते हैं स्लाइड डेक, सब लोगों को अट्रैक्टिव स्लाइड देखने की इच्छा होती है, राइट। सो लेट्स मेक अ स्लाइड डेक, अगेन क्लिक ऑन दैट स्लाइड डेक, अगेन आएगा डिटेल डेक चाहिए या तो प्रेजेंटर स्लाइड चाहिए। अगेन इट विल गिव द इंग्लिश, हिंदी, जो भी लैंग्वेज आपको चाहिए उसमें, सपोज मैं इसमें लिखता हूँ हिंदी, रेडी, आ गया, रेडी, ओके। सो अभी मैंने लैंग्वेज इसमें चूज किया हिंदी, डिफ़ॉल्ट रखा है। स्लाइड डेक में मेरे को क्या चाहिए, तो इसमें वी हैव टू स्पेसिफिकली डिस्क्राइब क्या चाहिए अपने को, तो मैं लिखूंगा इन लेंथ डिटेल्स अबाउट नोटबुक LM that I can present next day, ready। और इसमें लिखते हैं जनरेट, कर दिया सबने स्लाइड डेक जनरेट। किसी का कोई जनरेट हुआ अभी तक, कि सबका जनरेट हो रहा है अभी, राइट। एंड दैट्स वाई वी हैड स्टार्टेड फ्रॉम द वीडियो, वीडियो सबसे लास्ट में, बाकी सब जनरेट हो जाएगा, वीडियो सबसे लास्ट में जनरेट आता है, इसके लिए वी आर स्टार्टिंग फ्रॉम दैट। तो आपका ऑडियो का काम चालू हो गया है, आपका स्लाइड डेक का काम चालू हो गया है, आपका वीडियो का काम चालू हो गया है, राइट। अभी माइंड मैप पे बाद में जाते हैं, बिकॉज काफ़ी लोगों को नहीं मालूम है, तो उसको मैं बाद में समझाता हूँ। नाउ हाउ मेनी ऑफ यू नो दी फ्लैश कार्ड, राइट। फ्लैश कार्ड फ्लिप करता रहेगा, वो फ्लैश कार्ड है, तो उसका फ्लैश कार्ड बनाते हैं। क्लिक ऑन अगेन राइट साइड, नंबर ऑफ दी स्टैंडर्ड डिफ़ॉल्ट, उसमें जितने हो गए 10 वगैरह बनते हैं, इतने ही बनेंगे। मोर बनाना है तो मोर भी बना सकते हैं। डिफ़िकल्टी लेवल कितना चाहिए, मीडियम या चाहिए या कितना चाहिए, एंड इसमें डालना है कि किस तरह का फ्लिप कर किसके लिए चाहिए। अगेन डिटेल्स अबाउट नोटबुक LM, आप कुछ भी लिख सकते हैं, दैट इज़ नो डाउट। आपको नोटबुक LM के डिटेल में हमने रिसोर्स दिया है, तो नोटबुक LM के बारे में आप कुछ भी पूछ सकते हैं। यहाँ लिमिटेशन है कि इसके बारे में और कुछ पूछना चाहेंगे तो वो नहीं मालूम उसको, अभी वो नोटबुक LM के बारे में ही बताएगा, ठीक है। एंड लेट्स क्लिक ऑन जनरेट, ये फटाफट बन के आएगा। अभी आएगा क्विज। अभी आप लोगों ने एक्चुअली क्या क्या मेरे लेक्चर में से सीखा था, ये क्विज अब हम लोग एक्चुअल करके देखेंगे कि आप लोगों को आता है कि नहीं आता है। सो नंबर ऑफ द क्वेश्चन स्टैंडर्ड रख रहे हैं मीडियम, इसमें ज़्यादा कोई कन्फ्यूजन नहीं करते हैं। डिटेल अबाउट एनाटॉमी, फिजियोलॉजी, क्लिनिकल एप्लीकेशन ऑफ नोटबुक lm. Okay, and then generate. देखो यहाँ पे अपना फ्लैश कार्ड बन के तैयार हो गया है. कितने लोगों का हो गया नोटबुक एलएम का? ओपन करिए. ओपन किया तो यहाँ पे अपने को दो चीज़ है, लार्ज विंडो भी दिख रहा है और शॉर्ट विंडो भी होता है. तो एक्सपांडेड इनटू द व्यूअर, ये राइट साइड पे मेरा कर्सर देखिए कहाँ पे क्लिक करना है. क्लिक ऑन दैट थिंग, तो इट विल गिव अ फुल स्लाइड्स बेस डेक. अभी उसके बेस में आपको क्या है, सही है गलत है, वो आप डाल सकते हैं. जैसे उसके ऊपर क्लिक करोगे, व्हाट इज द फर्स्ट क्वेश्चन केम इज which specific language, large language model architecture served as a underlying engine of notebook LM. notebook LM किसके ऊपर काम करता है? So it is structured on Gemini. Next question is what is a maximum token context window supported by Gemini 1.5 Pro? क्या आंसर आएगा? क्या आंसर आएगा? 2 मिलियन टोकन वीडियो में था, इफ यू रिमेंबर राइट. तो दिस मच टोकन यू कैन जनरेट. देन आएगा हाउ डज द सोर्स ग्राउंडिंग डिफर फ्रॉम द ट्रेडिशनल रेग चंक एंड रिट्राइवर वर्क फ्लो. मीन्स सोर्स ग्राउंडिंग एंड ट्रेडिशनल रेग, इसमें क्या डिफरेंस है? तो क्या आंसर आएगा? इट इंटीग्रेट्स एंटायर डॉक्यूमेंट टू मेंटेन स्ट्रक्चरल इंटीग्रिटी रेदर देन ब्रेकिंग देम इनटू ए स्मॉल सेगमेंट. रेग में क्या करता है, वो छोटे छोटे सेगमेंट में डाल के उसके बेस पे बनाता है, वो है वो पूरा स्ट्रक्चर एज इट इज रखता है. नेक्स्ट, व्हाट टाइप ऑफ द न्यूरल नेटवर्क आर्किटेक्चर अलाउ जेमिनी 1.5 Pro to efficiently by only archiving a subset of its pathway? It is a mixture expert MOE, right? This is the slightly theoretical, हम जाने देते हैं. So this is all about the flash card. समझ में आ गया? फ्लैश कार्ड के बाद में और कुछ जनरेट हुआ है, क्विज जनरेट हो गई है. कितने लोगों की क्विज जनरेट हो गई? राइट. अगेन खोलिए नोटबुक की क्विज, उसको आप डायरेक्टली एक्सपांड करके यहाँ पे एडिशन भी कर सकते हैं. राइट. तो हियर एडिट का ऑप्शन है आपको. अगर यहाँ पे आपको लगता है कि नहीं कोई आंसर आपको प्रॉपर नहीं लग रहा है, चेंज करना है, तो आप चेंज कर सकते हैं. बराबर है. दूसरा यहाँ पे आपको क्रॉस है क्लोज करने के लिए. तीसरा यहाँ पे मोर ऑप्शन है, क्लिक करो मोर ऑप्शन पे, तो यहाँ पे डिलीट आता है. तो इफ़ यू नॉट इंटरेस्टेड कि ये नहीं बराबर बना, यू कैन डिलीट ऑल्सो. देन यू कैन चॉइस वेदर द गुड कंटेंट और बैड कंटेंट. तो अभी टेम्पररी उसको अपना हम क्लोज करते हैं. अभी नोटबुक एलएम क्विज के अंदर मोर के अंदर आपको ये 3 पॉइंट्स दिखेंगे. दिख रहा है 3 पॉइंट्स, उसके ऊपर क्लिक करिए. जो क्विज आपकी बनी उसके ऊपर राइट साइड पे 3 पॉइंट्स है, उसको क्लिक करिए. तो यहाँ पे आप उसका रीनेम कर सकते हैं, इसको आप शेयर भी कर सकते हैं. जैसे मैंने यहाँ पे क्लिक किया शेयर, शेयर को करेंगे, यहाँ पे आपका ऑप्शन आएगा रिस्ट्रिक्शन एनीबडी विथ लिंक एंड पब्लिक, जैसे गूगल क्विज में आता है. इट इज़ दी एनीबडी विथ लिंक, एंड उसको हम लोग सेव करते हैं. अगेन वो क्विज को अभी हम शेयर कर सकते हैं. कॉपी दी लिंक टू दी आर्टिफैक्ट, और अपने कहीं पे भी किसी भी अपने ग्रुप में भेजना है कि चलो ये आप क्विज करो, तो यू कैन क्लिक दैट थिंग, और डायरेक्टली क्विज आपका अटेम्प्ट कर पाएगा. तो यू कैन यूटिलाइज इन योर रेगुलर प्रैक्टिस ऑल्सो, इन योर लोकल प्लेसेस ऑल्सो, इन योर हॉस्पिटल ऑल्सो, बाय नर्स के लिए, यू कैन फॉर दी मेडिकल स्टूडेंट के लिए भी. तो ये आपकी क्विज डायरेक्ट शेयर हो गई इन व्हाट्सएप. क्लियर? वापिस बता, आपकी एक क्विज, इस पे 3 पॉइंट्स है, उसको क्लिक करिए। यहाँ पे शेयर आया, शेयर पे क्लिक किया। शेयर के बाद इसमें एक्सेस किन को आपको देना है, तो यहाँ पे ऑप्शन आता है एनीबडी भी। इसको नीचे डाउनलोड करोगे तो 3 ऑप्शन है, रिस्ट्रिक्टेड स्पेसिफिक लोगों को भेजना है, एनीबडी विथ लिंक करना है और पब्लिक करना है। एनीबडी विथ लिंक अभी मैंने करके अपने ग्रुप में डाला। अभी आप जस्ट ओपन योर व्हाट्सअप, आपका व्हाट्सअप खोलिए, उसमें क्लिक करिए वो लिंक को, मैंने जो अभी भेजा है वो, और क्या खुल रहा है देखते हैं। यहाँ पे आया रिक्वेस्ट एक्सेस, आता है ऐसा? नहीं आता, डायरेक्टली खुल रही है। परफेक्ट। खुला क्विज, बाकी किसी और ने भी क्विज शेयर करना चालू किया, वेरी गुड। तो अभी सब लोग अपनी अपनी क्विज सबको अपने अपने ग्रुप में भेजना आज रात को, देखते हैं कितने लोगों को नोटबुक के बारे में मालूम है। यस, रिक्वेस्ट एक्सेस आया तो उसमें ग्रांट करना है। इट विल टोटली डिपेंड्स ऑन एडिटर्स। तो एडिटर एक्सेस करेगा, यस करेगा तो आपको दिखेगा, मैं बता रहा हूँ। यहाँ पे आया कि व्यूअर और एडिटर, बहुत यहाँ पे मैं बोलूँगा रिक्वेस्ट एक्सेस, यहाँ पे मैं डायरेक्टली भेजता हूँ तो डेट विल बी डायरेक्टली गो टू दी नोटबुक एलएम के अंदर, मेरे वहाँ पे जाके रिक्वेस्ट एक्सेप्ट करना आएगा। बट इट इज़ दी डायरेक्टली एडिटर्स राइट कि आपको एक्सेस देना है कि नहीं देना है। भाई एडिटर ने यस बोला तो आपको आएगा। अभी मैंने ओपन रखा है इसके लिए आया, बिकॉज अभी मेरे में नहीं खुल रहा है, बिकॉज डबल चीज़ एक ही जगह पे नहीं खुलता है, इसके लिए मेरे को रिक्वेस्ट एक्सेस मांग रहा है। बट आपके अंदर डायरेक्टली खुलेगा, बिकॉज मैंने ऑप्शन डायरेक्टली वही डाला है, एनीबडी विथ लिंक, राइट। रिक्वेस्ट ऐसे आया तो उसमें आपको एक्सेस में एक्सेप्ट करो तो वो डायरेक्टली मेरे पे ईमेल में आएगा, मैं एक्सेप्ट करूँगा तो आपको दिखेगा। ठीक है, क्लियर? इसमें क्या है, चले आगे। अब तक क्लियर? यहाँ पे अभी अपना स्लाइड भी तैयार हो गया है। कितने लोगों की स्लाइड तैयार हुई है? चलो उसको देख लेते हैं। मैंने बोला था मेरा हिंदी में, तो दिस इज दी मास्टर क्लास नोटबुक एलएम की स्लाइड तैयार है मेरे पास। आप कितने भी एक्सपर्ट हो पीपीटी में, इज इट पॉसिबल टू क्रिएट सच टाइप ऑफ द प्रेजेंटेशन? नहीं बना सकते? अभी आप लोगों ने बनाया, आपकी स्लाइड देखिए। आप लोगों की बनी है स्लाइड, किसकी स्लाइड बन गई है? देखा? सेटिस्फाई विथ दैट ऐसा बन सकता है, नहीं बनेगा, बाकी तो प्रैक्टिकली पॉसिबल नहीं है। कुछ भी करना चाहो ऐसे हिंदी में मैं कहाँ लिखने जाऊँगा, मेरे को हिंदी टाइपिंग ही नहीं आता है, राइट। तो ये डायरेक्ट हिंदी मेरे पास पूरा तैयार है। ग्रेट। पूरा हिंदी में 10 स्लाइड का डेक उसने बना के दिया। मेरे को अभी कल प्रेजेंट करना है तो कर सकता हूँ, लेकिन मेरे को ये प्रेजेंट नहीं करना है। सो देयर आर दी डिफरेंट थिंग दैट व्हाट यू कैन क्रिएट। चलो इसको भी हम क्लोज कर देते हैं। यानी अभी अपना आ गया, नोटबुक का मास्टर क्लास बन गया, क्विज बन गया, फ्लैश कार्ड बन गया, वीडियो ओवरव्यू अभी और कुछ बना रहा है। अभी यहाँ पे अपने हम लोगों ने वो पॉडकास्ट बनाया था, राइट, डिबेट वाला। देखते हैं वो क्या करता है।
Welcome to the debate. Imagine you are standing in the center of a massive chaotic library containing, millions of documents, research papers, financial records, you name it.
Right, just the total mountain of data.
2 people?
Exactly.
2 person.
Now, if you ask a traditional AI assistant a complex question about all that data, It essentially sends a remarkably fast runner to just sprint through the stacks.
कितने
That
मिनट
runner
का
grabs,
डिबेट बनाया
you know,
देख लो.
a handful of torn pages that seem
22 मिनट्स
relevant
का,
based on a few
22 मिनट्स
keywords,
का बनाया.
sprints back, and then
And weaves those scattered scraps into a highly plausible story.
right, a highly plausible, confident story. That is how most AI works today. But if you use Notebook LM, you are
पूरा बाद में मैं शेयर करूँगा, पढ़ सुन लेना. 22 मिनट बिगाड़ नहीं सकते. बट आप सबका भी बना. You all are having a that video audio. प्रीफर लैंग्वेज कौन कौन सी? मराठी किसने किया था? मराठी आया मराठी बराबर लैंग्वेज है, राइट? तो इट इज़ दी गुड वर्नाकुलर लैंग्वेज ऑल्सो. तो दैट इज़ द एडवांटेज ऑफ नोटबुक LM. अपने को जो चाहिए उसको मांगना है, वो अपने हिसाब से बना के देगा. ओनली प्रॉब्लम इज के वो उसको चाहिए वो बना के देगा. डिपेंड्स ऑन आवर प्रॉम्प्ट. तो अपने को अगर अपनी चीज़ चाहिए तो प्रॉपर प्रॉम्प्ट देना पड़ेगा, देन एंड देन वो बनाएगा. एंड दैट इज़ दी ओनली लिमिटेशन ऑफ नोटबुक LM, राइट? अभी अपनी PPT प्रेजेंटेशन का एक चीज़ बताना रह गया. ये अपना PPT प्रेजेंटेशन है, राइट? उसको हम लोग डाउनलोड भी कर सकते हैं, आइदर इन दी PDF फॉर्मेट और PPTX फॉर्मेट, राइट? क्लिक किया PPT फॉर्मेट में, डायरेक्टली यहाँ पे PPT बन के तैयार हो रहा है, राइट? तो अभी नोटबुक LM में पहले 3-4 महीने पहले ओनली PDF डाउनलोड होता था, PPT नहीं होता था. नाउ दे आर एडवाइज गिविंग दी PPT फॉर्मेट ओनली, ऑल्सो ओनली नहीं. बट ओनली प्रॉब्लम दिस PPT इज नॉट एडिटेबल बिकॉज दे आर दी JPG फाइल्स, यानी पिक्चर्स है. उसको कैसे करना है वो थोड़ा एडवांस रहेगा चेंज, तो वो अभी हम डिटेल में नहीं जाते. बट एटलीस्ट यू कैन यूटिलाइज दैट योर फाइल, राइट? क्लियर टिल नाउ? नोटबुक LM तो आधा समझ में आ गया, अभी आधे पहुँचे, पूरा बाकी है, इसके लिए आधा बोला मैं. सो लेट्स मूव फॉरवर्ड. अभी अपने को 2 चीज़ बनाना बाकी है. एक तो रिपोर्ट बनाना बाकी है और इन्फोग्राफिक्स बनाना बाकी है. तो सर ने अभी आपको इन्फोग्राफिक्स कुछ बनाने का सिखाया था. हम यहाँ पे अभी क्लिक करते हैं इन्फोग्राफिक्स को. लेट्स सी वो क्या बनाता है. तो यहाँ पे क्लिक ऑन दी इन्फोग्राफिक्स. इसमें अगेन आपको लैंग्वेज पूछता है, कौन सी लैंग्वेज में रखना है. ऑल दी वर्नाकुलर लैंग्वेज, चूज एनी लैंग्वेज. लैंडस्केप करना है, पोर्ट्रेट करना है, स्क्वायर करना है. लैंडस्केप मीन्स हॉरिजॉन्टल, पोर्ट्रेट मीन्स सीधा, एंड स्क्वायर एग्जैक्टली स्क्वायर. अगेन वो कैसे करना है कि आपको खुद से यानी माइक ले लो. ऊपर है.
हाँ. So basically you have to keep in mind where do you want to use this infographic. The YouTube infographic is 16:9 format that won't do any favor in the Instagram. So you need to keep this in mind. You should have a complete idea कि मैं इसको कहाँ पे पोस्ट करूँगा, कहाँ यूज़ करूँगा. नहीं तो बाद में उसको you have to change the aspect ratio, it becomes a mess.
Right. So
नहीं, आपको you should be knowing. See, on Instagram you can post 4:3 format or a square format. And Instagram mostly we use on mobile. We don't use on our laptops. YouTube, we tend to see the YouTube videos like this.
Horizontal.
In a landscape mode. Instagram and Facebook we tend to use like this. So अपने को ये पता होना चाहिए कि मैं इसको Instagram पे डालूंगा तो मैं इसको square format रखता हूँ, या मैं इसको YouTube वीडियो में डालने वाला हूँ तो YouTube वीडियो either you see on your laptop or you see like this. तो उसका aspect ratio 16:9. जैसे मैंने एक chat GPT वाली स्लाइड में दिखाया था ना, एक aspect ratio we can change.
You can choose accordingly. Right. Again, स्टाइल कौन सी रखनी है आपको. देर आर दी डिफरेंट स्टाइल का ऑप्शन भी आपको दे रहा है. यू कैन चूज़ एनीथिंग और उसको खुद को चूज़ करने का चांस भी दे सकते हैं. सपोज मैं लिखता हूँ एक कव्वाली, क्लिक करता हूँ, मेरे को वो पसंद आया कुछ, तो अभी मैंने वो क्लिक किया. यू कैन चूज एन नंबर ऑफ, बिकॉज इट इज़ टोटली फ्री. अगेन व्हाट आई एम सेइंग, एन नंबर ऑफ टाइम यू कैन प्रिपेयर एनीथिंग, नो चार्ज एट ऑल. एटलीस्ट नेक्स्ट मंथ तक तो है, उसके बाद में मालूम नहीं. देन व्हाट इज द लेवल? कंसाइज चाहिए, स्टैंडर्ड चाहिए, डिटेल चाहिए. सर ने अभी बताया था किस तरह का चाहिए. तो अकॉर्डिंगली स्टैंडर्ड, एट प्रेजेंटली वी आर कीपिंग स्टैंडर्ड. देन डिस्क्राइब द इंफोग्राफिक दैट यू वांट टू क्रिएट. क्या बनाना है वो आपको खुद को क्रिएट लिखना पड़ेगा, यहाँ पे वो लिखना पड़ता है. तो क्रिएट, क्या लिखेंगे? डिफरेंस बिटवीन LMM and notebook and other GPTs, right? And let's see generate. अभी उसको बनाने का छोड़ देते हैं, वो बन रहा है. Then coming to the अपना रिपोर्ट जनरेट बेस्ड ऑन दी योर रिसोर्सेज. तो उसको रिपोर्ट पहले बनाते हैं, बाद में माइंड मैप पे जाते हैं. तो रिपोर्ट, इसमें अगेन ऑप्शन पे क्लिक करोगे, क्रिएट ऑफ योर ओन, ब्रीफ डॉक्यूमेंट, स्टडी गाइड, ब्लॉग पोस्ट. आपको कौन सा बनाना उसके ऊपर डिपेंड्स ऑन थी. सपोज अपने को ब्लॉग पोस्ट बनाना है, तो मैंने ब्लॉग पोस्ट कर दिया, वो अपने हिसाब से बनाएगा. क्लियर? इन्फोग्राफिक्स बन रहा है, अपना रिपोर्ट्स बन रहे हैं. लेट्स कम टू द माइंड मैप. माइंड मैप इज अ क्या चीज़ है कि माइंड मैप इज अ टोटल मैपिंग. इट विल बी कहेंगे नोटबुक, उसके बाद में उसके क्या क्या हेडिंग में वो चीज़ सिखाएगा, वो हेडिंग के अंदर क्या क्या सब हेडिंग है. तो दैट इज कॉल्ड माइंड मैप. एक के अंदर दूसरा आता है. तो लेट्स सी क्रिएट अ वुल माइंड मैप. इतना लिख के मैं छोड़ देता हूँ. लेट्स सी जनरेट करके देखते क्या आता है. सबके 3 चीज बन रहे हैं अभी. इन्फोग्राफिक्स, रिपोर्ट्स एंड माइंड मैप बन रहा है. ऑल आर रेडी. क्या माइंड मैप में जाइए, गो टू द माइंड मैप. जो आपके मर्जी में है वो चाहिए वो लिख लीजिए और बोलो जनरेट. कुछ नहीं करना है उसमें, वो बाद में क्या आता है वो मैं आपको डिटेल में समझाता हूँ. व्हाट इज माइंड मैप? एनीबडी हैज एनी कंफ्यूजन टिल नाउ? नो. चलो यहाँ पे कुछ बना मेरे यहाँ पे बियॉन्ड इट चैटबॉट. यहाँ ये बन गया है, देखते हैं. इसका रिपोर्ट आ गया अभी, जो हमने मांगा था वो. तो जो हमने जो रिपोर्ट बनाया था वो रिपोर्ट आ गया. उसको मैं थोड़ा सा एक्सपांड करके आपको दिखाता हूँ, तो यू विल गेट द आइडिया. बियॉन्ड इट चैटबॉट 5 वेज ऑफ नोटबुक इन री राइटिंग. और उसने पूरा अपने हिसाब से पूरा रिपोर्ट बना के अपने को दिया. हमने क्या मांगा था? ब्लॉग. तो उसने ब्लॉग के हिसाब से मेरे को पूरा बना के दे दिया. दिख रहा है? अभी इसका एडवांटेज क्या है अभी आपको बता रहा हूँ. रिपोर्ट में अभी आप 2 चीज़ कर सकते हैं. कॉपी करके डायरेक्टली कहीं पे भी डाल सकते हो इन वर्ड फाइल. यहाँ दूसरा आपको अगेन 3 डॉट्स दिख रहे 3 डॉट्स. उसके अंदर आएगा एक्सपोर्ट टू डॉक्यूमेंट, एक्सपोर्ट टू शीट और डिलीट. तो यहाँ पे आप डायरेक्टली एक्सपोर्ट टू डॉक्यूमेंट डाल देते हैं, तो अपने हिसाब से एक्सपोर्ट डॉक्यूमेंट में पूरा बना के डाल देगा. ये आपका बन गया पूरा वर्ड फाइल. यहाँ पे पूरा रिपोर्ट. अभी इतना सारा बड़ा आर्टिकल अपने को ब्लॉग लिखना है विथ गुड रेफरेंस. इट विल टेक्स मिनिमम 1 वीक फॉर अस. ये हम लोगों ने कुछ देखे बगैर डायरेक्टली बनाया, ओनली पढ़ना बाकी है. बराबर है? रेडी? पढ़ना पड़ेगा लेकिन दैट इज़ वेरी इंपॉर्टेंट. इसने कुछ भी गलत लिखा हो सकता है, अभी मैं उसकी गारंटी नहीं देता हूँ, लेकिन उसने बना के दे दिया. ओके टिल नाउ? ओके. हाँ, अभी और इसके आगे चलते हैं. यहाँ पे जो अभी हम लोगों ने रिपोर्ट बनाया, अभी हम लोगों ने यहाँ पे जो इसका रिपोर्ट कहाँ गया? हाँ, इसके ऊपर राइट साइड पे अभी 3 डॉट्स पे आप देखोगे तो यहाँ पे आएगा एक तो रीनेम आता है, अपने हिसाब से नाम लिख सकते हो. सेकंड आता है एक्सपोर्ट आता है डॉक का, सीट आता है, एंड व्यू दी प्रॉम्प्ट एंड सोर्सेज भी आता है. मीन्स हमने क्या सोर्सेज डाला था शायद भूल गए हो तो वो भी हम लोग देख सकते हैं. यहाँ पे एक और चीज़ भी डायरेक्टली आता है कि इसको हम डायरेक्टली एक्सपोर्ट कर सकते हैं एज अ सोर्स ऑल्सो. सो हमने ब्लॉग बना दिया तो उसको भी हम सोर्स के हिसाब से यूटिलाइज कर सकते हैं, राइट. तो दिस इज द बेसिक एडवांटेज. ये हो गया अपना. देन अपना एक इन्फोग्राफिक्स हमने मांगा था, इन्फोग्राफिक्स भी तैयार हो गया है अभी अपना. कितने लोगों का इन्फोग्राफिक्स तैयार है? लग रहा है ब्यूटीफुल. राइट. ऐसा इन्फोग्राफिक्स हम लोग कहीं पे देखते थे पहले. हम लोग देते थे कि भाई हमको इसका बना के देना है, और अपने पब्लिशर्स या तो अपना क्रिएटर बना के 500-1000 रुपया दे के बाद में बनाता था. यहाँ पे हमने 5 मिनट भी नहीं बिगाड़ा है, हमने तो पैरेलल काम किया है और यहाँ पे तैयार है आपके पास. ओनली थिंग व्हाट, क्या बाकी रहा इसके अंदर? पढ़ना इज़ वेरी वेरी इंपॉर्टेंट. इसने यहाँ पे कुछ गलत लिखा होगा, जो नहीं पढ़ा होगा, डायरेक्टली भेज दिया तो यू आर लैंड इन द ट्रबल, राइट. वो बताऊंगा क्या था, दैट विल बी, आई विल शो द एग्जांपल आल्सो.
Excuse me, sir. On a lighter note, थोड़े दिन पहले I saw an article of our neighboring country putting in a news report, and you know what was there in the news report? After the news report, whole of the article of the news, it was written, if you want, I can also create an even snappier front page line style version with punchy one-line stats and a bold infographic ready layout perfect for maximum reader impact. Do you want me to do that next? So उन्होंने what they did, they prepared the article, their news report from ChatGPT और ऐसा का ऐसा उन्होंने unedited बिना पढ़े, it went into the, it was from a very reputed paper in their country, the Dawn. उसके अंदर front page पे the news was like this, and the last there was a text after this. So it was totally copy pasted from ChatGPT.
Only newspaper में नहीं होता है, अपने व्हाट्सअप ग्रुप में भी देखो होगा. व्हाट्सअप ग्रुप में मैनी टाइम डबल एस्ट्रिक्स आते हैं, राइट. तो डबल एस्ट्रिक्स इज द इंडिकेटर ऑफ इट इज मेड फ्रॉम ChatGPT, राइट. तो वो डी आइडेंटिफाई करके ChatGPT ने डबल एस्ट्रिक्स कैसे निकालना वो बाद में सीखना पड़ेगा, वो सिखाऊंगा बाद में, टाइम होगा तो. हाँ, कैसे करना है, ठीक है. तो अभी मैंने वही आपको बीच में भी दिखाया. कहाँ गया अपना इन्फोग्राफिक? ये इन्फोग्राफिक्स. यहाँ पे अपने को आता है व्यू प्रॉम्प्ट एंड सोर्सेज. तो यहाँ पे प्रॉम्प्ट एंड सोर्सेज में आप देखोगे तो ये चीज़ आता है कि दिस आर दी थिंग्स, राइट. अगर आपको पसंद नहीं है तो यू कैन अगेन यूटिलाइज दिस इन्फोग्राफिक्स एज अ सोर्स, और बोलेंगे कि उसमें ही करेक्ट दिस थिंग, राइट. तो ओनली सिंगल सोर्स लेंगे उस टाइम पे, क्योंकि अपने पास तैयार है. अगर नोटबुक में नहीं डालना है तो यू कैन डू सेम थिंग इन दी PPT ऑल्सो, और दी डायरेक्टली इन दी ChatGPT ऑल्सो. ChatGPT में तैयार करके डाल दिया आपने ये बना के, और बोला ChatGPT को भी यहाँ पे गलत लग रहा है तो जस्ट चेंज इट, वो ChatGPT भी करके देगा. तो ChatGPT इज इजीएस्ट वे रेदर देन नोटबुक LM फॉर दी करेक्शंस. चले आगे, क्लियर. तो अभी माइंड मैप खोलते हैं, जो हम लोगों ने अब तक सीखा वो. तो दिस इज माइंड मैप. क्या नोटबुक एलिमेंट जेमिनी इंटीग्रेशन, तो उसकी डिफरेंट टेक्निक्स क्या है, इसका सोर्स मैनेजमेंट क्या है, इसके कोर्स फीचर्स क्या है, स्टूडियो आर्टिफैक्ट्स क्या है, ऑप्टिमाइज स्ट्रेटजीज क्या कर सकते हैं, एडवांस वर्कफ्लो क्या कर सकते हैं, प्राइमरी. तो अपने सब सोर्स में से उसने ये सब हेडिंग निकाले. अगर उसको हम क्लिक करते हैं तो आगे उसके अंदर से ये 2 चीज़ निकालता है. उसको अगेन क्लिक करते हैं तो इट विल गिव दिस टाइप ऑफ द थिंग. तो इट विल गिव अस अ वेरी कंसाइज हेडिंग, लाइक अपने इंडेक्स, अपनी बुक का इंडेक्स दिखाता है. दैट इज़ द माइंड मैप, कि वो इंडेक्स अपने ये बुक के अंदर क्या क्या चीज़ है, उसमें से कहाँ जाना है, वो डायरेक्टली दिखाता है. इसको आगे करके अभी एंड पॉइंट है तो आगे कुछ नहीं गया, राइट. So this is the full mind map, means जो हम लोगों के पास resources है उसमें से एक्चुअल एंड तक हम जा सकते हैं. तो ये चीज़ हम लोग कहीं पे भी डायरेक्टली इतना चीज़ ऐसे नहीं दिखा सकते, तो हम लोगों को ये माइंड मैप करके उसके डिटेल में जा सकते हैं. दिख रहा है? तो दिस इज द माइंड मैप. माइंड मैप मीन्स व्हाट इज दैट मेन हेडिंग है, उसके डिफरेंट हेडिंग, उसके अंदर से अगेन आगे गया कि उसके अंदर से क्या क्या पॉइंट हम देख सकते हैं, उसके अंदर से गए कि आगे आगे क्या क्या पॉइंट आ सकते हैं. तो दैट इज ऑल मैपिंग ऑफ फुल डॉक्यूमेंट in a one systematic manner, that is the mind map. Clear? चलो अभी आगे चले. अभी कुछ बाकी रहा बनाना वाला, तैयार हो गया. ठीक है, तो यहाँ पे अपना मेन अबाउट दी नोटबुक एलएम के क्या क्या चीज़ क्रिएटिवली बना सकते हैं हम लोगों ने सीख लिया. यू हैविंग एनी डाउट रिगार्डिंग दैट? सबको आ गया तैयार? नोटबुक कहाँ से देखना है वो भी आ गया, और कहाँ से स्टार्ट करके कहाँ पे काम करना है वो भी आ गया. व्हाट एक्चुअली इट वर्क्स वो हम लोग लास्ट में क्विज में आपको डेफिनेटली पूछने वाला हूँ. तैयार रखना आपको कितना मालूम है नोटबुक के बारे में. राइट. सो लेट्स कमिंग टू दी नोटबुक का वेरी इंपॉर्टेंट फीचर्स. पहले हम लोगों को क्या था कि रिसर्च के लिए कोई भी पूछता था ना, तो हम लोगों को अलग अलग ऐप देख लेने पड़ते थे कि ये ऐप में से मैं ये लूँगा, चैट जीपीटी से मैं कुछ अलग दूंगा, इसमें अलग दूंगा. नाउ नोटबुक हैज़ इट्स ओन कैपेबिलिटी टू डू ऑल सच टाइप ऑफ द रिसर्च. किन किन लोगों ने अपना खुद का रिसर्च अब तक किया हुआ है या जो रेगुलरली करते हैं? कर रहे हो आप? कितना टाइम लगता है जनरली मैडम आपको? एटलीस्ट मिनिमम 1 to 2 months मिनिमम. डेटा कलेक्शन का अलग छोड़ देते, लेकिन इतना तो मिल सकता है. यहाँ हम देखेंगे कि हम आधे घंटे के अंदर कितना कर सकते हैं. राइट, बिकॉज देयर मे बी अ टाइम लिमिट मे बी देयर. तो हम तब तक जितना रिसर्च देख सकते हैं वी आर ट्राइंग टू डू दैट रिसर्च. ठीक है, अभी अपने पास टॉपिक क्या है? नोटबुक एलएम पर था, बराबर है. अभी हम थोड़ा उसको छोड़ देते हैं और करते हैं क्रिएट न्यू नोटबुक. वापस क्लिक करिए क्रिएट न्यू नोटबुक. हाँ दिखा? चलो अभी किसके ऊपर रिसर्च करना है? पहला माइंड ब्लॉक मालूम ही नहीं है किसके ऊपर रिसर्च करना है. दूसरा माइंड ब्लॉक एक बार चलो समझ में आ गया कि भी अपने को पीडियाट्रिक में करना है कि ऑप्थेल्मोलॉजी में करना है. तो वो क्या रिसर्च हम करेंगे वो करेक्ट आएगा या तो वो ज़रूरी है कि नहीं है? सेकंड माइंड ब्लॉक. थर्ड माइंड ब्लॉक, अब कुछ अपने पास सब तैयार है लेकिन अभी डेटा कलेक्ट करना है तो कैसे करेंगे? माइंड ब्लॉक. डेटा कलेक्ट करने का चलो हम कुछ ना कुछ जुगाड़ कर लेंगे, लेकिन कैसे कलेक्ट करेंगे? क्या क्वेश्चन बनाएंगे? नो आइडिया. क्वेश्चन बनाने के बाद चलो बन भी गए, सब लोगों ने इकट्ठा होकर अच्छे से क्वेश्चन भी बनाया, तो उसको बाद में कहाँ से गूगल फॉर्म में कैसे डालेंगे? अगेन प्रॉब्लम. उसके बाद में प्रॉब्लम आया कि वो क्रिएट कर दिया गूगल फॉर्म में, बना भी दिया, डेटा कलेक्ट भी कर दिया. अभी डेटा कलेक्ट तो होगा लेकिन इसका करेंगे क्या? स्टैटिस्टिशियन तो कोई है नहीं अपने पास. राइट, अगेन प्रॉब्लम. डेटा चलो कलेक्ट करके चलो स्टैटिस्टिशियन मिल भी गया, उसने 5,000 रुपया लेके आपको स्टैटिस्टिशियन ने डाल भी दिया. अब क्या करोगे? कहाँ पे रेफरेंस डालोगे? रेफरेंस कहाँ से लाओगे? नॉट पॉसिबल. गूगल में से कुछ आ गया लेकिन उसका ऑथेंटिकेशन कौन देखेगा? नॉट प्रैक्टिकली पॉसिबल. चलो कुछ रेफरेंस ले भी दिए, 5-10 रेफरेंस अपने पास आ गए हैं तो उसमें ले लिए, तो उसमें से कंपाइल करके अपने डेटा के साथ में मैच कौन करेगा और उसके हिसाब से डिस्कशन कौन करेगा? फाइनल कंक्लूजन क्या निकालेगा? राइट. दिस इज ऑल अबाउट दी रिसर्च के पूरा स्टेप है, और पूरे स्टेप के अंदर कहाँ कहाँ ब्लॉक हो सकता है. जस्ट गिविंग अ फ्यू स्लाइड अबाउट दैट रिसर्च एंड देन वी कैन गो टू दी नोटबुक अबाउट दैट थिंग. उसके अंदर आपको कहाँ कहाँ दूसरे यूटिलाइज कर सकते हैं आपको मालूम पड़े. इम्पोर्टेंट क्वेश्चंस हमेशा जब भी मैं प्रेजेंट करता हूँ तो आता है, इज इट इथिकल टू यूज द AI फॉर द थीसिस राइटिंग? क्या बोलते हो? इट इज इथिकल नाउ, बट इन अ सर्टेन एरिया, राइट? अपने को डेटा इकट्ठा करके उसको कंपाइल करने के लिए यू कैन यूटिलाइज AI, बट सब लिखने के लिए AI यूज करोगे तो वो आपको प्लेजरिज्म के जगह पे अब आएगा AI जनरेटेड डेटा में रिजेक्ट आएगा. तो नाउ रिजेक्शन ऑफ द एक्सेप्टेंस ऑफ पेपर इज कमिंग इन 2 वे. वन इज द 3 वे वी कैन से. वन इज द नॉट प्रॉपरली प्रिपेयर्ड, सेकंड प्लेजरिज्म इज वेरी हाई, एंड थर्ड वन नाउ कमिंग इज द इट्स अ AI जनरेटेड. तो ये सब चीज़ों को अपने को कैसे निकालना है, for that we can just give some brief about that. So these are the things where we can go for our paper writing and research, and mainly our target is the research in the journal and publications. Important thing what I just mentioned, that is what are the common barriers. There is no topic, अपने पास टाइम ही कहाँ है, लिटरेचर ओवरलोड बहुत हो गया है, स्टेटिस्टिकल फिगर है, राइटिंग डिफ़िकल्टी है, जर्नल सिलेक्शन कहाँ पे है, बना तो दिया लेकिन भेजेंगे कहाँ पे, एंड लेक ऑफ द मेंटरशिप ऑफ ऑल दिस थिंग. सो दिस इज ऑल लीड टू द रिसर्च डिले. दिस इज अ टोटल रिसर्च साइकिल व्हाट वी रियली रिक्वायर व्हेन वी डू. मैं ये भेज दूंगा प्रेजेंटेशन, डोंट वरी, आराम से भेजूंगा. मैंने भी बनाया ही हुआ है तो आपको भी भेजूंगा, डोंट वरी. सो इट इज़ अ रिसर्च आइडिया से लेके रिसर्च क्वेश्चन, लिटरेचर रिव्यू, methodology, data collection, data analysis, manuscript writing, plagiarism check, humanization of language enhancement, and journal selection and publication. So these are all the steps where the AI can utilize in proper systematic way. But there are the few basic rules when we are doing the academic writing. That include it should be authentic, it should be original, it should be research based, it should be helpful, and systematically presentation should be there. It having a very clear, it should be coherence with the topic, credibility is very important, and lastly adherence to topic is equally important. And where AI can assist, it assists in the creativity, efficiency, accuracy, and productivity. But at the same time, we have to go for all the precautions just I discussed, that including the verify the result, understand the limitation of the tool, ensure the data privacy, maintain academic integrity, stay informed what are the latest things are going on, choose the reputable tools, keep backup copy ready if something happens wrong, review terms of services, seek expert advice, and report the issue if it happens. If you follow all these precautions, it will be my guarantee that it will reduce a lot timing of the research. So there are the different tools are available for the writing and publication. ChatGPT, Cloud, Originality, AI, and Authenticate will be the writing and publication. It will be helpful. Its purpose is also written for the perplexity, consensus, illicit, and science-based AIs are there. For the production and visualization, Notebook LM, Research Rabbit, Gamma AI, Canva AI, and Powder BI co-pilots are there. So, our AI adoption to generate the research question, literature review, methodology, questionnaires, statistical plan, and draft the manuscript. So, this is the all about the our live demo what we are at presently discussing about the research. Okay. क्लियर गाइडलाइन अब तक का रिसर्च में क्या क्या चाहिए. अभी सब लोगों को खुद के रिसर्च चालू करने हैं. नोटबुक ओपन करिए, रेडी विद योर रिसर्च. आज आएगा आपका रिसर्च. यू कैन एबल टू पब्लिश डे आफ्टर टुमारो. सो यहाँ पे अपना क्वेश्चन आएगा कि अपने को क्या रिसर्च करना है. So I just writing the research I want to do for the AI related to medical health. ऐसा मैं लिख के छोड़ता हूँ, देखते हैं उसमें क्या आता है. आप अपना कुछ भी लिख सकते हो, अभी ये फाइनल नहीं आएगा, आपके माइंड में जो भी है कुछ भी राइट यहाँ पे डालिए, बराबर। वांट टू रिसर्च, सपोज एक काम करते हैं नोटबुक एल में रह देंगे, क्योंकि आप लोग अभी चैट जीपीटी से काफ़ी एक्वेंटेड हो, तो लेट्स गो फॉर चैट जीपीटी फर्स्ट, तो दैट विल हेल्प यू टू इजी फाई, अदरवाइज नोटबुक एल में घूमते रह जाओगे। तो लेट्स गो फॉर द चैट जीपीटी फर्स्ट। चैट जीपीटी ओपन किया है, सबके पास तैयार है? तैयार, वेरी गुड। चैट जीपीटी में न्यू चैट पे क्लिक कर दीजिए। किया नोट किया? अभी इसके अंदर want to do research on use of the AI adoption by medical professionals, give me suggestions, details अभी नहीं करना, suggestions on topics, राइट डाल दिया मैंने, स्पेलिंग वगैरह गलत है जाने देते, वो अपने आप ले लेगा, वो अपने आप सोचना चालू किया, हम लोगों की सोच नहीं है तो उसने सोचना चालू किया। तो इसने डायरेक्टली दे दिया कि अभी करंट में क्या क्या टॉपिक ज़रूरत है। वन इज़ दी हाई प्रायोरिटी रिसर्च टॉपिक, दैट इज़ दी AI एडॉप्शन एंड यूटिलाइजेशन पैटर्न अमोंग दी मेडिकल प्रोफेशनल्स, राइट। व्हाट शुड बी दी टाइटल? इट विल बी दी असेसमेंट ऑफ दी आर्टिफिशियल इंटेलिजेंस एडॉप्शन, यूजेज पैटर्न एंड परसेप्शन अमोंग दी मेडिकल प्रोफेशनल्स इन इंडिया। इसके ऑब्जेक्टिव क्या क्या हो सकते हैं? मेजरिंग दी AI अवेयरनेस एंड यूजेज, आइडेंटिफाइंग दी कॉमनली यूज AI टूल्स, assess the barrier and facilitator of adoption and explore the speciality wise difference, राइट इसने इतना पूरा अपने को लिख के दे दिया। उसका दूसरा ऑप्शन भी दिया है, तीसरा ऑप्शन भी दिया है, चौथा ऑप्शन भी दिया है, पांचवा ऑप्शन भी दिया है। आपके उसके अंदर भी इस तरह ऑप्शंस आए होंगे। कॉपी पेस्ट करता हूँ, दिखाता हूँ क्यों आपको, आप डायरेक्टली कॉपी पेस्ट करिए। व्हाट्सएप पे आ गया। राइट, रेडी विथ योर ऑप्शन। आप अपने अपना ऑप्शन चूज कर लिया, तैयार। अभी अपने को क्या करना है, मेरे हिसाब से मेरे को अभी पहला ऑप्शन लेना है, आपको दूसरा तीसरा जो लेना है ले सकते हैं। मैंने इसको कॉपी किया यहाँ से और डायरेक्टली डाल दिया नोटबुक में। तो वो अभी अपने को क्या करेगा, उसका रिसोर्सेज डाल के भेजेगा। हाँ, टॉपिक जो है, टॉपिक ऑब्जेक्टिव जो डाला है वो पूरा पूरा वन पार्ट जो अपने को चैट जीपीटी ने दिया वो डाल दिया, राइट। इसीलिए मैं बोल रहा हूँ कि ऑलवेज प्रीफर दी लैपटॉप मैडम, मोबाइल पे डिफिकल्टी रहती है, राइट। तो इसने डायरेक्टली जितने सोर्सेज अवेलेबल है हम लोगों को इंपोर्ट करने का बोला। अभी इतने सोर्सेज, इज इट पॉसिबल फॉर, दो मिनट दे दे, इज इट पॉसिबल टू गो फॉर दिस मच ऑफ द रिसोर्सेज एट अ टाइम बाय यू टू फाइंड आउट एनीवेयर एनी पॉसिबल। गूगल में भी करोगे तो पूरा लिस्ट देगा, लेकिन वेग देगा। वापिस जाते हैं, आपका जो आता है पहला है पेरेंट लीजिए। व्हाट दी फर्स्ट थिंग चैट जीपीटी में किया, बाद में क्रिएट नोटबुक अपना तैयार था, क्रिएट नोटबुक पे क्लिक करिए, वो सर को समझाना है। किया क्रिएट न्यू नोटबुक, उसमें सर्च वाला जो बॉक्स आता है खुला, क्रिएट न्यू नोटबुक। देखो उसने थोड़ा थोड़ा आधा काम तो यहाँ पे अपना करना चालू कर दिया। बिल्ड द ट्रस्ट द फ्यूचर ऑफ एआई इन इंडियन हेल्थ केयर करके कुछ ना कुछ डालना चालू कर दिया। हमने तो उसको कुछ पूछा भी दिए। यहाँ पे उसने अपने को सोर्स दे दिए। कितने सोर्स दिए हैं? सो मैनी, राइट। यहाँ पे एडवांटेज क्या है, नोटबुक जो भी सोर्स देगा ना वो ऑथेंटिक प्लेसेस से देगा, और दैट इज़ द एडवांटेज ऑफ दिस थिंग। दूसरा फॉर ऑथेंटिक सोर्सेज अगर आपको जानना है तो दैट इज दी परप्लेक्सिटी। परप्लेक्सिटी में भी आप डालोगे तो उसमें का जो रेफरेंस है ऑथेंटिक है। नेवर पुट दैट प्रॉम्प्ट इनटू चैट जीपीटी। बी फ्रेश, बहुत स्पेसिफिक बता रहा हूँ, चैट जीपीटी में नहीं डालना है। 90% विल बी दी रॉन्ग रेफरेंसेस। तो नेवर पुट फॉर रेफरेंस के लिए कभी भी अपने को चैट जीपीटी यूज़ नहीं करना है, राइट। कंसेसस ऑल्सो इज़ अ वेरी गुड ऑप्शन टू डू दैट, बट अभी सब कुछ चीज़ नोटबुक एलएम में आ गया, इसके लिए मैंने नोटबुक एलएम पकड़ा है। कोई भी एक चीज़ में मास्टर होना है, सब चीज़ नहीं कर सकती एक दिन में, तो अपने हम लोग नोटबुक पकड़े। चलो हो गया अपना, डायरेक्टली हो गई अपने पास रिसोर्स आ गया, टॉपिक एम ऑब्जेक्टिव आ गया। यहाँ पे अब वापस मैं वही चीज़ टाइप करता हूँ, यानी कॉपी पेस्ट कर रहा हूँ। क्या किया मैंने, मेरे को ये टॉपिक के अंदर टाइटल के ऑब्जेक्टिव चाहिए। अभी मैं क्या लिखूँगा इसके अंदर, प्रॉम्प्ट आगे, गिव मी एग्जैक्ट रिक्वायर्ड heading and details so I can do the research on the topic, right? इतना लिखा मैंने, इतना तो हम लोग लिख सकते हैं। गया नीचे, उसने अभी सोर्सेज के हिसाब से उसका रिलेवेंट डालना चालू कर दिया। यहाँ पे डायरेक्टली उसने डाल दिया व्हाट इज द इंट्रोडक्शन। मैडम आपका इतने जल्दी इंट्रोडक्शन आता है, नहीं आया थे। बाद में व्हाट आर द ऑब्जेक्टिव, ऑब्जेक्टिव 2, उसके अंदर पूरा स्पेसिफिकेशन। 4, इसको मैं छोटा कर देता हूँ तो ज़्यादा अच्छे से दिखेगा। 5, ऑब्जेक्टिव 5, कंक्लूजन एंड स्ट्रेटजी टू रिकमेंडेड, राइट। नाउ अभी अपना रिसर्च यहाँ तक रिसोर्सेज आया, उसका ये क्या बन गया, अपना एब्स्ट्रैक्ट बना के सबका सब कुछ थोड़ा थोड़ा कुछ आया, राइट। क्लियर। अभी अपने को चैट जीपीटी पे जाना है। अगेन आपका जो रिसर्च वाला थोड़ा इसको मॉडिफाई करने के लिए बताऊँ, क्योंकि इसके अंदर अपने को स्ट्रक्चर्ड डेटा नहीं आया, राइट। बट चैट जीपीटी का वंडर क्या है कि वो अपने को पूरा स्ट्रक्चर देता है। तो चैट जीपीटी कितना यूज़ करना है, नोटबुक एलएम कितना यूज़ करना है, वो मैं डिफरेंस समझा रहा हूँ कि चैट नोटबुक एलएम में क्या आया, अभी चैट जीपीटी अपने को क्या ऑप्शन देता है। I want to do research on this topic. Please guide me further. इतना ही लिखा कि भी अपने हमको अब कुछ मालूम नहीं है क्या करना है, तो क्या करोगे। एंड सी दी हाउ दी चैट जीपीटी इज गिविंग आंसर। तो इट इज़ डायरेक्टली प्रपोजल ऑफ द रिसर्च प्रोटोकॉल। टाइटल क्या होगा, व्हाट विल बी द बैकग्राउंड, व्हाट विल बी द रिसर्च क्वेश्चन, व्हाट आर द प्राइमरी ऑब्जेक्टिव, व्हाट आर द सेकेंडरी ऑब्जेक्टिव, व्हाट विल बी द स्टडी डिज़ाइन, स्टडी पॉपुलेशन कौन कौन से होंगे, व्हाट आर द इंक्लूजन क्राइटेरिया, व्हाट आर द एक्सक्लूजन क्राइटेरिया, व्हाट इज द सैंपल साइज, व्हाट विल बी द आइडियल क्वेश्चन स्ट्रक्चर। तैयार आ गया आपके पास। That is the demographic, AI awareness question, AI adoption related question, AI tool what can be used by the concerned person, purpose of the use, then pursue usefulness, barrier कैसे आएगा, facilitation क्या आएगा, ethical concern क्या आएगा, future intention क्या आएगा, and what is our key outcome of our thing, देन इंडिपेंडेंट वेरिएबल्स क्या रहेगा, व्हाट इज द स्टैटिस्टिकल एनालिसिस क्या क्या आएगा, पोटेंशियल पब्लिकेशन फॉर दी वन डेटा सेट क्या हो सकता है, व्हाट आर दी नोवेल रिकमेंडेशन, तो ऑल दिस थिंग इज वो डायरेक्टली उसने दे दिया, राइट। सो अगर हम नोटबुक में डालते हैं तो उसने लिमिटेड रिसोर्सेज में अपने को स्पेसिफिक थोड़ा थोड़ा दिया, बट अपने को प्रॉपर रिसर्च प्रोजेक्ट चलना है तो अपने को कहाँ पे डालना है, लार्ज लैंग्वेज मॉडल, दैट में भी और जेमिनी हो सकता है, दैट में भी क्लाउड हो सकता है, और दैट में भी चैट जीपीटी हो सकता है। क्योंकि क्लियर अभी आएगा, अभी अपने पास प्रपोजल तैयार हो गया, सब डिटेल तैयार हो गया, अभी डेटा सेट कैसे बनाएंगे, तो अपने को गूगल फॉर्म बनाना पड़ेगा, राइट। सो अगेन मैं चैट जीपीटी को डालता हूँ कि प्लीज़ मेक अ गूगल फॉर्म फॉर द डेटा सेट फॉर क्रिएशन ऑफ डेटा सेट, राइट। क्रिएट गूगल फॉर्म क्वेश्चन फॉर क्रिएट डेटा सेट। यस कर रहे हैं ना, अभी कर रहे हैं ना, फॉर्म बनाने नहीं, हम लोगों ने प्रपोजल किया, प्रपोजल तैयार हो गया, अभी अपने पास दो चीज़ है, अभी हम लोग रिसोर्सेज को यूज़ नहीं कर रहे इसलिए मैंने नोटबुक साइड पे रख दिया, बराबर है, अपने पास रेफरेंस आ गया है, और अपने पास अब क्या बनाना है, उसका एब्स्ट्रैक्ट बनाना है, उसका टारगेट बनाना है, डेटा सेट बनाना है, वो नोटबुक में भी दे सकते हैं। नोटबुक क्या करेगा, उतने ही रिसोर्सेज में से देगा, अपने को पूरा नहीं देगा, राइट। तो यहाँ पे एडवांटेज चैट जीपीटी का ज़्यादा है। तो दैट इज स्टडी परसेप्शन पर्पज ऑफ द स्टडी इन्फॉर्म कंसेंट, यहाँ पे डायरेक्टली उसने कंसेंट भी मांग लिया, जो हम लोग गूगल फॉर्म में काफ़ी टाइम भूल जाते हैं। देन स्टार्टिंग विद ऑल द क्वेश्चंस व्हाट दे वांट टू क्रिएट, बराबर। तो अपने पास पूरा क्वेश्चनर तैयार आ गया, राइट। अभी हम लोगों को लगता है कि नहीं एक क्वेश्चनर बहुत ज़्यादा है, इतना ज़्यादा कोई भरेगा नहीं, लगता है, राइट, इतना लंबा कौन भरेगा, बराबर है कि नहीं बराबर है। तो हम उसको बोलेंगे कि कीप अ नेसेसरी क्वेश्चंस ओनली टू मेक द फॉर्म मोर कंसाइज। हम लोगों को उसको स्टेप बाय स्टेप समझाना है कि अपने को क्या चाहिए। अब समझ में आ गया कि हमको क्या चाहिए, हम लोगों को इतना तो मालूम है कि इतना बड़ा फॉर्म कौन भरेगा, 25-40 क्वेश्चंस का तो किसी को फॉर्म देंगे तो कोई भरने वाला नहीं है। तो प्लीज़ कंसाइज इट फॉर ओनली नेसेसरी क्वेश्चंस। So look not lengthy। ठीक है, तो उसने डाल दिया मैक्सिमम 10 से 15 का क्वेश्चन डाल दिया उसने। तो 15 क्वेश्चन तो हम पूछ सकते हैं, राइट। So now please make final Google form। डायरेक्टली उसने डायरेक्ट गूगल फॉर्म का जो अपना था वो पूरा डालने लिया। अभी अपने को कहाँ जाना है, दिस इज द इम्पोर्टेंट पार्ट वेयर द मेजर प्रॉब्लम अकर, कि हम लोग इसको कॉपी करके गूगल फॉर्म में डालने जाएंगे तो कितना टाइम लगेगा, इट विल टेक्स अ लॉन्ग टाइम। तो यहाँ से हम लोग उसको क्या करेंगे, कॉपी करते हैं, कॉपी किया, हमारे पास और टूल है, दैट इज दी गूगल फॉर्म। गूगल फॉर्म कितने लोगों ने अब तक बनाया हुआ है, हाउ मेनी हैज प्रिपेयर्ड दी गूगल फॉर्म। गूगल फॉर्म बनाने में कितनी देर लगती है, अगर अपने को 20 क्वेश्चन लगाने तो कितनी देर लगती है सर? एटलीस्ट आधा घंटा, 1 घंटा? यहाँ पे मैं बोल रहा हूँ इसको ब्लैंक फॉर्म बना दिया। यहाँ पे अब जेमिनी ने अपना काम दिखाना चालू किया है। जो हम लोगों ने वहाँ से कॉपी किया था, यहाँ पे अपने को सिर्फ पेस्ट करना है। जेमिनी के अंदर क्रिएट ब्लैंक फॉर्म, जेमिनी क्रिएट। अगर जो उसके अंदर स्पेसिफिक होगा, ये आपका गूगल फॉर्म तैयार हो गया। देख लीजिए ऊपर गूगल फॉर्म पूरा तैयार है आपके पास, बराबर है कि नहीं है? क्रिएट फॉर्म, ये आपका डेटा फॉर्म तैयार। कितनी मिनट लगी? 1 मिनट, बट एवरीथिंग इज रेडी। सर आपको दिखाना पड़ेगा वहाँ पे, बराबर है? कितनी देर लगी? अभी थोड़ा जो टाइम है, यस, वापिस दिखाना है, अभी पकड़ी। यहाँ पे अपने गूगल में जाते हैं, न्यू बनाते हैं, गूगल फॉर्म बनाते हैं, ब्लैंक फॉर्म में जाएंगे, वापिस देखते जाइए। यहाँ पे ब्लैंक फॉर्म में जाइए, किसी को नहीं मालूम है ब्लैंक फॉर्म। ब्लैंक फॉर्म में अगर आपका जेमिनी आपने उसके अंदर एक्टिवेट किया होगा तो जेमिनी डायरेक्टली यहाँ पे दिखाएगा अपने को क्रिएशन उसका खुद का। तो यहाँ पे लिखने का पार्ट है डिस्क्राइब। तो डिस्क्राइब ने अपना गूगल फॉर्म जो तैयार किया था चैट जीपीटी में, उसको हमने कॉपी ऑलरेडी किया हुआ है, उसको मैंने क्या किया, पेस्ट किया। नहीं किया हो तो अभी भी कर लो, आप लोग करो। जेमिनी में नहीं है, गूगल फॉर्म में जेमिनी जा रहा है, उल्टा है। जो गूगल कैम में राइट साइड पे जेमिनी दिखेगा, अभी हम लोग यूज़ नहीं करते, वहीं पे प्रॉब्लम है। सब चीज़ गूगल ने इतना सारा दे दिया है, लेकिन वी आर नॉट नोइंग कि इसका यूटिलाइज हम इस तरह से कर सकते हैं। हुआ? आपका गूगल फॉर्म खोलिए पहले, गूगल फॉर्म खोला, इसमें राइट साइड ऊपर साइड पे देख रहा है कहीं पे जेमिनी का सिंबल, मीन्स आपका इंटीग्रेटेड नहीं है जेमिनी, आपको इंटीग्रेट करना पड़ेगा, राइट? वो हो जाएगा, उसमें जेमिनी को बोला वो गूगल वो आता है। तो दिस इज दी थिंग। तो डायरेक्टली आपका गूगल फॉर्म तैयार हो जाएगा यहाँ पे, जो मैंने बनाया है, ठीक है? उसको मैं अभी पब्लिश करता हूँ और अपने ग्रुप में डालता हूँ। 5 मिनट निकालिए आपको डेटा सेट क्रिएट करने के लिए। आपको जो मर्जी आए वो डायरेक्टली उसके अंदर आंसर दीजिए, ठीक है? मैंने व्हाट्सएप में डाला है इसका लिंक। क्या? वो बाद में बताता हूँ मैं, अभी जस्ट देख लीजिए, कोई डेटा सेट का टाइम नहीं है मैडम, इसके लिए मैं अभी थोड़ा स्पीड कर रहा हूँ। यहाँ पे आपने कॉपी किया, क्योंकि डेटा सेट को कैसे मिक्स करना, स्टैटिस्टिक क्या आएगा, वहाँ तक जगह जो सीखना है आपको, तो मैं वो सिखा रहा हूँ। गूगल फॉर्म डाला आपको, जस्ट आपको जो मर्जी है फटाफट क्लिक कर दीजिए। हम लोग एटलीस्ट 60 पीपल है यहाँ पे, 60 आंसर्स अपने को मिल जाएगा, रेफरेंसेस, हम डेटा सेट क्रिएट करेंगे। गूगल आपके पास है, व्हाट्सएप है, व्हाट्सएप में मैंने लिंक भेजा है, प्लीज़ आंसर इट। खुल रहा है सबको गूगल फॉर्म यहाँ पे? सबसे पहले कौन सा किसका रिस्पॉन्स आता है देखते हैं। चलो सर्च लगा, यहाँ पे रेस लगाते हो। अभी तक 0 रिस्पॉन्स है। अरे वाह, एक आ गया। हु इज द फर्स्ट? सूरज ततांक। सूरज, वेरी गुड, ही इज द फर्स्ट। देखते हैं अब सेकंड कौन है। सबके पास गूगल फॉर्म आया है? अरे गूगल फॉर्म भरे तो सही, अभी जेमिनी भूल जाओ। ये गूगल फॉर्म जो मैंने लिंक में भेजा उसको जस्ट क्लिक करिए और भर दीजिए, तो अपने पास डेटा सेट आएगा। तो डेटा सेट को आगे क्या करना है मैं वो समझा देता हूँ इसके लिए। दिस कनेक्शन इज बेसिकली विथ जेमिनी प्रो। એટલે आपके पास अगर जो जियो का कार्ड है, सिम कार्ड है, तो उसको आप जेमिनी प्रो को एक्टिवेट कर सकते हैं 1 साल तक फ्री में। और जैसे ही वो एक्टिवेट करोगे तो वो आपको यहाँ पे हेल्प के लिए आ जाएगा, राइट। तो दिस इज़ द बेसिक थिंग। जब तक आप उसको एक्टिवेट नहीं करोगे आपके पास नहीं है। जियो वाले आपको फ्री में दे रहे हैं 1 साल तक ये सब में फैसिलिटी। एटीन रिस्पॉन्स आ चुके हैं। मैं 30 के बाद बंद कर दूंगा। 30 के बाद आप नहीं कर पाओगे। 22, 21 यानी आप लोग ही कर रहे हो। पूरा डेटा सेट तैयार हो रहा है। ओनली 3 बाकी अभी। चलो फास्ट। अब तो बढ़ गए। अभी के कोई भरना चालू रखा है तो मैं अभी 1 मिनट रखूँ चालू, नहीं किया तो मैं बंद करूँ। कोई भर रहा है अभी फॉर्म? नहीं भर रहा है तो मैं स्टॉप करता हूँ। तो दिस इज दी अवर डेटा सेट तैयार हो गया। अपने पास फाइल आ गई, डाउनलोड कर दिया एक्सेल में। अपने पास 30 डेटाबेस है अपने पास, राइट। 30 ऑप्शन है अपनी जो हम लोगों को जो स्टडी करना था उसके हिसाब से, राइट। इतने अपने पास डेटा सेट है। व्हाट आई एम डूइंग नाउ, डी आइडेंटिफाइंग कि सब लोगों के ईमेल वगैरह नहीं आने चाहिए, वो नहीं दिखने चाहिए, राइट। तो हम लोग कुछ भी अब इसके अंदर डालेंगे तो अपने को जो लोगों का जो पर्सन है वो आइडेंटिफाई नहीं हो इस तरह का डेटा डालना पड़ेगा। तो मैं इसको सेव कर रहा हूँ फाइनल डेटा। राइट। तो दिस इज टोटली डी एन ए। किसने क्या दिया था इसके अंदर अभी कोई चीज़ नहीं है, बट अपनी ज़रूरी चीज़ सब कुछ है यहाँ पे। परफेक्ट, क्लियर। इसको मैं अभी सेव कर रहा हूँ। अभी देयर इज अ 2 मेथोडोलॉजी। अगर अपने को चैट जीपीटी में कंटिन्यू रखना है तो वहाँ पे भी रख सकते हो, और दूसरा मेथड है नोटबुक एलएम में रिसोर्सेज के साथ कंपेरिजन कर सकते हो, राइट। क्या करना है, नोटबुक में लेना है कि चैट जीपीटी कंटिन्यू रखना है? नोटबुक में लेना है, ठीक है। तो अपने पास ये हमने एक रिसोर्स और बना दिया। अपना नोटबुक पे आ गए हम लोग। यहाँ पे हम वापस आ गए उसके सोर्स में। अपने को हम क्या कर रहे हैं अभी, अपना सोर्स ऐड कर रहे हैं, राइट। सोर्स क्या है, अपलोड फाइल कर रहे हैं। डाउनलोड में अभी आपको यहाँ पे कहीं पे भी एक्सेल दिख रहा है? नहीं दिख रहा है, राइट। तो दिस इज द लिमिटेशन ऑफ नोटबुक एलएम। तो अपने को क्या करना है, उसका ऑप्शन अपना ये फाइनल डेटा है, उसको हम क्या कन्वर्ट करेंगे? किस में कन्वर्ट करें? PDF। अब देखते हैं नोटबुक में दिख रहा है कि नहीं दिख रहा है। आ गया? ठीक है, तो हमारा एक और सोर्स हमने डाल दिया, डेटा सोर्स। दूसरा अपना डेटा सोर्स क्या आएगा? हमने क्या बनाया है चैट जीपीटी में, उसका पूरा स्ट्रक्चर बराबर है, तो उसको भी अपने को लेना पड़ेगा, तो ही वो दो कंपैरिजन हो पाएगा। इसीलिए मैं बोल रहा था चैट जीपीटी में चालू रखो। तो चैट जीपीटी में अपने पास पूरा जो डेटा तैयार है ये, उसका अपने को एक कॉपी करके वर्ड फाइल करके अगेन PDF बनाना पड़ेगा। या तो उसको हम डायरेक्टली भी कर सकते हैं, ये अपना डेटा सेट वहाँ से हमने डाल दिया। सॉरी, ये पुराना वाला है, नया वाला ही करना पड़ेगा। उसको हमको ये अपने नोटबुक LM के अंदर यहाँ पे स्टार्ट टाइपिंग में डालेंगे। अभी अपने को पहले तो सिलेक्ट करना पड़ेगा सोर्स। कहाँ गया अपना फाइनल डेटा, तो उसको हमने टिक किया, और जो हमने चैट जीपीटी में बनाया था उसको मैंने यहाँ पेस्ट कर दिया, बराबर है, उससे सोर्स बनाने से ज़्यादा, और डाला नीचे फॉर दिस स्टडी यूज द डेटा सेट attached and give क्या क्या चाहिए अपने को? डिस्कशन एंड कंपेरिजन। पहला डिस्कशन चाहिए, कंपेरिजन अब नहीं कर पाएगा, ले डिस्कशन। अभी जब भी बहुत लंबा हम लोग डालते हैं तो ये चैट जीपीटी या सॉरी नोटबुक अपने को एक्सेप्ट नहीं करने देता है, तो अपने को अगेन ये बहुत लंबा हो गया है, इसके लिए वो नहीं करने दे रहा है। इसके लिए उसका अगेन अपना ऑप्शन वही रहेगा, डाउनलोड में जाके उसका एक वर्ड फाइल बनाना पड़ेगा। और इसको अपने को सेव एज PDF। ठीक है, अभी हम लोग दो पैरेलल काम कर लेंगे। एक चैट जीपीटी में क्या आता है वो देख लेते हैं, तो जट में भी जो टाइम परमिट नहीं हो तो एटलीस्ट अपना स्टडी पूरा हो जाए, और नोटबुक में आगे कैसे करेंगे वो समझा देता हूँ। यहाँ पे हमने अगेन एक और सोर्स डालना पड़ेगा। जब तक यहाँ पे वो आता है तब तक हम लोग डायरेक्टली चैट जीपीटी को पूछ लेते हैं। यहाँ पे अपना डायरेक्टली डेटा सेट अटैच करता हूँ मैं। यहाँ पे चैट जीपीटी का फ़ायदा क्या है, इट विल टेक दी आवर एक्सेल ऑल्सो, राइट। ऑन this data please complete this study including references and final conclusion। इतना ही लिखा है मैंने, इसलिए वो नोटबुक छोड़ दिया मैंने। तो अभी देखो उसको मैंने दे दिया डेटा सोर्स, अपना स्टडी प्रपोजल ऑलरेडी उसके पास तैयार है। अभी ये अपने उसको बोला मेरे को रेफरेंसेस भी साथ साथ में ले दे, तो अभी वो कितना देता है वो देखना है। बट ओनली कंसर्न व्हाट आई पर्सनली फील इज द प्रॉब्लम विथ द रेफरेंस इज चैट जीपीटी इज इट विल ऑलवेज हेल्यूसिनेट, और मेजोरिटी टाइम एक रिफ्रेम बनाया हुआ होता है, डायरेक्टली नहीं आता है। तो ये तैयार, अपना पूरा स्टडी तैयार, इसका बैकग्राउंड, ऑब्जेक्टिव, मेथड, व्हाट इज द रिजल्ट जो हम लोगों ने डाला वो रिजल्ट भी दे दिया उसने। 33 मेडिकल प्रोफेशनल्स पार्टिसिपेटेड और उसका क्या रिजल्ट आया, व्हाट इज द कंक्लूजन। देन अगेन दिस इज द फुल एब्स्ट्रैक्ट फॉलोड बाय इंट्रोडक्शन, ऑब्जेक्टिव हमारा क्या था, सेकेंडरी एक्सरसाइज मेथोडोलॉजी क्या था, पूरा तैयार आपका। क्या क्या उसमें से उसने रिजल्ट भी ले लिया पूरा। एज डिस्ट्रीब्यूशन, वो वहाँ पे वो लास्ट मैडम वो बोल रही थी, निकल गई शायद, कि ये उसका ये टेबल प्रॉपर नहीं आता है, वो मैं जस्ट समझा रहा हूँ कैसे आएगा, राइट। तो फुल स्टडी इसने डाल दिया, लिमिटेशन, फाइनल कंक्लूजन, रेफरेंसेस पूरा आ गया, आपका पूरा स्टडी तैयार। इसको मैंने कॉपी कर दिया, करके इसके अंदर अपना वर्ड फाइल में गए, फाइनल रिसर्च, जो आपने डेटा दिया था उसके अंदर से ही ये पूरा रिसर्च आ गया, उसका कंक्लूजन क्या आता है वो देख लेते हैं इसे। तो ये मेरा पूरा रिसर्च पेपर तैयार हो गया। कितने पेज का तैयार हुआ, 8 पेजेस, राइट, इंक्लूडिंग द रेफरेंसेस, पूरा टेबल इंक्लूडिंग दिस। तो दिस इज द बेसिक स्टडी हम लोगों ने पूरा इकट्ठा मिलके किया। इसका वर्ड फाइल और पीडीएफ में आपको डालता हूँ, घर जाके पढ़िएगा कितना इम्पोर्टेंट है। अगर लगता है तो हम आगे प्रोसीड करेंगे अपने ग्रुप के अंदर। क्लियर? ओके, थैंक यू। एनी क्वेरी? हाँ, उसके लिए मैंने बोला उसी से गूगल जेमिनी प्रो है, तो उसको अपने को आपका जो जियो का सिम होगा उसमें एक्टिवेट कर दो, 1 साल तक फ्री है आपके पास, तो डायरेक्टली हो जाएगा। या हो गया, रैप अप कर दिया। अभी ये लोग ताली बजाए तो मेरा काम खत्म। I hope at least something other than what regularly we are utilizing, it is useful for something better than that, right? Yes. हाँ, उसको दिखा देता हूँ, वो टेबल आ ही गया। हाँ, अभी हम ही यहाँ पे से निकल जाएंगे, 2 मिनट पे निकल जाते हैं। ठीक है, आपका ये आपका टेबल तैयार ही है। इसका अंदर सिर्फ अपने को वो नहीं है, उसकी बॉर्डर नहीं है। ये आपका टेबल तैयार है, आपका टेबल तैयार है, ये सिर्फ बॉर्डर नहीं है। अरे यार, इन लोगों ने निकाल दिया तो मैं क्या करूँ। हाँ, दिस इज अ टेबल रेडी। राइट, ये टेबल तैयार है, इसको सिर्फ बॉर्डर नहीं, कॉपी प्रॉपरली करोगे तो प्रॉपर सब आएगा. थैंक यू.
A short announcement. We have a yoga workshop tomorrow morning at 6:30 a.m. on the occasion of the International Yoga Day, which will be held poolside. The first 40 registrations will be getting a free t-shirt and a yoga mat. You just have to show up at 6:30 a.m. in the morning. The registrations are being done at the Sun booth outside. So if anyone is interested, they can surely join in and register themselves. The workshop will start tomorrow morning 6:30 a.m. after poolside. We will start tomorrow morning 9 a.m. with the conference. So be there at 9 a.m. sharp. We'll be starting at 9 a.m. So I request all the physicians to please make their way inside the hall. Now I would like to call upon our chairpersons for the next specialty focused lecture based on the medicine topic. I would request Dr. S.V. Kulkarni and Dr. Amit Kumar Dey to please come on stage to chair the session.
Welcome back, everybody. Let's settle down. So we're going to have a combined session. So all of us there will also be connected here. So we'll be having this in the form of 2 lectures, 2 sessions by 2 speakers, followed by a very interactive panel discussion, and we'll try to have a more interaction with the audience. I know it's been a brainstorming day today with everybody in the workshop, so you must have been all having a little bit of brain fogging with too much in the mind. But let's get this more interactive. So this session is going to be a specialty focused session. So we are going to align the discussions on the applications of artificial intelligence and digital health in the subspecialty of medicine as a whole. We have 2 very good speakers. Dr. Aniket will first tell us about the applications in resource limited settings. So when you talk about technology and digital health and artificial intelligence, the first thing that comes to all of our mind is that, is it going to be expensive? Will people be able to afford it? Will really this make a difference in a place, in a primary healthcare setting, in a rural care setting, where it is actually needed the most to provide a more equitable distribution of healthcare? So that's what Dr. Aniket will talk about. And then we'll have Dr. Rajesh Deshmane from Solapur. He will talk about the application of artificial intelligence in metabolic, non-communicable diseases in diabetes management. So we'll get an overview spectrum of how AI is being used and what is the current landscape. Following that, we'll have a very interactive, interdisciplinary panel discussion, which will be led by Dr. Mayura Kale from Aurangabad. And all of us will then join in that panel discussion, and we'll make it interactive with questions coming from all of you. And we will try to see where we stand in the applications of AI in medicine. So I think with this note, I would request Kulkarni sir to kindly introduce Dr. Aniket, and we can start the session.
It is my great pleasure to introduce the 2nd, 3rd and 4th generation of the doctors who are physicians who are interested in AI digital technology, and I'm really proud of them. Normally we also have seen so many times in our career also that the people who are at the top stage, they don't want to hand over it, but I'm very happy that we have got really able next generation, and Aniket is one of them. Aniket, can I request you to start your presentation? His presentation itself is a testimonial for his knowledge, wit and wisdom. He has been awarded Best Paper Awards in American College of Physicians conferences, and even the last RSSDI, he won the Young Scientist Award also. So please, Aniket. And there is a similarity between me and him, because we are working in a very small place. We are not in the metro cities. We are not in the district places. He is working in a place called Umarga, and I worked in a place called Khopoli, which was not even on the list of Maharashtra, because there are only talukas listed in the Maharashtra map. So at least Aniket is lucky to have his town listed in the name. I owe it.
Dr. Kulkarni sir introduced Dr. Aniket without a script, without an introduction. So human intelligence always goes over artificial intelligence.
Absolutely, absolutely. Yeah. Thank you, Kulkarni sir and Amit, for that kind introduction. So we are living in exciting times, friends, and you have experienced all these excitement in last 2-3 hours. So how AI is augmenting our own intelligence to improve the patient outcomes, to improve our own quality of life. So I am here standing before you to speak something about how AI can improve our clinical practice, especially in resource limited settings, because I come from a small town which is 80 kilometers away from Solapur, small Umarga. So how I am utilizing artificial intelligence to improve my practice, to improve my clinical acumen, and to into clinical research also, because I have been doing that since past few years. So we have been using AI in our day-to-day life since many years. We know that Google Maps is there. It is helping us with the outputs based on the data that it is getting and getting trained. Language translators are there. Biometric technology we have been using quite a lot. Virtual assistants are there. Chatbots are there. So we have been using this kind of artificial intelligence technology since last 1 decade. But how AI is transforming medicine, that is the most important thing that we want to learn. So robotic process automation is there. Lots of things are happening in process automation. So everything is getting automated. So we have just learned how Notebook LM can automate the simple tasks and improve our research purpose and doing research in a very simple way. So AI is there to transform the medical imaging system, because now every medical imaging diagnostic tool is empowered by AI. So be it is sonography machine, echo machine, MRIs, CT scan. So every first time you will get an answer, you will get a differential diagnosis from the machine tool, and then using your clinical acumen and whatever the data and output given by that particular system, we can improve the diagnostic accuracy and improve the quality of care. So wearable devices are there, so we are living in a remote, almost in remote monitoring. So since the era of COVID-19, we have seen that how remote monitoring, that wearables are transforming the way we monitor the patients and improve the quality. So resource limited settings definitely have their own challenges in terms of we have limited number of specialists, diagnostic tools and poor infrastructure. But AI can definitely help us to bridge this gap and amplify the clinical decision making in a profound way. So it is, we can use AI not to replace us, it is here to act as a force multiplier. So it's a force multiplier for me, for you, for everyone using AI. So we have to embrace this technology to improve our diagnostics and our clinical practice, because it is very good at predictions. It is the moment you put some kind of a data to any kind of higher LLM models, it is highly accurate in giving predictive analytics, because it is amazingly beautiful at that particular thing. So it reduces the errors, saves time, improves the accuracy. And as I said earlier, it is here to augment us, support us, not to replace us. But it will definitely replace those who don't use AI. So start using AI rather than becoming obsolete in our own practice. So, and especially very impactful in rural and under-resourced settings. So potential of AI in healthcare is huge. So we have seen that AI algorithms can analyze the medical scans with superhuman accuracy. So you are exhausted, but still you are learning, staying back here and learning something. We have certain limitations to our own cognition, to our own retention capacity, but machines do not have that. So you can use these kind of AI algorithms and analyze the medical scan with superhuman accuracy and detect the diseases early. We can personalize treatment with predictive analytics tailored to that particular patient's genetic history. And so that is called as precision medicine. So AI is there to personalize medicine. What kind of phenotype this patient is, what kind of obesity phenotype this patient is, what kind of diabetes phenotype this patient is. And depending on his own genetic history, his own clinical parameters, we can personalize the medicine and give him. It is there to enhance our workflow. So routine hospital operations, robotic process automation can, and especially with the help of natural language processing, can simply streamline the administrative tasks, frees up the clinician's time to focus more on the quality patient care. And it is there, AI-powered analytics can help us in population health also. As we have seen, we have experienced COVID portal, especially in COVID-19. It has helped Government of India with a huge amount of data to analyze, to propose, to integrate some kind of inventions that has really transformed the population health throughout India. So machine learning is there in a radiology breakthroughs. Natural language processing is there in clinical documentation, because we find it very difficult to write everything down. So we are having so much of tools now. We have just tell the tool, just transcribe it. It will write down everything, avoid all kind of jargon, and come up with some kind of amazing documentation, and it will be enhancing our own capacity of comprehensive record keeping. It improves the accuracy for documentation errors, inconsistencies, critical omissions, and increases the quality and completeness of the patient records. We can extract the data from unstructured notes using the natural language processing and to support the clinical decision making, and ultimately it frees up our own times to focus on quality care. So AI is there to help us in predictions. So pattern recognition, prediction of risk factors, outcomes. It is there to help us in diagnosis. And in COVID-19 also we have seen in therapy and selection and generation. So we are now have certain kind of systems which can identify the drugs which can be used for some other diseases. They are invented for some other diseases, but we are now repurposing those drugs for some other diseases, like baricitinib. We used it for simply using the AI generative predictive analytics and the data that we got from baricitinib, and we used it for different diseases. So gone are the days when new inventions, new treatment protocols used to take decades for a new invention and new therapy. Now within few years, not within few years, within 2-3 years itself, we will get a new drugs for a better quality of life of our patients. So administration, their AI is helping us, and digital epidemiology, national screening programs, everybody AI is there. So it increases our efficiency, it reduces our cost because it reduces the need for manual labor, improves the accuracy, and we can scale it, definitely scale it. So AI is there in every field now. So FDA has already approved more than 900 AI algorithms. And you name any specialty in medicine, especially in internal medicine, AI algorithm is there to help us to diagnose the patient better, to intervene early, and to improve the quality of life. So highest number of AI algorithms that has been approved by FDA are in the field of radiology, followed by the fields mentioned in this particular diagram. This is a busy slide, but just see how busy is the AI field growing up So you name any disease, AI algorithm is there to help us. AI algorithm is there to help us in cardiac arrhythmias, breast cancers, breast tumors, MRIs, CT scans, in hospital glucose patient monitoring, diagnosing ADHDs, mental health. So every specialty has immense potential to transform with the help of AI. So MedPalm LM is another tool developed by Google, which is excellent at mammography classification, dermatology classification, virtual question answering, medical question answering, and it has cleared the US MLE examination with a score of more than 93%. So AI is there for medical professionals and for patients too. It is there to help us with the clinical documentation, creating discharge summaries, generating clinical notes, insurance pre-authorization, summarizing research papers, radiology interpretations, suggesting treatment options. And for patients, it can help, again, with the analyzing laboratory results, disease prescriptions, interpreting physician notes, personalized health recommendations, symptom assessment, analyzing wearable data, and mental health, and so on and so on. So now let us come to simple tools which can help us in our day-to-day clinical settings. Isabel is one, which is a differential diagnosis companion. Just put the differentials what the patient presented with. You will get the first 3 differential diagnoses. And not only this Isabel will take you to that particular diagnosis in a simple page, and you will get entire details of that particular differential diagnosis. So you can combine your clinical acumen with these differential diagnoses and come up with an excellent diagnosis and intervene early to improve that quality of patient. Informatica is there. It is a so the patients who used it, 80% of the patients indicated that substantial overall satisfaction with the help of experience and the value delivered by Informatica. So it is a symptom assessment score. So it will definitely help patients as well as doctors. So this is another important where medical dictation has become very simple. So you just tell these tools like Suku AI, Mobis MD, and ChatGPT models also, some of them are coming. So you just transcribe whatever you are conversing with the patients. And now most of the AI tools, are even EHR systems are integrating these kind of systems where the conversation between the patient and doctor gets transcribed, and all the jargon is removed, and whatever the important medical history is taken into account, and that is stored, and for the future purposes also you can use it, and it is very effective in creating discharge summaries, documentation, and improving the quality of care. So mobile-based diagnostic tools are there, simply smartphones, we can use it with the help of peak vision. It is vision screening, skin vision, analyzes the skin lesion for malignancy, and ADA Health symptom checker offline modes are also available. So this is again a EP monitor cleared by FDA, which has capacity to, so it can diagnose the seizure before the onset of seizure. It can tell you that this patient is going to have seizure, and you can intervene early and offer a better seizure management and treatment for that patient, and this has been cleared by FDA. We know the Fitbit has come up with something wonderful. So this is a smartwatch which is there with a PPG algorithm, and that PPG algorithm helps this smartwatch to detect the atrial fibrillation, and once you detect the atrial fibrillation, you can start him on anticoagulation and prevent the strokes. So see the kind of quality of care and improvement we can imagine with the help of these tools. So this is another derma sensor, again FDA approved. Just we have to point and skin, just take the tool, point at the skin lesion, that itself will tell you the diagnosis whether this person is going to have some kind of a skin malignancy or not. So again, very helpful and cleared by FDA. So this is again invention by our own Indians, and amazingly transforming the care of respiratory diseases in India and in Africa also. So Cure AI, you just upload the X-rays and other radiographic images, and most of the times in our busy practice we tend to miss small pneumothorax, consolidation, pulmonary nodules, rib fractures, but it has a sensitivity of 100% with a specificity of 96%, and 96% accuracy. It will tell you whether it is going to be a TB, pneumothorax, pulmonary nodule, and it will definitely help us to improve the quality of care. IBM Watson is there especially for the genomics, and it is there to identify the genetic mutations associated with the cancers, and it recommends the targeted therapies for specific mutations. So as I said earlier, because we are literally living in personalized drug discovery. So Benevolent AI is another tool which uses the machine learning to identify the drug candidates by analyzing the biomedical data. And we used baricitinib for COVID-19 treatment just by analyzing the molecular pathways. And it definitely helps us to improve the quality. So AlphaMind, again discovered by Google, so it's introducing DeepMind. So it predicts the protein structures with high accuracy, and this AI predicted protein structures enable researchers to identify how genetic variations affect the disease risk. So AlphaFold is there to help us in identifying the protein structures and come up with great tools. These are the things, just take a click and you can use it. Clinical decision support systems like Keragon, CBD models are there. LLM assistants like PathTrial and Kenya is there. Imaging AI as Cure AI is there, and various things that are helping us to improve the quality. Again, with the help of wearables, we are easily and better in a stage of remote monitoring the patients. With the help of all smart watches and smart rings, and integrating with EHR and other tools, we can definitely improve the quality of remote monitoring that we can have. These are some of the papers that I presented using AI in my own practice at Umarga, where this is a paper using ChatGPT to dispel the diabetes myths to improve the quality of adherence, and this is again a real world evidence which has been presented and published in ATTD Asia Singapore last year. This is another study where we used the digital well-being features which are there in everybody's mobile phone to reduce the sedentary behavior in type 2 diabetes, and definitely it worked. So those who use this tool to improve the physical activity and reduce the sedentary behavior definitely improve the physical activity behavior. These are some of the things that Mitra and other tools that we presented at ADA also. So we have come up with some kind of chatbots for diabetes who can tell you how to manage their day-to-day behaviors, what kind of food, what kind of exercise, what kind of stress and sleep adjustments they have to do in their own practice. So these are again fantastic tools. Eva is there to help in women's infertility. So the Sunu band is there to just, those who are blind and visually impaired, it improves the quality of life that those patients are having. AI wearables for blinds are there. So these are the specs where the camera is there on the right side of their lens. It clicks the photographs, tells the patient what is in front of that blind person, and it records the memories also. So next time, whenever such kind of things comes in front of him. So just imagine the quality of things that our visually impaired or deaf, blind people are going to have in next few years. So what are the implications for physicians? We cannot escape the field now. So if we are going to ignore artificial intelligence, so we will be out of track. So we will be out of practice. So AI won't replace physicians, but it will definitely enhance their skills, empower them to provide more efficient and personalized care. So it is there to streamline our administrative tasks, enhance the diagnostics and treatment planning, and improve patient communication and engagement. So what are the strategies, how to thrive in the age of AI? So embrace the continuous learning as you have done today. So today you are just explored one of the fantastic and exciting opportunity that we have today with the help of AI. So do this kind of a continuous learning, embrace this technology, develop AI literacy, collaborate with the AI experts, and champion ethical AI. We don't want unethical something in our own practice, because we want to practice ethically, and AI should be ethical, and we are there to help the government policies to develop such kind of policies to practice the ethical AI. So future of medicine is not just technology, not just physicians. So it's a partnership between the AI and human partnership for better patient care. So personalized medicine, enhanced diagnostics for remote patient monitoring, newer therapies, improved access to the healthcare. So my dear friends, so AI is poised to disrupt medicine now. It is disrupting medicine significantly, offering both opportunities and challenges for physicians. AI is revolutionizing the healthcare industry and empowering doctors and improving patient outcomes through advanced algorithms in diagnostics, treatment, and population health. By understanding these dynamics, physicians can better navigate the integration of AI into their practice, ensuring that they enhance the patient care while maintaining their essential role in healthcare system. So start with one area, start using whatever we have learned today, Notebook LM, ChatGPT, Gemini, start using it, play with it. You will gain more and more knowledge, and it will definitely improve. Train our staff to use that kind of tools offline also, and ensure that you are collecting good number of patients' data. So AI tools can augment the clinical practice in low resource settings. They are accessible, affordable, impactful options are available, and start small, think big, and scale sustainably. Ultimately, what Adya Shankaracharya told in Nirvanashtak, Aham nirvikalpo nirakara rupo vibhurvyapya sarvetra sarvendriyanam sadame samastvam namuktirana bandha chidananda rupa shivoham. To attain that highest level of ananda in our own practice, we have to embrace this artificial intelligence technology to improve our own quality of life and quality of care that we deliver to our patients. Thank you for patient listening.
Thank you so much, Dr. Aniket. And there's a strong connection between artificial intelligence and spirituality too, which Dr. Aniket and his team is researching on, and we are very sure that we'll have some scientific activities from there as well. So we understand that AI has the potential, and he mentioned about many such use cases which are not expensive. Largely, we see the application of AI tools in public health and screening, especially in resource-limited settings. But in a diverse clinical practice, in a busy clinician OPD, there are several tools which a doctor can adopt, and they can make their task and life easy and reduce that burnout that we all face at the end of the day. To move on to the next speaker, I would like to invite Dr. Rajesh Deshmani from Solapur. Again, a dynamic clinician, an administrator, and also an individual who's been working in the frontier of healthcare and non-communicable disease. Would love to hear his viewpoints on the applications of AI in diabetes and metabolic disease.
Okay. So, thank you, Amit. Thank you, Dr. Kulkarni sir. Thank you, Dr. Parade sir. So, right now, Aniket already discussed what is the best thing we can have in day-to-day clinical practice while managing patients. So my job is little bit simple. I am practicing as a diabetologist, and what tools I am using and you can also use in day-to-day practice that and we are right now we are using AI in day-to-day practice. So it is also already helping us because we do use lot of things currently, and AI is no longer is experimental, but it can definitely enter in your clinic. So today you have learned very interesting things, and that will help you a lot. So diabetes is growing like anything, and we are seeing nearly doubling of the disease in next 20 years. Important thing is, along with diabetes, like NCD, the obesity portion, that is also increasing. And this creates a major need for smarter care in day-to-day clinical practice and a scalable solution, because as a doctor, previously we used to see 30-40 patients of diabetes, but right now the number is increasing. So we need a scalable option to treat such disease. And that's why, and it is very important, a single CGM data, in single day we have almost 288 readings of CGM. If patient is wearing some wearable devices like like electronic wearables, like sleep trackers and watch, so then there will be a multiple data, and it is very difficult to do a manual job of interpreting everything. So AI definitely can help us to interpret this data and convert into clinically insightful things, so that we can analyze and we can clearly discuss something with our patients. So the AI mainly works to this machine learning we have already discussed, deep learning and predictive analysis. Machine learning actually identifies the hidden patterns, while deep learning analyzes images like retina scan. Daily we are doing a lot of fundus photography, retina scan, and predictive analysis actually forecast future risk. So this all allows us to shift from a reactive approach to a proactive approach in diabetes care. So we can understand AI in diabetes in 4 pillars. Like first is perception. Perception means AI sense complications. AI can see complications. Second is prediction. AI forecasts the risk of complication. Third important thing is control. It automates, control means like we have automated insulin delivery system, like newer insulin pump. So it can do that. And second is, last is generative AI, which can help us for managing things, as well as it can also help patient to educate for education of patient also. So this is just the same slide what Dr. Aniket discussed previously. So AI, right now currently we are using AI in diagnosis of diabetes. AI can clearly identify high-risk patient, those who are very prone for development of diabetes. We are using like various scales or like Indian Diabetic Risk Score to predict diabetes, but definitely AI can be much more helpful, like it combine obesity pattern, it can combine glucose trend, family history, as well as biomarker for diabetes. AI-based retinal images can clearly detect diabetic retinopathy earlier as compared to routine or what an ophthalmologist can do. So this is available right now. So this is one of the most practical uses of AI, that is treatment observation. So best treatment what you can offer to your patient based on the phenotype, comorbid condition, prior response to various treatment, whether the patient is suitable for any GLP based therapy, SGLT2 based therapy. So all this you can reduce error, and the treatment can be personalized if you use AI in day-to-day practice. Then digitalized tool brings continuous monitoring as well as personalized intervention. Patient remain connected between visits, and those patients who are using digital tools like CGM as well as some apps, the HbA1c can be reduced by almost 1.3%. So it's as good as adding 1 or 2 anti-diabetic medications. So that can be very much helpful. So the major technology currently what we are using is CGM, insulin pump, the newer insulin pump which are automated. Then also these are current what we are using day to day our practice. So same thing. This closed loop system, what I am talking about, 780G, actually this is one of the latest pump which actually predict hypoglycemia, predict hyperglycemia, and automatically delivers insulin. It changes its rates, so it can adjust insulin. So time in range is improved significantly in those patients who are using this automated insulin pump system. Similarly, this is a diabetic retinopathy evaluation scan, that is IDXDR or IRT, which is approved by FDA, US FDA. They allow automatic screening of diabetic retinopathy without an ophthalmologist. So this can be a big game changer, particularly in remote spaces, or otherwise we are, as a physicians, we also can have a retina scan, and if needed, if the retinopathy is patient, then we can immediately refer or send the patient to ophthalmologist. That can be very much possible. Second important thing is chronic kidney disease. This is a very important aspect. So actually we are now, right now, it is very important to monitor that flow diagram as per guidelines, KDIGO guidelines, but we are not doing. So it is very simple. We can give a command. You can have that application in your PC, and you can immediately screen out whether the patient is at what stage of chronic kidney disease, so as to start any SGLT2 inhibitor, any finerenone-like thing, or a good glycemic control, good hypertension control. So then diabetic foot is another thing where AI also help us. AI can detect early ulcers through photos, thermal images, and also gait analysis, even before onset of ulceration. So this is another very important area where AI can be used. Another thing, ECG analysis. So analysis of ECG, lipid parameters for prediction of high cardiovascular risk factors, so cardiovascular disease in day-to-day diabetic management can be very much possible with the help of AI. Then some platforms like OneDrop or Gluco, which integrates multiple data streams to provide actionable as well as recommendation, which are essential in diabetes coaches. These are the healthy coaches, and that can track diet, exercise, medication, as well as blood glucose values monitoring. So all this can be tracked. And digital therapeutics are also evidence-based intervention that uses technology plus coaching, and they don't replace treatment, but definitely they help in improving the HbA1c of your patient and improving engagement of patient, because that is also very important. Patient education also very important, and it is one of the very important pillar of managing diabetes, and AI can personalize education based on the literacy. Right now we have seen that Marathi video we can based on patient's need. So that can be very much possible as per language, patient behavior, as well as literacy. This is a study which shows significant A1C improvement, nearly 2% in a patient with poor baseline control when they use very much adherence to treatment program on based. So, and AI also allows us to identify the high-risk individual before they develop diabetes. So, and in next 4 or 5 years, AI will integrate genetics, wearable clinical data, as well as lifestyle factor in one ecosystem, and digital twins may help stimulate treatment outcome before we actually prescribe any medications. So, and AI is cost effective because by early diagnosis, early management, intensive management, we can prevent hospitalization, we can prevent complication, and there will be a better outcome, and definitely there will be a lower infrastructure or healthcare cost in such things. So the future is not about replacing doctor, because we always think that AI will replace us, but not. It is about empowering us. So AI can reduce the burden of routine analysis, so we can focus on clinical judgment and human care. That is very important. So what we can implement today? A retina test, a CGM, automated insulin delivery, insulin pump, kidney risk stratification, then diabetic foot analysis. So these are the current things we can right now implement in your day-to-day practice for managing diabetic patients. So AI will not replace physician, but physicians who use AI will transform diabetes cares. So thank you.
Thank you again so much, Dr. Rajesh, for giving a structured overview of the current landscape. So I think without wasting much time, let's head on to the panel discussion where we will take up similar questions, and I will first invite Dr. Mayura to come up on the stage as the moderator. And I would also request as panelist Dr. Prasad to join us. Dr. Aslesha, if you would also join us for the panelist, please. And Dr. Azhar is also there. Would you please join us here as a panel?
So, good evening, everyone. We will be starting with the panel discussion, and we expect it to be an interactive discussion. So I may have some 4 or 5 slides of introduction, but followed by that I'll be asking questions. After that, we want each and every one of you to ask questions and get your doubts clarified. This is the main motive of this session. So I will be finishing within the next 30 minutes rather than 1 hour, and maybe after that we will be having questions from you all, because it is very important that you all get clear idea of what we learned today and how each one of us is going to apply it in your practice. So my calling may be different than yours, your need may be different than mine, and how actually we can utilize these sessions in our practice, in our research, in our presentations, whatever we want to do. So why are we suddenly talking so much about AI? Yes, I know there are smarter tools to which we are attracted, certainly. There is workflow pressure, as Dr. Rajesh, my friend, has. There is clinical adaptation, not only research papers, but into EHR, documentation, and all these things. So that is why we are talking so much about AI. So anyway, what is AI actually? AI can be traditional clinical AI we are using in clinic for risk stratification, classification of images, and patterns of data, kind of sepsis alert you can say. But there can be generative AI also, which is more interesting now. For example, we can draft discharge summaries, inbox support, ambient scribes. So this works with language and conversation and not only science. So this is what we can call AI in plain language, where AI will help us internal medicine specialists. So maybe before the patient comes, we'll do the risk stratification, medicine, what we are giving. During visit, what we have seen, what is the differential diagnosis, what is the trend happening in that particular patient. And after the visit, maybe follow-up visit, what will be the follow-up plan, investigations, discharge summaries that can be thought of. So examples where we can, like diagnostic support, clinical risk prediction, communication task, and conversation into a draft note with summarization of prior records. This can be done. You all must have understood a little bit by today's lectures what AI is good at and what it is not. So it is good at all the fast summarization, repetitive administrative tasks, and handling of structured workflows, but it's not good at understanding a context like clinician. And as everyone is saying, here we are very, very important and no one can replace us. AI is there to support us, but we are the main person, we are the main individual who will be able to understand the context like a clinician with empathy. That is very important. We will be also able to handle ambiguity, values, bedside nuances, accountability, judgment, and guaranteeing correctness without verification. So we see the patient, we understand the patient. We even if AI tells us or doesn't tell us, we know what we have to do and what is correct in that particular situation for that patient. And here AI will never be able to replace, but certainly it will be able to guide us in that situation. So what are the potential gain? That is, there is less documentation time. Almost 66% physicians AI are using, and there are thousands of AI or machine learning devices which are authorized, and they are a part of clinical technical ecosystem. yes, the concerns are there. Why are we cautious? Because there are clinical risk and system risk. Clinical risk, I think everyone must have understood by now, that is the hallucinations, bias, and the system risk are confidentiality, privacy, poor local validation, and unclear accountability. Simple loop rule, we know that human should be in the loop. So what should every doctor ask before trusting an AI tool? So this we will discuss obviously, but it will come to everyone's mind की मी काय करायला पाहिजे आता, मी काय हे वापरताना मी काय करायला पाहिजे आणि कसं मी ट्रस्ट करायला पाहिजे. So the question is not whether AI will enter the internal medicine, it has already entered, but the real question is how to use it in a way that is useful, safe, ethical, and clinician led. And I think we all are here to learn that only. So let us begin the conversation. My first question is to Dr. Amit. That is, when you hear the term artificial intelligence in medicine, what comes to your mind and what do you think it can do and it cannot do today?
So I think I'll take the last part first. What it cannot do, there's nothing that AI cannot do at the moment, the way we're heading, right? So we are literally heading into the era where we will be having agents and agentic AI in an overlayer of artificial general intelligence with a lot of autonomous functioning architectures, performing complex tasks and multitask on multimodal data at the same time. The question is how much we want it to do and what tangible outcome in terms of clinical benefits in a patient it can really bring. So that is the way we have to look from the lens of a clinician. So whether it is an agent, whether it is a language model, whether it is a simple algorithm which is inbuilt in a tool giving a predictive analytics, we have to look at that tool from the skepticism of is it really bringing a clinical improvement in our patient. If yes, then it's effective. If not, then it's not fitting the right need gap.
Okay, yeah, thank you.
So one more thing, I think we can use AI tools more in preventive and predictive patient follow-up and follow-up also, but not for emergencies, ICUs, where the patient dynamics are changing frequently. You should not go for AI at all. It should be human intuition, your experience. Of course, follow-up, prevention, prediction, these tools will come into the picture for sure.
Yes, that's true. Maybe we will have a question on this from Dr. Rajan will answer about this. So I'm so sorry for this. Yeah, I will read out. So my second question is Dr. Ashlesha. In your daily internal medicine practice, what are the one or two pain points like documentation, triage, follow-up, diagnostics, where you want most help from AI?
Thank you, madam. Thank you so much. Let me just first come to the question and then, I'll elaborate. So one is internal medicine and just exactly like Dr. Azhar just mentioned that you want to first use this for low risk, tasks. So first pain point for any doctor, and we hate it, and we are, we are famously not liked for this, is writing and more of scribbling, right? So we do not like documentation, and in our private clinics as well as in our hospitals or even in academic settings, we are forced to kind of go through a lot of documentation. And when we were asked to adopt digitalization, the first thing that came into our offices was a computer screen, which we hate, because exactly what I did right now, just before the question, is that screen, I don't want a screen in front of me when I'm connecting with my patient or my audience. My patient is my audience. My patient needs to get connected with me through eyes, not through screen or camera. That is how the telemedicine has also never picked up. During COVID, very transiently people did that, but given a chance, patient wants to sit in front of me and wants to talk to me. They don't want to talk to a screen, or they don't want to see a doctor who's looking at screen. That is one pain point which we see every day. And how really speaking, we're talking of digitalization and AI, and without screen, really, we have gone past are the days where AI or technology means me typing every word. We are much ahead of it, which is where AI in healthcare comes in, where you have voice to discrete data, you have softwares which are ambient, which are sitting with you and your patient, provided there is, there is privacy protected, there is safety in it. Of course, that's a completely different realm. We will not, right now you're asking me about the pain points. That is one thing where I don't want to do my, I don't want to keep doing the documentation. The other thing is, insurance. Insurance is another thing which is a lot of paperwork which a doctor need not do on a daily basis, but then we have to, because khayenge kya? Bread and butter is that. So we have to really answer those queries in our private clinics and things like that, but that need not be my primary focus. So that's another thing. And of course, we are sitting in India where numbers are everything, volume. We cannot do away with the volume. That is where, again, I cannot give a lot of time per patient. Per patient time of a doctor is very limited. Even in private setting, each one of us would really agree that we are not able to give as much time as we really want to give to an elderly patient who has multiple queries or has no query but just has come to see me just because he wants and he feels good when he visits my clinic. So that is where are the pain points. Yeah. I also come from public health. So again, the volume part. That is where the screening becomes very, very crucial, and that is where, again, AI can help me. Right? Okay, thank you. I stop there.
Yes, thank you so much.
I'll just continue with in the context.
Sir, you have a question, another question for you, and we will need time for that.
But I will add to this.
Okay.
The CT all prescriptions copy paste is one of the best thing. And the second point where it will help me maximum is calculating the risk scores. ASCVD, I am not worried about ASCVD. In Maharashtra, the biggest problem is the chronic liver disorders. In the chronic liver disorders, the drugs behave in a haywire way, and the output means sometimes you have to tell that your MELD score is so and so. कोण ट्रान्सप्लांटवाला मिळते का आजूबाजूला जरा बघून ठेवा आत्ता पहिल्यापासून. Sometimes you can predict the person's deterioration over the time, and please use one very simple calculator which is available on Medscape, or calculate by QX. Calculate by QX. It will be helpful for your assessment of renal function also. Kidney and livers don't cry till they fail. Please, even frac score for the bones also. Thank you.
Yes, sir. So my next question is to Dr. Rajans. Sir, can you share a practical scenario in internal medicine, something like sepsis alert or AKI prediction, where an AI-based tool might be realistically changing your decision-making or workflow?
Thank you for that question. Actually, there are multiple tools which are available in the market, like internationally particularly. But I am from critical care medicine with a 110 bed ICU.
Sorry to interrupt, but as your principal, only one proper answer.
Yeah.
So the one you did in your workshop, that you just gave one workflow. So similarly, a very good workflow which you are using and which will be beneficial to all over here.
No, what I'm trying to say is that AKI prediction model, sepsis prediction model, these are all available, but they are yet to be validated in the Indian ICUs. So, or for example, there are multiple data points where we need to integrate all the data together, or something like a glucose monitoring tool with an automated, syringe pump setting, or EMS, this emergency medicine, a triage tool. Now, recently we are just recently into the AI, and recently we were thinking that the dietitians prescribe something in our ICU, and nobody really knows what has been prescribed. So what are the caloric input and how they have calculated the fat, carbohydrate and proteins. So we thought, why not make an AI tool where everybody understands what's happening with the diet, and also the caloric value of each of the foods which is available in India, and kind of advise the patient properly. So there are multiple tools which I'll be using, but as of now, I think I'll have to validate a couple of tools before I can start using bedside.
Yeah, maybe one, can you tool?
There are two companies which are working on this.
Sorry.
One is a Bangalore-based cloud physician. They installed a lot of cameras in the ICU, and they try to predict based on the behavior, the ventilatory movements, the parameters and all that. Based on that, they start predicting. They are basically doing a cloud telephony kind of a thing. They alert the intensivist who is there on the ground that this patient is going to deteriorate in the next few hours. They also monitor the whole ECG, the ventilator parameters, the ABG parameters, and they start giving red flags. This company works only in ICU. It's called Cloud Physician. There is another company I had met, I think it's from Gujarat. They are working only on neonatal ICU. And that's a very, very good company. They handle many patients, even in peripheral areas. I think it's from Rajasthan. So they are having good predictive model how the infant is behaving in neonatal ICU.
Okay,
I forgot the company name. But these are very good companies, well technologically enabled.
Okay, so and they will be like on yearly maintenance basis, charges and all. I mean,
yeah, subscription basis. They are live 24/7. Their doctors are monitoring the monitor in their home, not at the premises, and they give red alerts as soon as possible.
Okay, sir.
Right now, we are actually working with 3 models, AI models, and trying to validate them. So once the validation is done, I'm sure we will be able to put them in the ICU or the hospital setting.
Yeah, maybe Dr. Amit will invite you in the next session for that. So I want to ask Kulkarni sir. So we are already seeing AI is showing up in our work everywhere, like ECG interpretation or radiology reports, EMR suggestions, even if it is not explicitly labeled as AI. So I want to know in 1 or 2 minutes exactly how it is being seen, even if I am not able to see in my practice, but it is being used there. So which are these areas?
The reflection of use of AI is in my prescription and in the way in which I see the patients. Even at the end of my prescription, I always mention the red flag signs. Those red flag signs are automatically put into the software. And one more very common cause of death is drug interactions. So I always check drug interactions and I mention it that a combination of azithromycin, domperidone, derifalin and beta blocker can kill you. Avoid combination of drugs which increase the QT interval, and sometimes you have to write down the note, the drugs below that, and the person looking at your prescription itself comes to know that you are really using the proper AI tools. And if I calculate the risk scores also, in that risk scores I like it, that is MELD2 or whatever the kidney function test, the way in which analyze. And it is the reflection of your personality too.
So you mean you are suggesting us to use AI tools to see the drug interactions mainly, besides what we have been seeing? Yes, sir, you want to.
There is another company from Bangalore. It's called Tricog. They're already using AI to diagnose normal ECGs, and they put a red seal on that it is totally AI generated. No doctor has seen it. And they're releasing the reports.
Yeah, but so what is there any human in loop in that situation?
See,
and what are
ECG, they are not using human in loop, but some ECG they are also telling that it is AI assisted ECG with the doctor in the loop. But Tricog has got millions of ECG with them, so they are doing a lot of pre-training and training the models.
And what about their specificity, the sensitivity?
They say it's almost 98%, and they'll give with a red seal that it is AI generated.
Okay. So another question is for you only, sir. So how should AI generated risk scores or diagnostic suggestions be presented so that you actually find them usable at the bedside? So we keep on discussing lot many tools, lot many things, but actually use it at bedside.
I feel if you can install AI tools at the back end in the pathological laboratory, histopathology, radiology, it will do wonderful work. Because as Dr. Ashley was telling, once we face the patient, we should have the CDSS ready, that clinical decision support system should be ready, which can be done with all our blood reports. It should summarize the blood reports. It should multimodal basically. It should see the patient ECG, X-ray, ultrasound. It should give us a prompt or a simple line that this patient is having some dengue or could be having pneumonia. So there it is definitely useful. You can start using from today itself. It's called simple clinical decision support system. But once we see that on our screen, then we know what we are going to talk to the patient. So backend, please start using AI. Your pathology, laboratory, radiology, you should start using it.
Yeah, you mean to say we have to integrate that with EMR?
Yes, yes.
And so that as soon as my patient's data comes, my OPD patient's data comes, so that data comes with everything around. Like,
let me make this a little bit more clarity based to the audience for everybody's understanding. So we are looking at artificial intelligence as tools which is going to automate tasks, which is going to pick up a pattern and give you a prediction, right? That's a simplistic way of understanding. There's going to be two categories in which you will see application. One is non-clinical, which is most likely going to be doing all the logistic and the administrative tasks. From one point of view, non-clinical AI tools are a low-risk tools because they're not involved directly in clinical decision making. They do not necessarily need validation and clinical evaluation. They just need an internal testing, a workflow understanding, and a scalability to be deployed to the market. The other end, you have the clinical support tool, which he was talking about. Any tool which is using an intelligence, whether it's an automated intelligence or a pattern recognition intelligence, which is impacting the clinician decision making capability, which means you look at that on your screen, whether it is in the EMR or outside the EMR, doesn't matter, and your approaching towards a patient's management changes. That's a CDSS or a clinician decision support system. That, number one, has to be clinically validated. One. Second, they need to talk to the systems with each other. So that's where the question of interoperability comes. Which madam wants to know is that I have a CDSS, but if it's not connected with my EMR, it's not going to give me a recommendation from my patient's data set. So that's where the interoperability comes in. So I just wanted to clarify the entire spectrum to everyone.
yes, thank you so much. So my next question is to Dr. Rajan sir. So in your view, what would be convincing evidence that the AI tool is really improving patient outcomes? So maybe Dr. Ashlesha, would you like to answer? Yeah.
There is no my view or somebody's personal view. This needs to be actually validated with hardcore research. Nowadays, we see startups coming up day in, day out, and they are coming to our doorsteps now, as in our clinic's doorsteps, with various claims. There is no shortcut for this. If it is useful for my patients, is to be decided by me and not any numbers. You have to have a hardcore research gone into it. Unfortunately, right now, when we are looking at this new age or new kind of research, we're taking two extreme approaches. One is completely averse of these newer tools to use our data. So they're coming to, so a startup coming to my clinic and saying that this is the service that I'll be providing, this is good for you, and in return I'll get your data, etc. So so there are two ways to look at it is, I cannot really give my data is my everything, and I'm sitting on my data of ages together, doing nothing with it. That's one approach, and then the other one would be highly commercial. So, that other approach. So we need to really identify the middle ground here, where you need a hardcore, proper research. It could be a clinical trial as well, but a proper clinical trial. It is not in somebody's view whether it is going to help my patient. It has to be really tested, validated, and what we as clinicians or as physicians, healthcare professionals need to really be aware of is what questions we need to really ask. Only then can I say whether this particular solution, whether this particular tool is useful for my patients, if the really patient outcome is going to improve or no. Having said that, it has to be really friendly from the startup point of view as well. You can't simply write them off. We have to start somewhere. Then we start slow. We start in a test environment, we start in a pilot environment rather than straight away going into, and with proper proper licensing and proper ethical clearances. So I think that is how we go forward with taking or accepting these kind of solutions in our practice, one step at a time, and then only we will be really able to tell and then utilize them. Like sir mentioned, right now we are in the validating process and validation process. Once that validation is done in our patient or in our population, then that can be safely used. But at the same time, the regulatory framework has to be adhered with.
Yeah.
Just a follow-up observation. I mean, now after I got into the field of AI, a bit of learning, of course everybody is learning. So a lot of you have a AI washing machine, AI refrigerator, AI whatnot. So everybody will add the term AI to every possible thing. Similarly, we have got so many vendors who come across to us as if they have got a one-stop solution for everything. So that we have to be very careful that usually even to work on one system, like a pulmonology, chest x-rays for example, it takes a huge amount of time before you can actually validate. So if somebody comes to you that I have got a solution for this, then you should be really skeptical about it. So I mean, a lot of vendors will come to you, and that's what is happening with me also. So I am also learning that who is really talking sense to me, and unless you learn AI, you will not be able to make out who is right and who is wrong.
Yeah, okay. Thank you, sir.
AI tools can also be used in administration. So that will help a patient getting discharged early. They should get proper communication, and the information should go like interoperability for the insurance desk. And suppose there are a lot of institutions which handle hundreds of OPDs per day. So there the triage can be done with AI tools. He comes with the chest pain, immediately he has to be sent to the cardiology department. Other patient and queue management can be definitely done with AI in administration.
Yeah, okay.
Yeah, just one thing that I would like to bring to notice, when any vendor is really saying that, we're providing this service free or this tool free, when anything is free, you are the product. So please remember this. Please remember this, and we don't have to be scared, we don't have to shy away also, but we have to be well informed of all of these aspects. So that way we will really, be able to answer whether it is really helping our patients and improving the patient outcome.
Yeah, thank you. So since we have only 2 minutes left, I'm merging questions for Dr. Amit. So regarding safety bias and the ethics and regulation, so maybe there are many questions, so I will just tell them. So what are the worries the AI system would cause misdiagnosis, and how would you handle that those worries, misdiagnosis, overdiagnosis, false alarms or performance because they have been trained somewhere else and that's not performing well in our population, and maybe who should be accountable for the decision. So all these things together, please answer. I'm so sorry for that a big question, but still.
All right, so who is responsible when an AI goes wrong? That's a very common question, right, that is asked. So it is the driver who is driving the car who has obviously got the vicarious liability to everything that's happening. But it's not always as simple as that is. So you are responsible. Even if you don't understand what's happening in the model, you're still responsible because you have used that model. But of course there is a liability of the developer, there's a liability of the people who have done the research as well. But that's still the law of the land that is still taking into shape. These questions are still in the gray zone because no matter how big we talk, we're still not using AI to make clinical decisions yet. But we know that there is a potential where an AI can fit in to the clinical decision support system and help us take a smarter clinical decision. Now, the thing is, all of us sitting in this room need to understand this, that no technology is born smart. No AI tool is going to be giving you great responses right on day one. But the important thing that we all must ask is the right questions at the right time. So first is, for any tool, if it is impacting a clinical decision, a prediction, look for the validation, ask for the studies, ask for the publication, ask for the label. See, just like in every pharmaceutical drug has a label, right? You read the pharmaceutical drug, you read the label, you read the trials, and then you use it in your patients. Tomorrow, every AI tool will have to have a label which speaks which model is being used, how it has been trained, what data set has been used in training it. We spoke about model shift and model drift a little bit today in the discussions. That is prevalent, that will always be prevalent. That doesn't mean that the tool is wrong or the model is performing badly. It's a part of the journey. But we have to make sure that the proper research has been in place and then contribute to the clinical validation of it. Now the point here is very important, that in the developmental cycle of any AI tool, if a clinician or a cohort of clinician gets involved early, the success of that entire tool is much higher. So be a part of that ecosystem where you can not only contribute to the validation of it, maybe even co-develop it. So you ask the right questions, you ask the right point, and you make sure that you understand the model and the technology that is there, which is going to make you take a clinical decision when it is going to come. But before we do all that, let's come down to the ground zero, okay? And I have a question to the audience on this. Yes. How many of us sitting in this room is using a digitalized prescription? Can I have a big raise of hands? The rest of us who are not using need to get digitalized. We need to get digitized, we need to get digitalized, and then we will make patterns and predictions, and then artificial intelligence will come. So let's get started with it.
Yes, thank you so much. Are there any questions from the audience? Please do ask, because that will maybe decide what has really... Yes, please.
Can we have a microphone?
Mic done. Sarana mic done.
It's a new technology. Is it approved by our government of India? Because we see a lot of things are getting held up. Once we start using this new technology, there should not be any problem from government side. So this is number one. Question number two, all these studies which we have discussed since morning, are they standard to our Indian constitution, Indian this one human being, or this is all over the world? If it is so, then we have to form our own standard. Okay. So I want these two.
Yes.
Thank you, sir. So I am also working, not really working, but closely associated with government, some of the government organizations which are looking into and really creating guardrails. And during the workshop, I did take that liberty. It was not directly linked to it, but I did talk about Ayushman Bharat Digital Mission, which is actually the skeleton or the backbone of digital healthcare system in Government of India. We have India AI guidelines right now, and the thing that we have been talking since morning, DPDP, Digital Personal Data Protection Act 2023, which is still again going back and forth. Some of things are in discussion and things, but then it actually is giving us the framework for these AI related tools, AI related, so and again software as medical device. So there are certain guidelines and around that. So it is existing. However, your question is very, very important, and it is not answered completely, because in healthcare or in medical, we still have a little bit of gray area on which agency or organizations like ICMR's National Institute for Digital Health Research are working right now to create very strong or very clear guidelines, very clear workflows for healthcare professionals to utilize at the user end or at their end to incorporate AI in their day-to-day practice and academia. That process is still ongoing. We have certain regulations in place, like I said, India AI regulations are there, BIS is there. So yes, you're right in raising that question, but also we are working towards it. Everybody saw the India AI Impact Summit, where who's who of AI across the globe had visited, came down to India. That's one way that the government is actually showing or showcasing that it is invested in bringing AI in the mainstream, rather than any AI company or any data company going from the back doors and reaching out for data or whatever information, making India just a test bed or whatever. It is actually bringing it center stage so that learned or people who are actually going to use AI should use this ethically, responsibly, and under the guardrails, national guardrails. So yes, some of it is already formed, some is right now in process. The process is ongoing. Yes, thank you, sir, for that.
Yes, thank you. Are there any more questions?
Hello, just one comment again.
Yes, sir.
Actually, during my discussion, I forgot to mention about one tool we are using in our hospital that is designed by our clinical pharmacist. Unfortunately, I could not recollect that while speaking. The clinical pharmacist is known as a PharmD, who is a 6-year training in pharmacology. And they have designed a tool which calculates the drug interactions, dilutions, then how much drug to be given, and also modifying the drug dose as per the nephropathy, the liver problem, kidney problem. So like that, the tool is really working well. Particularly the nurses will not know the dilution, which drug to be diluted, in which solution, whether it's 5% dextrose or normal saline. So that tool is really working well, and it is being monitored by the human in loop by the clinical pharmacist.
Yes, thank you so much, sir. Thank you all the panelists for telling us repeatedly and so nicely that we need to develop an AI ecosystem, validate it, and certainly use it in our population and use it very confidently afterwards. Thank you very much.
This is a very important announcement because we are all having at the moment technology burnout. A lot of tech since morning. So to remove all the fogs from the brain, tomorrow 6:30 a.m. we are supposed to be meeting Dr. Gurunath and the team poolside for International Yoga Day and to de-stress ourselves. So that's very important. So we must be there. I believe we need to felicitate the speakers and the faculty. If you could join me here, and also Dr. Aniket. And I think they have something. No?
Audience, it has been a very long and tiring session. We are very grateful to all of you to bear with all the sessions. It was a wonderful session. Please continue the applause. It has been a very hard work by all the panelists. A big round of applause, please, guys. Thank you so much, all the faculty. It was a wonderful session, and with that, we come to the conclusion of this session. It was a long day. This will be followed by the Dean's Council Advisory Member Meeting, which is being held in the Business Center. Those who are members can proceed there. Our dinner will be starting at 8:30 p.m. in the lawn. Also, those who are interested for the registration for the yoga workshop, they can do their registration at the Sun Pharma stall. It is there outside. Tomorrow we will be starting sharp at 9 a.m. in the morning. Thank you so much.